in each one, and others will say, no, I don't have that. What I need is public, a private sector. In some places, we'll define the human resources. So we would need to write what we need in the analysis of the information. If we have that information, what type of information do we need? We need methodologies, and for equipment, what type of teams do we have in the ministry, or do we have to strengthen it? And that information use for a dialogue with the Ministry of Economy or Finances, so you can say, no, we want to do this analysis, but we would like the a constant dialogue with the Ministry of Finances to improve dialogue. For those who already have the dialogue, there's things that can be improved, because the dialogue we only have in methodological things, but we need them in other, in human resources, for example. And so we need budget for training. So we're going to do this exercise for each of the topics. There are 5 topics. Diana will be leading this, and this with this person that you have worked with. We'll have this matrix as called the red light, the traffic light, and with the topics that are the challenges, to remember which were are the challenges and which people. So let's start. Each country with the 5 topics, like the five or 10 minutes with the system data information. So it's the idea is to write down the challenges of that we already have. They may be the same, they can match, but they can be different also. We also propose, and we have worked on this, some actions that will help us to develop the policies. These actions can also match, and it could be the next step, but also they can also be completely different. The idea is for you to write them down in your charts. We have more paper, so if you want to use one big piece of paper for each topic, so we'll work individually, each country, like 8 to 10 minutes. So we'll leave the actions there for you to see. Let's start to work with each team.
Yeah, the action. So we are doing the action. So what you can do then is we can go around and you go with the microphone, and if you listen to the discussions and you can participate and everything, right? So and you can put the microphone and the person will translate. So you could go, or you could go to whatever you want. Use the microphone from the start, and I'm going to introduce the people that you're doing this. Where do you want to go? Maybe I don't know. Each one is very very interesting itself. So if you want to have this, Argentina, Paraguay. You decide.
¿Tenemos que hacer este cuadro ahí?
Él.
Este cuadro tenemos que
No,
hacerlo
no,
ahí.
no. Y empiezas con sistemas de información y dices cuáles acciones de sistemas de información te sirven. Perfecto.
Okay, even better, even better.
Sí,
Okay.
súper.
Okay. So
¿Cuáles nos sirven? ¿Cuáles son los retos?
Entonces, ¿cuáles son los retos? No. Entonces, por ejemplo, es un sistema de información. ¿Cierto? Tenemos el sistema de información y tenemos 3 áreas del sistema de información. ¿Cierto? Tenemos los datos de información. Entonces decimos, bueno, ¿cuáles son los retos? A nivel mundo, a veces no tenemos la distribución, entonces necesitamos construir eso. Quizás no tenemos
Hi. Ah, vea, esto por ejemplo son los chicharrones de esta vaina así. ¿Qué?
No me alcanzaría a escuchar.
Ah, no, no.
Chicharrón.
¿Cuál es chicharrón? No, ¿sabe qué? Igual aquí. Okay, so we're going to switch to the next topic of governance. We will work until 9:15 in the governance space. So the main thing that we identify is that there was a set of coordinations that happened at different levels. So that was like pretty much because of a need in which we had to take the agreement, to do the agreement, and to um, go on with the agreement. But with that experience, the purpose would be to institutionalize it. That's what we've seen in the study. But for each country, what would that challenge be? What would be the next step to follow? I believe the easiest thing is to work it in a next sheet, and we would have a 5 minute space, please. 5 minute timeline.
Bueno, ahora los invito a que trabajemos sobre el tema de la disponibilidad a nivel nacional de los recursos humanos para la salud. Estamos atrasados 5 minutos de gobernanza. 5, 5. Yo dejo para los demás y de 5. Ay. Gobernanza. al tema de la disponibilidad de los recursos humanos a nivel subnacional. de capacitación
Yeah.
But I guess now it's how to come to into the concept of rights produce a lot. I mean,
Yeah, that's the thing.
it's broad, it's very broad.
Yeah.
So now it's maybe how they have some priorities, and then for the priorities, how do they want to go about it? Because they are, I think Peru was like to improve the collaboration between the different ministries, which is key, but it's a very
Just we're
broad,
talking about how to look forward
Yeah.
with this cooperation.
because I think it's great to have these discussions. It's really fantastic.
The country is very exciting with el ejercicio fue muy interesante. La esquina esta está muy callada. Esta esquina está muy callada. Y de hecho, me está mirando Mari Carmen con una cara que no digo nada. Me asusté. Me asusté. Nos vamos instalando, por favor. Yo no dije eso. No, dije que era una esquina. ¿Qué nos falta? Nos falta Argentina, Paraguay. Ya. Ahí viene Mónica, ahí viene Débora. Ustedes recuerdan que ayer Edilma dijo que se iba a Brasil. ¿Mm? Dicen que en la noche el presidente Lula recibió un llamado
We
telefónico.
heard that in the evening, President Lula called a phone call. She said, President Lula, I'm Edilma from Colombia. You're waiting for me, but I cannot leave this important HR meeting, so I'm going to stay here.
Así estamos.
That's how we are.
Así que, bueno,
So, okay, we're going to make several changes in the agenda. We have said it already yesterday afternoon,
y bueno,
and we were going to have a presentation from Washington. Still, we haven't achieved the proper connection, so therefore, we're going to ask our colleagues from Chile
nos hagan la presentación, una
to do
presentación doble,
a
porque
double presentation because
ellos van a presentar
they will make a presentation in the subject that was pending from yesterday, healthy mental health program. But besides, we're going to ask for a small reflection on the work that they do with the Ministry of Finance in Chile for investment in human resources.
Muy bien. Habíamos visto la
We
importancia
have
que
seen
tiene
the importance that it has the how it is negotiated with the finance sector, all resources for human resources. So Chile has an interesting experience, and also if the rest of the countries have it, it'll be interesting to know it. So
por favor, dejamos
please, shall we leave
a Chile.
Chile? Shall we let Chile?
Ya. No, ahora sí.
Ahí sí.
Esa fue como la frase ayer, antes de partir las intervenciones con los micrófonos, ¿no? Bueno, buenos días. Buenos días
Good
todavía.
morning. Still good morning to all of you.
Vamos a partir, vamos digo, porque
We will start. I'm saying will because along with Claudia Godoy, we prep this presentation. It corresponds to me to present it, but then we'll complement it with the questions. And first, we're going to present what we had committed of our incipient experience, but that we value a lot and that we, besides, want to continue to empower and improve it, what we call it healthy um, employees, us in charge of what happened with during pandemic with healthcare workers before the need of taking care of difficulties in the surroundings of the mental health. Well, the first thing, I think it is important maybe to locate a bit in which state we are in general. In the context of a conversation of yesterday and we have nowadays, in regards to Chile, Chile is nowadays in a moment where, from the point of view of commitments of the government, there are three great priorities. One of them is what we have called the postponed care, which is reduced to waiting lists, but at the same time, we understand it's a higher difficulty as an outcome of the pandemic. Second, there is a priority of government commitment of mental health. That means to progress in the mental health policy for the country, which of course includes what I'm going to mention here regarding the healthcare workers, but in a higher mental health policy. And the third is a priority, which is the implementation of an educational reform, which has as essential pillar the universalization of primary care and the integration of different systems, primary as well as secondary and tertiary. From the political point of view, there are two processes that have influenced in the total isolation of the current government. One of them is a rejection to a constituent process, a constitutionary process in healthcare was important political situation. And second, now there was a rejection of tax reform. What do we mean by this? I mean, we talk about healthcare reform. The path nowadays, late March the 12th, March is 12th, the parliament discussion, but it is important for us to mention the political context. Because I also want to mention something that's important from a conversation that we're having today, even with the challenges that we have in terms of health. After pandemic and with the current government, the government has had to do a lot, especially with the healthcare sector, because our division corresponds a lot to approaches, high expectations of workers, not only of solving problems after the pandemic, but historical gaps in pendings of labor conditions, which many years hadn't been approached for many years. Last one was the fifth reform in 2015, but that didn't resolve issues in HR that are still pending. I think it's important to mention that because at the end, if you approach a problem like this one, it's difficult to think that this is not articulated with a higher policy of labor conditions, of work systems, an important part of everything that was discussed yesterday. But that being said, I'm going to go for the sake of time because it's only 10 minutes, right? These are the general characteristics of a public assistance network of our country. They are the primary, secondary, and tertiary levels of care. You have this presentation so that I don't have to go too deep. The great pending part from our end is what reform proposes, health reform. It's how do we better articulate because everything regarding primary care in Chile is dependent on the municipality government. And very seriously, pandemic evidence the need of articulation with the secondary and tertiary levels. And what the initial reform design is proposing is to strengthening the integration of these networks and besides the universalization of primary care. An important percentage of Chilean citizens are taken care of in the public sector, and we have around 3 million people who are taken care of with the PRESAP or the private insurance or assurance. And what the reform is proposing is a public universal assurance with possibilities of having private insurance or private assurance uh, um, and contracting. And that's the reality of the country. Is people working in the public assistance network. All the data that we have here is on the public network. Part of our gaps is how to collect information from the private sector. There's not the possibility of accessing too much to that. That's part of what we have been working on. And its vast majority, women. Therefore, everything referring, for instance, to mental health, which is part of a program that we're developing, have an absolute gender approach from point of view of devices, as for instance, children care, which has a lot to do with the conditions in which women work in the sector. This is some data on how COVID cases have been evolving in the healthcare sector. I'm not going to get there. There's a peak that we have in 2022, which had to do with whenever the mascot was eliminated, was removed. That's an important point, and that's why that varies. And here, there's something that really, beyond staying with data as such, it has to do with this data of absenteeism, which has been impacting not only because medical licenses are related to mental health disorders, but because of the impact that absenteeism level is having nowadays in the work environment. Nowadays, and I'm going to refer to something more qualitative. Nowadays, pronunciation. The highest pressure that we're having is inside the work team. Those who have to be keeping a lot of terms as a product, as an outcome of absenteeism, te quiero es la pronunciación, to cover replacements. We have an keys. We have an important number with salaries, which is part of the Air Force in the pandemic, and we still are keeping them. I'm going to refer to our conversation with the Ministry of Finance and with a working group that we have been, uh, where we are approaching that point because human resources that were additional in pandemic effectively are covering historical gaps. And what we're proposing is that we can absorb part of that staff and that not necessarily uh, once the pandemic is ended, we cannot have those human resources, which besides already has 2.5 years working, has been trained, and is part of a network. So when we talk about medical leave or license, medical license or mental health, it's not just to look at the personal condition of people, but necessarily all factors that nowadays are influencing around the work teams essentially, and condition factors which allow to approach in a better way and in a more comprehensive way mental health approach strategy. What I mean to convey is to understand that whenever people ask for medical leave with a high level of absenteeism, which is 35 days in average per worker, not to make invisible what happens with teams that are without necessarily asking for a leave and the care in terms of work environment. With that being said, what is the program about? Well, this is a program that is born in pandemic period as a strategy and as an immediate solution. That means the need of being in charge of approaching the mental health problems that we are facing in terms of the exhaustion, stress that healthcare teams were having. I don't have to mention it. We all went through that, right? In taking care and saving lives. And the program proposed at that time two great goals. One of them was to approach the contingency, but it was defined already thinking that medium and long term this was a strategy that could stay. And that's why it's two targets. On the one hand, to approach and manage all psychosocial risks of workers who right now are working in the network, and on the other hand, to generate initial conditions that could allow the development of a management model in the network, the care of the health of the staff, medium and long term. Indeed, the way how this program was installed was to take care of those who take care of us. So that's like the quote that symbolically stays in the whole program installation process. I'm going to anticipate that nowadays the challenge that we have is to progress in target and goal number two. What happened to the implementation? And clearly, this started in 2021. That means it's been like 1.5 years of implementation. And essentially nowadays, what we have achieved is this initial strategy, and you'll see the related outcomes of this contention and diversion um, strategy. And the purpose is to advance in this management model looking forward. Here, they are like the principles, I believe, of what we understand strategy of a program or a management model of mental care and of the care of people working in the sector. By the way, approaching short, medium, and long term the impacts of the pandemic. That's the first thing that we've done. Preventing secondary effects and reducing the long-term impact. That's part of the challenges that we have right now. Assessing, intervening, and managing mental health needs. Everything regarding diversion, like deviations, that has been strengthened way more. Something pending here, and here network managers have an important role. That means those who lead. And this is an important approach that we're having right now in 2023 because in order to progress in installing um, people care management capacities, those who lead, what's traditionally like the leaders, the chiefs have an important role. It has to do with a lot of work of training related to other stakeholders of training, those who drive these teams to generate this capacity of the care of people in a permanent way and to gather experience and to prepare for a new potential crisis, which really should make us react not in an improvised way, but we but to have certain protocols to be able to approach it, to be able to face it. Um, just an example, a crisis, a recent crisis were the fires that we just had in 4 or 5 regions of the country in a brutal way, where again the healthcare staff was exposed to be in the first line. So that's what we're referring to. Why? Because everything we saw here are that is being developed in terms of mental health is not only for citizens, but it's also to assist the teams. Um, it was put at stake. For instance, these days with fires. Chile is a country where tsunamis, earthquakes, and fires are very common. So what is the strategy about? This is how it's been designed, and this is being worked in an important way with managers. With the strategy was so installed. We have right now 29 healthcare services and 77 healthcare managers or advocates were installed, like professional psychologists with experience in the mental health arena that were installed as focal points in the healthcare services, and some additionals in primary care and in high complexity hospitals. So that is the strategy. That is the network of advocates who besides have done a work of being able to work in a coordinated way and also inside the regions, like of certain macro zones which have specific territorial characteristics, and therefore there are ways of approaching environments of different strategies. These are the four elements of the strategy. On the one hand, prevention. We understand that uh, ethically is questionable if we do not approach prevention and whenever approaching mental health, how to decrease risk factors. There's a treatment environment, of course, and that's the diversions and the additional resources that we need to follow, that we need to continue to guarantee for the healthcare staff, and that they can have access to psychological intervention in an effective way. Well, and effective doesn't only mean the moment in a timely manner, but that follow-up, which is like sometimes was difficult to guarantee. There's
Environment.
one of them is the medical license. And what happens here once people come here? Because it's
Entorno.
saying it because where we're living, so the re, integration of people in an extended license or leave is part of a higher strategy of mental health of organizations and of promotion because that's part of a more educational work and self-care. And in that sense, I think for the videos that are going to be available, I think that goes very along with how people take care of themselves or by themselves. Here, the program started. I don't want to go too far with this, but what did was essential to install the network managers or advocates, and the network managers or advocates could do a diagnostic. They had a lot of work during 2021 and part of 2022 of immediate contention of being able to appropriately articulate diversions of psychological and psychiatric interventions. And um, there was a lot of work, participation. We send pretty much every week we have meetings with the managers of mental health in all the network, and therefore we're monitoring, especially in crisis times, as it was in fire times these days. What is the work? What are the needs? Besides higher risk situations, and that can be approached according to the same protocols that each of the healthcare services have been generated. In that sense, we've been respectful, and it's true that we've generated a lot of technical guidance in general. We believe that organizations have different cultures, and therefore their response capabilities or the way of responding. I'm referring to the organization, the healthcare service, the network, the hospitals, and the linkage that they have with the primary care territorially and organizationally that has different responses. And some prevention responses or how managers relate with workers, with associations, has certain protocols which are different than others precisely because of history. I don't know, they are institutions that have higher conflict than others. So there we have respected a lot that possibility and we've gathered those experiences besides because that has even enriched the same guidances that we have been delivering. Here, this part of the development, as you can see, there are pictures of the zoom of the guidances, the guidance that we have been releasing. Nowadays, we're even in a review of all these manuals or technical guidance because we understand that now the first uh, crisis care has gone by already. Therefore, we're in a discussion or a design that's committed for the end of 2023 of this policy and of this um, care management of the care of people inside the network. Here are the numbers. Of course, I'm not gonna refer to figures. Figures have a lot to do with. That's why I care about putting the context because figures have a lot to do with this emergency care. That means diversion, psychological, psychiatric care, follow up to more critical situations, and some activities of work and protocols inside each of the hospital services. We put a main focus on hospitals that have a higher demand. We have that very mapped and identified. And the other thing that probably is pending is how, besides this work in this line, is better articulated between hospitals and managers, advocates get to impact the primary care because of the way how our primary care system is structured. We always may leave uh, professionals of primary care or let them advance so that they feel that they're not the last ones receiving the care. Well, besides, they are the first line of care to citizens.
Y aquí está todo el material, ese material está disponible. Aquí
Here,
están
there's a
todas
whole
las
material
referencias
is
de
available.
atención
Here, there are the figures of psychological care, diversions,
diversas
referral to
¿no?
psychological and
Este año,
psychiatry
20, no, perdón, el año
care.
pasado, en el
Last year,
2022, ¿sí? En el
2022,
2022 logramos reforzar esta estrategia
we
de
got to
prestación
reinforce
por
this
hospital digital.
strategy of
Una
compensations with a
estrategia en el Ministerio de Salud que es hospital digital
hospital,
y
digital hospital. We have a strategy in the Ministry of Health,
una línea
which is a digital hospital.
exclusivo
There's an
para trabajadores y
exclusive
trabajadoras
phone
que
number online
opera 24 horas y
for
eso permite
workers. It operates
sesión
24 hours, and
en
that
línea
allows
de
online
24 horas de
some
sesión
psychology
y
care
hasta dos
24 hours
sesiones
a day, and up to two
psicólogo cuando
sessions
una
with the same
persona
psychologist
necesita
when a
continuar, ¿no?
person
Eso
needs to
también nos ha
continue.
permitido descomprimir
That
un
has
poco
also allowed us
ese
to a bit
esencial
kind of
recurso,
decompress
recurso
what
humano que necesitamos para poder
on-site, the
atender
on-site
estos
human
días
resource that we
además
need
de
to
los
really take
momentos que
care of the
tenemos de
demand
relación de
that we
salud.
had at some point in mental health.
Teníamos cierto escepticismo en relación a la
We
estrategia
were
en
some kind of
línea, ¿no?
skeptical in the
Precisamente porque
online
lo que se
uh,
requería era como más
care
cercanía, pero
because
hoy día los
it was
niños
required to have a
saben
closer
que cuentan
care.
con un número al cual
But
pueden llamar en
nowadays,
cualquier
they know
momento,
that they have
en
a
cualquier
phone number they can
hora del
call
día, y
anytime
por
during
eso
the
en el
day
fondo
for
ha
care,
sido un buen soporte
and it
también
has been a good
para la
support
comunidad.
also for the strategy.
Ahí está. Estas son las prestaciones
There
que se
is
han dado por
these are
digital
the compensations that are being given by digital
este año
hospitals. The hospital.
2022.
These are the
Y para
figures
terminar, ¿cuáles
of
son los desafíos?
2022.
Hay
Now
otros
to end,
componentes
what are the challenges?
además los voy a
To
desplegar al tiro,
besides, I'm going to show them all together.
¿no?
They're right there.
Tal como algunas de estas cosas ya las he
Some
dicho,
of these
tenemos
things
que
I have said
actualizar
already. We need to
la
update
programática
the
del
programmatic
servicio para poder
guidance,
instalar más bien
and
modelos
nowadays
de
to think on
atención
installing this management
del
model
cuidado de las personas.
of care of people.
Requerimos todavía
We still
mayor difusión
require
de
higher
escenarios vulnerables que
dissemination
tengan más
so
claridad
that
respecto de dónde acudir, o sea, todavía tenemos
uh,
zonas en las cuales,
professionals have
por ejemplo,
somewhere
centros
to go.
rurales,
We have like people like
establecimientos más alejados
rural
no
areas,
van a
more
tener
isolated clinics or
definitivamente
hospitals
el
where
soporte, sobre
they don't
todo
know
si
where
es
they
que
have the support,
en
especially in
relación con
emergency
las
situations.
prestaciones,
That's
algunos
a great
trabajos
challenge.
complementarios
Some
que
complementary work that we have to do. One of
el
them is
protocolo de vigilancia de
all the
riesgo laboral, donde
work
actualmente tenemos
psychological
salud mental
protocol surveillance in which mental health
factores de
and
no
environment
violencia,
of
¿no?
non-violence environment
Relacional
were
con el
included.
ámbito de salud mental,
That
pero
we're
que
relating
tienen
it
que ser
to the mental
abordados de
health
forma integral y no vamos por caminos
environment,
distintos.
and they don't go in different
También
tracks.
se elaboró una
And
política
also
y un plan de
a
acción
policy and an
de
action
prevención
plan
como
of
alcohol y drogas,
alcohol and drug
es una
consumption
característica
prevention
que se ha
plan
visto
was
en
made.
nuestros
This is a
funcionarios
high index that we
profesionales de
have in
salud,
professionals of
especialmente en las
health,
urgencias,
especially in emergency
y por lo tanto vamos a hacer un plan piloto de
rooms, and
abordaje
therefore we're going to make an approach
complementar
pilot,
al programa
which is
estratégico,
complementary to the mental health program,
trabajar y avanzar en el
to
programa
work
de
and
seguimiento
advance in
laboral
the
que estamos observando y que por lo tanto requerimos luego acompañar
reinstatement
este proceso.
to assist the process,
Y finalmente
and
terminar las
finally to
negociaciones con las
end
autoridades de
2023 with
atención a
this
corto, mediano y largo
more
plazo.
medium and long-term
Recursos
management model.
adicionales en la
Additional
conversación con Hacienda
resources in conversation with the Ministry of Finance, and by this I want to
instalamos en una
finish.
mesa
We installed
Hacienda,
a
nosotros como
finance working
Ministerio
group
de Salud
or work
y
group of
como
finance,
Ministerio
the
de
public
Salud
sector,
como ente
not only
técnico
healthcare, and the Ministry of Health as a
descentralizar
technical
para
entity of mental
trabajadores del
health
sector público en
for
general. Ese es el
public
primer paso, ¿no?
um,
Y eso, de alguna
sector
manera,
workers in
conversaciones
general.
con
That's the
ellos,
first
va a
step, and at some
seguir
point it has
adicionando
committed
recursos
Ministry of Finance that they're going to
obligatorios
continue
al
to add
financiamiento
resources because
sobre
advocates
todo en
are
atención
not
primaria y
enough
también
with a approach,
establecimientos
especially in
más
primary
aislados.
care and more
Por lo tanto,
isolated
tenemos un compromiso de parte de Hacienda
facilities. And we have a
en la
commitment from
programática
the
que va a
finance
tener recursos
ministry,
y que comprende cuáles
which
son
is which this is
las
going to be a
necesidades
program
precisas
that's
que
going to
tenemos.
require resources, understanding the need that we have.
No sé si quiere agregar algo, Claudia.
Claudia, if you may want to add
Muy
anything,
bien.
okay, very well.
Muchas gracias, Angélica.
Thank you,
Vamos a hacer
Angelica.
una pequeña
We're
ronda
going
de
to make a
comentarios
small
y
round of
preguntas
comments
para
and questions for
después
this part, and then
continuar
we're
con
going to
Julio.
continue with the other one, Julio
Débora.
and Deborah.
Nuevamente, felicitaciones, muchas gracias por
Again, congratulations.
Chile,
Thank you for sharing
FONASA,
Chile. with the FONASA reduced a lot segmentation and fragmentation somehow. But I think there is an effort to improve the levels of integration at a vertical as well as horizontal level. I would like you to share with us not only in general services, but of the program. How have you made it so that there isn't that vertical look, but that it is integrated in the regular services, particularly at a municipality level? Because here, Chile shares with Bolivia, and I understand there are a lot of municipalities, France, France, capability of financing and management, and no other. Ese micrófono está intermitente. How to balance those inequalities?
Hablo ahora.
Sí,
Débora, después
sí,
Wilson.
recogemos primero.
Deborah and Wilson.
Bueno,
Well,
muy bueno, digamos, en la presentación fue
in the
clarísimo,
presentation,
con mucha
it
información
was the
muy
presentation was
valiosa
clear with a
y
lot of
besides el
valuable
programa,
information and
porque
besides the
realmente
program because really
como
it
distintas
has like
etapas
different
que permiten
phases
hacer
which
una análisis
allow to
integral.
look at mental health in a
Felicitaciones, muy
comprehensive way.
bueno.
So
Y tal vez ya
congratulations.
tienen algunos años de implementación, con lo
Besides,
cual
you have some years of
creo que deben
implementation
estar
with which
pensando
I
ya
suppose you may be
en alguna
thinking on at some
metodología de
point
seguimiento para
assessment or
darle.
follow-up
En ese
with it.
sentido, digamos,
In that
yo
sense,
les quería preguntar,
I wanted to ask you
porque en la primera quizás me lo
because
perdí, si
maybe
el
I missed
sedentarismo
it
ha
in the first
bajado
part. If
considerablemente
absenteeism has
desde el
decreased because
2022
of
o
mental
no.
health in 2022 or not?
No ha
No,
bajado.
it
Esa
hasn't.
es una
It hasn't.
pregunta
That's
que hay
a
que hacerse,
question
que
that
tiene
we
que
need to
ver
ask
con
ourselves,
la
which has
segunda,
to do
el
with
segundo comentario que quería
the second
hacer.
comment that I wanted to ask.
Realmente
I
los
wanted to make
abordajes, como vos
because
dijiste,
really,
desde
as you
abordaje
said,
psicológico,
a
atención
veces se pone muy ronco
alimenticia,
este micrófono
contención,
también.
derivación, creo que
Guys,
han
I think
cubierto un
you
trabajo
have
muy
covered a
importante.
very important
¿En
work.
qué medida pudieron
At what
avanzar
extent were you able to
con el
advance
tema de las condiciones de trabajo?
with the working
Con los
conditions?
agentes
That means
sociales que están
with
interviniendo
social
muchas veces en la
agents that are
generación
intervening many times in
de
the
problemáticas
production of
psicosociales, porque digamos,
psychosocial
una de las cosas que es
problems.
importante tener en
Because one
cuenta
of
en
the
el
things that are
contexto de
worth taking into
pandemia
account in any
tiene
context
que ver con
has to do with
cómo se genera esta
how to
producción
generate this
que
production of,
masivamente empezó a haber
I mean,
trastornos que salieron a
massively.
ver. Bueno, parece que sí,
There started to be a disorder, mental health.
o sea,
Seems
todos
like
los
yes, but
estudios que ahora nosotros
all the
tenemos
studies that we have
demuestran
already available,
cuánto ansiedad,
knowing
cuánto estrés,
how
cuánto
much
dolor
anxiety, how much of
causa,
this or the other we didn't have before,
focalizado en trabajadores. Entonces,
focalized on
una pregunta que
workers.
nos hacemos
So
que
there's
tiene
a
que ver
core
con
question that we
hasta
asked
dónde
ourselves, which had
realmente
to do with at what extent
bueno, sabemos que avanzó,
really
sabemos que creció, sabemos que
it has
seguramente
advanced that we know that it advanced, that it
me
progressed,
parece
and that's
excelente.
a
Pero
problem we
quiero
need to
saber si
face.
en
I
este
think it is excellent, but I want to know if in this
digamos, proyecto se podría
project
avanzar o
we could
podrían
advance,
avanzar
or you're
en las
thinking on advancing
causas y
in
no
the
en soluciones.
causes
O sea, tiene que
and
ver con las
not
condiciones de
in
trabajo
the
muchas
results.
veces,
With
donde
working conditions, many
personas que
times
son
with
más
people
vulnerables
who are more
desde el punto de
vulnerable
vista de la salud
from
mental
a
o de
mental
su
health
vida,
point of view of all their life
tienen una reacción diferente
have a
frente a la
different
carga de
reaction in regards
trabajo
to work
que
stress
personas que no
compared
lo
to
son.
people who are
Pero
not.
digo, es un tema muy
But okay,
delicado
that's a very
de
complicated
abordar, ¿no?
subject to
Pero
approach,
buenísimo.
but very good.
Bueno, vamos a dar dos
We're gonna
intervenciones más y después vamos a
we're going
pasar
to allow two more interventions, and
a
then
la otra
we're going
presentación
to go to the
de
other
Chile, que es
presentation of
con
Chile, which has to do with
Wilson y Luz
this
María.
Wilson, and Luz Maria.
Muchas gracias.
Thank you very
Bellísima
much.
la
Very
presentación.
beautiful presentation.
Dos preguntas para entender bien.
Questions to understand
Los
properly.
alcances del programa Saludablemente
Scope of
van sobre todo el
the,
sector
the healthy program
público.
or saludablemente program,
El privado
especially is focused in the public
correlato con
sector.
eso.
Does the private sector have
Contestaste, gracias.
anything to do there also?
Y sobre
You,
la
you
figura
just
del
answered. Okay, thank
gestor,
you. And about the figure of
va
the
por el
managership
financiamiento
mentions like
directo
the
a los
advocates,
bienes
does,
y servicios
do
nacionales
they
y
go for the
colectivos.
care of workers?
Y se involucra también
Do
con
they get
prestaciones en
also
salud mental
into the mental
que
health
vendrían a ser los usuarios de los
compensations
servicios, o
or
son
salaries
solo
paid to the users of a
o sea, la
service?
relación
Is it an
objetivo
advocate? Is it a
son los
manager?
trabajadores
Which target
o la
population? Is it
persona que
only
está
workers,
cobrando
or
la
does it
renta que
also
es a la
have
boleta.
to do with, or do they also have to do with
Gracias, Wilson, Luz
the
María, y
compensation
después le
or
damos la palabra
salaries?
a Angélica
Thank
Vergara.
you, Wilson Maria, and we'll give the
Angélica
floor then
Vergara
to
parece que tiene
Angelica
alguna pregunta, entonces
because she has all
hay
the
que hacerle
questions,
pregunta.
and so that she can answer
Gracias.
all the questions.
No, quería hacer una pregunta
Okay, I wanted to ask a
puntual
very,
en
very
relación
specific question in
con,
regards to,
tú hablaste de unos
you
gestores,
mentioned some like
¿cuál es
managers or
la
advocates.
figura de los gestores y cuál
to better understand the figure of those managers and what is the figure that they have within the whole network to identify people who need the support, which I thought was a very, very important figure in the process. And to congratulate you because it's um it's an investment that's very important from the state's end, which is worth it to know the results and the impact of the program. Thank you. I'm gonna try to answer Claudia. Just give me 1 second. That as always at the end, every time I say we're gonna close, someone comes up, and in this case, it's my dear namesake, Hernando Rodriguez. Hernando Rodriguez. Please be brief, Hernan and Roberto. If you want a microphone for you, event, we'll give you the better data to find it. Thank you. Very good. Question is the monitoring and assessment with cases. Do you have figures like fatal cases or like suicide, etc.? Because I think it is important to have that information. Thank you, Hernan and Roberto. And there we'll wrap up. Very specific. Specific actions to solve some issues which originate the mental health problem. Have there been cases in which the healthcare staff, because of the worker overload or burden, have problems? If you have made any actions to correct or attenuate to obviously favor the healthcare staff. Okay. Can you hear me? Yes. Can you hear okay? Yes. We're gonna start with the questions of a manager, advocate. That helps me like to explain the work in a more detailed way. Then Claudia helps me complement. The decision of installing a manager, advocate, that's understood, is that given the urgency, if we approach the people management, people who are permanent in the services, who were already absolutely stressed during pandemic, it was going to be not very probable to progress in a strategy like this one. So the aim of putting a manager was effectively a human resource who at that minute was understood as a more specialized human resource in the mental health environment. I mean, psychologists with um, trajectory and experience in this environment, and that strictly that's the resource. Like there aren't any other financial resources, so to speak. So as a human resource distributed in the network, and it's in the 29 services installed in the directorate in the management of a service, and in some hospitals where we have more workers, and therefore in the management of a hospital. So all questions related to the role of the manager is that the first thing was maybe to design, sometimes not to design, but he himself or she herself have to take care of the first cases. Those probably were the first 3, 4, 5 months. Remember that it was 2021 still. Therefore, it was to start to take care of cases. Indeed, at that moment there was an assessment of that, and we had to correct so to speak. And it's okay. The manager has to arrive and take care of cases. You cannot elude that or avoid that responsibility as professional ethics, but you need to start doing your work. The, the basic thing is to effectively coordinate all the other resources available, and they became an important support for people of the care services, but it needed to be thought, analyzed, better coordinated. So that has allowed to approach environments that are from the safety work committees, physical conditions, from resources available, for instance, in training, in which allowed to train more in this environment, diversions. We have function. employees' health programs, and those programs that were um, um, unforeseen or like by the pandemic in psychiatry. So the role of the manager has been in the first phase this care, but then to be able to generate a plan with the available resources. That on the one hand, on the other hand, everything referring to labor conditions has been part of a work that's also coupling or to this or being fitted into this strategy because part of the first assessment is systematized by the managers themselves, and that is in the design that we have been um, talking about. It was necessary to approach, and there it agrees, it matches with an agenda that we have committed nowadays in working groups. There are two important things. 40 hours reform to the labor shift is being discussed. That's medium, long term, at least 5, 6 years if it's implemented in the public sector. And yes, we have been working in uh, redesigning the shifts or in how a labor system change is going to affect the shifts and the schedules. So we're also doing like more of a pilot that the government has committed to generate some innovations in the shift systems, which allows us to approach more structural labor conditions. That on the one hand, on the other hand, and there it gets crushed with the additional resource of the pandemic. We have been trying to support work with the Ministry of Finance regarding. I'm going to make a proportion there. We had 21,000 people in the network, which nowadays are like a booster, like a reinforcement who got into the system as an outcome of the COVID booster. That was all. They were all hired by compensation by salary. So we did a proposal in which we said, okay, when this health alert emergency, if people leave the system, not only the care of people are going to be jeopardized, but also all environments of working conditions of workers, because these 21,000 people are covering historical gaps. We did a very strong work, hard work during 2022 of being able to identify where these people are, because we know that these people are covering historical gaps and we're in a negotiation nowadays. We don't know how it's going to end, but part of that staff can be observed because effectively, besides because of the absenteeism that we have, it's going to allow a certain degree to normalize a human resource gap, which is um, noticeable. The in absenteeism levels haven't decreased, as I said. There's exactly the same, and the program does not take care of the private sector. In the working groups that we have with associations, nowadays we have on that working table, that working group, the private sector workers are representative. This is how we resolve the private sector issues. Mental health are very far from what nowadays we're doing in the public sector. That is a group of workers who are like abandoned because finally it depends on each private clinic how they resolve it. But we care about how to do something, but nowadays it's not affecting. I think I answered it, Claudia. I don't know if there's anything else that you would like to.
Micrófono, porfa. Micrófono, micrófono.
Regarding the question that Julio was asking, because FONAS really is the provider, and in the case of Saludablemente program, Healthy, FONASA does not participate because there are two Saludablemente programs. One of them is addressed to the population, which was to mitigate the effects of the pandemic for the general population, and another one which is a line that subsequently came up, which is the saludablemente employees. And here, salaries or compensations are not charged as a provider. It doesn't participate in FONASA. These are compensations that are covered within the program and with their own resources they have in each healthcare service. The psychologists existing were in each of the facilities with psychiatrists, and that's why Angelica mentioned managers are in charge of assessing. There's a diagnostic and the appropriateness is assessed in which they go to a program that where they have up to 12 sessions assured with the psychologist and given a situation even with a psychiatrist. But there isn't a charge of compensations in between. It's part of a program and services that are delivered in a context that besides it way broader because it's within the context where we have a health and safety at work department which has a line and besides this data they work with gender violence with um, external, internal violence, with work violence and sexual violence. And besides, we have this line that where additionally pandemics, we gather all the environment, the health status of the employees, of this professional. Not every month and cases have been decreasing, and there has been less monitoring. But there's a joint monitoring. There's a lot of information available, so the program is a line within something that's larger which is the policy of care of employees,
Ok,
professionals.
Alicia, tú vas a hacer una
Alicia,
pequeña
are you gonna make a
observación,
small
sí,
observation?
y ahí
Yes,
cerramos.
and then we'll wrap it up there.
Muchas gracias, muy interesante, muy
Thank you
elaborado.
very much. Very interesting and well elaborated
Cuando
presentation.
hablas de que el
When you
personal al que atienden
say that
es
the personnel that you take care
el
of
municipio
is the one
básicamente,
working in the municipalities, pretty much,
¿existe algún tipo de cruce o el personal que
are
trabaja,
there any kinds of
digamos,
crossing, like
para
personal
el
working
sector
for
público,
the public sector?
puede ser el mismo
Could it be the same working in the
o es
private sector, or
diferente?
is it different?
No, a nivel, o sea, hay un porcentaje de
Well,
personal que
there's a
trabaja en el
percentage of
sector
staff working
público
in
y
the
que
public
también
sector
tiene
and who
alguna
also have
cuota
some
en el
kind of
sector privado. De hecho,
time
lo
in the private
importante
sector,
de
like
nuestras
during the day. So
dificultades
that's
para
part of our
retener
difficulties to
personal en el sector
retain staff
público
in the
son las
public sector as
remuneraciones en relación a lo
our
que ofrece hoy día
payments
el sector privado.
compared
Si
to what
bien
the
hoy
private
día
sector offers.
el sistema
It's
privado
true
en
that the
Chile está un
private sector
poquito
in Chile is a bit
duro, ¿no? Por lo que usted debe
critical right
conocer por
now.
la crisis de las
You may know
ISAPRE.
how the crisis of
Pero
the
claro,
ISAPRE, but of course,
comparte en parte. Ahora, eso se da en
at some
algunos
point it's shared.
estamentos,
That's
¿no?
given in some
Los médicos, los técnicos, los enfermeros, que son los
levels.
estamentos que más
Physicians
comparten
are the
con el
levels that
sector
share the
privado.
most with private
Pero
sector.
hay otros funcionarios
But
más
there are other
administrativos
more
y
administrative
personal
professionals and more
auxiliar que es más del
assistants,
sector público, ¿no?
assistants, personnel, which is
Eso.
more of the public sector.
Cosa que a nosotros sí nos
One
está
thing
pasando
that was happening to us is that, for
tenemos un
example,
turno en un
the
hospital
girl
público
did
de 12
her
horas
shift in a public
y se
hospital of
vino
12
a
hours,
hacer un
and she went
turno
to
de
do a
24
shift of
horas en el sector
24 hours
privado.
in the private sector.
Y obviamente a
And
ese ritmo
obviously,
pues
at that rhythm,
no avanzas.
she's not gonna progress. You're not gonna
Justamente
progress.
ya cuando enfermaban
And when they got
recurrían al
sick,
sector
they
público
appealed to the public sector
para hacer
to
sus reclamaciones
make
de
their
seguro,
claims of
hospitalización y
uh,
demás cosas.
insurance,
Así que
assurance, hospitalizations, and other things.
estamos de alguna
So
manera
I do believe that at some
tratando de
point we
hacer
should, and we're trying to do it,
el sistema de rentas
through
internas
the
una
internal
especie de
rents
mapeo para ver
systems.
qué
That is some
personas
kind of
más
mapping to
tienen que
see
hacer en el sector
what people, besides exercising
privado,
in the private sector,
están en el sector público
are in the
básicamente,
public sector pretty much,
trabajando horas
working
o media
hours
jornadas,
or half
porque
shifts,
sí
half
se
time,
ve las
because we
personas
do
que
know
hemos
that people who
más,
obviously work
digamos,
more,
posiblemente en los dos sectores,
possibly in the
son
two
las que
sectors,
están más
are those
damnificadas.
who are more affected.
Sí, muy de acuerdo con eso.
Yes, I agree with that.
Nosotros tenemos algunos
Gracias.
datos sobre eso también.
We have some data about that also.
Gracias,
Thank you.
Alicia. Muchas
Thank
gracias,
you,
Angélica.
Alicia. Thank
Entonces
you,
vamos a
Angelica.
pasar
So
a
now
la
we're gonna go
otra fase
to
de
another
la
phase of
presentación de Chile y
Chile's
voy a invitar a
presentation,
Ana Paula
and
que nos haga una
I'm gonna ask
pequeña
Juana Paula
introducción.
to give us a small introduction.
Bueno, ahorita vamos a pasar para el tema de
Okay, now we're gonna
los
go to
desafíos de la inversión en recursos
challenges
humanos
of
para la salud.
investment on
Ese
human
diálogo
resources
del que
for
hemos
health.
hablado entre
That
salud
dialogue we've
y
talked about
finanzas,
between health
¿no?
and
Entonces
finance.
aquí hay dos temas principales. Un
There are
tema
two
es
main
a
issues here.
nivel
One
global,
issue is at a
después de
global
la
level,
pandemia y durante la
after
pandemia,
pandemic and
los países
before pandemic and
en
after
una
pandemic,
crisis en temas
countries
de
find a crisis in
desaceleración del crecimiento,
the
de temas
the
fiscales,
acceleration of growth in
y a pesar
tax issues.
de la pandemia, de la
And in spite of the
emergencia,
pandemic,
de la
of the
necesidad de
emergency,
inversión de recursos
of the
humanos
need of
que se
investment
ve
in
durante la
human
pandemia,
resources seen
los
during pandemic,
países empiezan a
countries
recortar.
start to
Muchos países empiezan de recortar. Es
shorten.
decir, empieza otra vez el diálogo
That means
de
dialogue starts
cuáles
report on what is the budget percentage that's going to be allocated to healthcare compared to other sectors, or how much is going to be shortened in spite the pandemic evidences the need of investment. Why? Because of tax deficit, and that is noticed everywhere in the world, but not necessarily in all sectors of economy. Other sectors of economy get to keep those investment levels or even improve them. So this stripe of in this piece of discussion is we want to understand. It's clear for us the need of investment in human resource, which helps the need of investment in healthcare in general, challenges that we have, or proposals and gaps. The connection between the Ministry of Health with the Ministry of Finance or Economy and Finance in other countries in Colombia. We have that challenge, that connection, but not only that dialogue, but of understanding, of speaking the same language. Many times it happens that Ministry of Finance says, no, I'm interested into this prioritization in this way. So how do we approach finance? And on the other hand, healthcare arrives with another terminology, which not necessarily is the one of finance, which has a long time in economy. So how do we make a bridge? And this is the aim of this. And how do we also use data? We've talked during yesterday, during this morning, in different boards, the presentation of those data, but analysis and what kind of analysis. So it is to understand how to pass that analysis, the practical analysis, which in economy, ministries of economy and finance understand it way better, how to switch them, make a switch towards that policy and having a continuous dialogue to agree on what is the kind of analysis that helps find those finances. So let's focus on those two subject matters, and I think that that's pretty much it. Perfect. Again, in Chile. First, to highlight that we were not prepared for this. Okay, let's make clarification. Let's make a clarification. Because, sorry, we're gonna make the clarification. I have forgotten. I thought it was going to happen, but it didn't happen.
That, like we saying in Chile, it happened, but it didn't really happen. We have someone from ECLSA to talk about this process that he had a problem, an emergency. But this person from CLAC was from Chile. So let's continue with the logic. So we surprisingly requested the colleague from Chile. So they do the negotiation with the Ministry of Science. Okay. We divided to tell you the experience. One part is the context of how we are today, and Angelica will tell you how we are now. A little history. The traditional area of personnel would have several environments, development environments, work, training, the working relations, planning, and it always focused on contract, hiring, development. However, the area, the budgeting is like the resources for people. This is a part of the budgeting process. There's a division of budgeting that uses all the financing. And like Juana Paula said, the technicism of human resources is very extended. The amount of allotments, we have a unique scale of wages. We have three statements, one for administrative and for the other for medicals and another for municipal workers. Each one with different laws and very ample, as we say in Chile. This made us create the need to, in people management, a division devoted to coordinating, financing, financing subjects and workforce. We started paying, not only paying, but only monitoring and counting and monitoring all the allotments we had and the execution of of these work, so we could plan the budgeting of each one of these. With time, th- this 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 area grew and transformed into a management budgeting with with it's coordinated directly with the budgeting department. It is also coordinated and directly uh, dialogue with the Ministry of Finances and the planning department, which is where I work. And with that, we work all the projects that have to do with budgeting expansion. If we need more resources, not only resources, but the gaps, some teams are not only people, the amount of people, but allotments that are not covered. But in the plan, we provided positions, but not the budget. So so
Explicas un poquito lo que son las asignaciones,
so
porque
why
esa
don't
es la
you
pregunta
tell us
habitual.
what are the allotments? Each law has allotments, the wages of fixed income and a variable income. And it has a series of what we call assignments or allotments, like permanence for permanence, and that has important different wages for people that do 24-hour shifts. In Chile, we have a third and fourth shift, and that is paid with a different wage. So if the person doesn't do the shift, it's going to pay the same way. And there's an extraordinary that is called the total hours worked. And for physicians called like 3 or 4 biennials or triennials. One question: when when you talk about a medic physician, uh, are you referring to the physician? Only physicians, dentists, chemical pharmacists, and chemists. In this scenario, given that the wages, there's not only understanding of people gaps in people, but also in wages. When you do the planning, we do it in the long and short and long term. So there's an important work that we have to do, and this is how we started migrating of the funding of each one of these projects and providing human resources. And this is explanation. They started to ask for the methodology, so we started having meetings outside of the tables to explain the methodologies. And we started later. We have a budgeting cycle that starts in March, between March and August of each year. That is very intense. And there we elaborate the projects, and each project has a calculation memory and some minutes, explaining minutes, and this is all delivered to the Ministry of Finance. So when the projects are very complex, we start before the project. We start providing data. So what we've done with the Ministry of the Finance is provide the fundamentals, the technical fundamentals, so they can understand what we are talking to. The Cyprus, the direction of Cyprus. We always talk in acronyms. This has been the context, general context of what we have been working, and and has helped us in times of the pandemic, because to deliver the amount of budget that we needed to start the each of the projects, we needed the amount of personnel and the methodologies to do this. Angelica will just tell you just a little bit more. That's the basis about how we have worked a few years ago. We also need to understand that healthcare is for the government of Chile. The is most impacted by healthcare and education are for the Chilean government the most important of their government. What we now deliver is that at certain moment, currently we're at after the pandemic, and thinking of the two topics we talked about, information management and finances in all the countries, and in Chile also, it is very restricted. We're coming from a political situation and cutting, trimming some of the budget. So the budget of the nation was restricted. So we diminished the budget in, we didn't diminish the budget in health, but we're now, it was maintained despite all the restrictions, uh, all the restrictions that we have for 2023, and we maintained that budget. So we achieved funds for additional funds. We have a base fund budget, and then we now achieved, and coming from the pandemic's experience, that they approved additional funds for support to face COVID. We continue with the logic of requesting additional budget for against the results in the language of finances that they love. So today, apart from the budget, we have what we have extraordinary funds for healthcare, and they have been extraordinary funds to approach wait lists and delayed. And this is done in a work table and with the teams of our division and the team of budgeting. We have a system that has three principles. We have open, we open the whole kitchen. Everybody, this is how it's said in Chile. It is open to everything. This means all the information that we have, and this is with the context with the historically in Chile. It was not necessarily in healthcare, but it was in other places of the state and the ministries, and they don't, and they're not shown in the Ministry of Finances. So always the ministries say, well, what do we show so we can ask for more funds? So we did a risky request supported by the ministry and the subsecretaries, is to say we're not going to do this anymore. We're continue to strengthen what we've been doing based on trust, on a trust that has to continue because ultimately we're the same state and we're the government and we're the same government. It didn't sense take advantage of the political moment. So the first with all the information available and what the information we could share, so they could show the information that we were monitored by and the information we had available. And this meant that we needed to recognize that we have healthcare services that are unfinanced. So our control mechanisms did not operate in the best manner. So our commitment was more accompaniment and more presence in the field. So this is just an example. So this is the first principle. The second one is co-responsibility in complying with the targets. So the Ministry of Finances was part of the technical discussion boards. So today we have a gen. The Ministry of Finance has professionals distributed that they attend to each sector. So there's some in education, in healthcare. The specialists in healthcare are in charge of this. The specialists in healthcare are devoted to the healthcare apart from the budgeting activities that they also do in this country. It also contributes. This generates stability in the budgeting in local governments and to maintain the technical teams. The second thing is that we have these work teams that they are part of the discussion of the projects, as Claudia says, that are going to formulate the budgeting, the prospecting budgeting. So the strategy is not present. They need to discuss the budget, how is it going, how much does it cost, and how do we incorporate some of the other activities, how much it could cost, and they are part of this table. We have done this, what not done it with all the projects, but yes, with some of the most important projects. And pertaining to all the gaps and formulation of policies for 2024, and that all the people that worked in the pandemic was not all, but just a high percentage, like 60%, the percentage that worked during reinforcement during the pandemic should be absorbed by the network. But this means that for the for Ministry of Finances, important growth, the impact, the economic uh, impact of to the budget. Yeah, I don't know if there's anything else. This is what we can share right now. Thank you very much, Claudia and Angelica. Let's give them an applause. Before for comments, this makes me recall we organized a meeting, an intersectional meeting in a healthcare environment. We invited people from different ministries, work, finance, healthcare, and in a group work. Uh, and somebody from Paraguay said, summarized in this way. So it's an interchange of mutual no ig- ignorances. This is what he heard is to open the space to know what we do. This is an exercise of empathy. The essential element of this requires the will of both sectors, and in these countries it is difficult to understand that they always fighting, and it's difficult to understand that they are the same government. They're always fighting between each other. We will have just a few minutes for a comment. Javier, go ahead. I just wanted to highlight the element that they commented about the transparency of managing data. When one is not is transparent with other, it is very difficult to come to agreements, to positive agreements. So we need transparency in data transference. So in my experiences, we had a nice experience with FENASA. So there was due to that transparency, we had a greater financing for hospitals. So and this should be so they said that saying that you're not in the conversation between finance and the other institutions, they didn't feel guilt for one thing or another, but they were sincere in talking about the funds and what they needed. So they were delivered the budget that they needed. So we need to this topic of transparency is essential. So when the sector is not transparent, something is being hidden. So simply, this is could be an important lesson that is learned, like having transparency, being transparent between one another. Francisco and Pascal, David.
Thank you for the effort, even though, mm, okay, it's highlighted transparency is essential for management of human resource between health and economy or finance. In Peru, we have a similar experience. We have mentioned it already. The application talks to math. Francisco, remember, but está perfecto, it's perfect. No, don't worry. I was telling you, the fact that applications speak, we has allowed us to manage easier salary management. We come from doing three consecutive increases of the salary base of healthcare professionals, and this has been very easy through conversation and exchange of information between finance and healthcare. Besides, for these types of situations, finance asks us to show our production data. They don't only share information at an HR level, but at the level of as to quality management. If the money they're giving us is generating positive results for the country, and for instance, that also allows us to start into appointment policies that we come from three consecutive waves of appointments uninterrupted since 2013, and it's going to end in 2026 with the possibility of generating labor stability. So this program is essential, and I really think it is important that we share our countries, the management that we have, or the experiences that we have at the level of making transparent the flow of information of these ministries. Thank you, Francisco, Pascal.
Thank you very much for the presentation for Chile. I have a questions. You mentioned that you succeeded to maintain the budget, and I wanted to know if you know about other sectors, if they were also able to maintain, or if you think that the health was in a better position because maybe others declined. And you also mentioned that you have hopes or to get additional funding. And based on your experience, what would be the best way to get that additional funding also for the budget of health? Thank you.
Gracias, Pascal. Gaby.
Thank you, Pascal. Gabby. Yes, just to mention a couple of initiatives that I think may contribute to this linkage between health care and finance, which were developed from the regulation of the Ministry of Health. One of them is in the healthcare reform itself, when the National Healthcare Board was created in Uruguay, which is the one that FONASA manages, which is the gross funds which give coverage to population. The, the Ministry of Finance is included in that board. Ministry of Finance, as well as the Ministry of Health and the Social Service Bank, management of funds in a joint way. And another initiative, which I believe is also very interesting, which is the Ministry of Finance, which is that at some point it was proposed several years ago. Since the healthcare sector is the one that takes almost 9% of the IDB, it said, okay, let's generate a specialized healthcare unit within the ministry. So that also allows us to have a dialogue with people who understand about this subject matter. So we have um, health economy specialists within the finance ministry, and there's a specialty within the finance ministry. That's not the discussion is easier because then resources are scarce and we need to fight for a sheet, but it allows that dialogue and a different understanding of problems that are proposed from the Ministry of Health. So in a scheme which is probably different because we were talking with Wilson about that the Ministry of health fights in finance funds that are joined for the sector. It's not that the public sector that what I'm fighting. What I'm asking is resources to pay my physicians or to hire more physicians because the Ministry of Health does not have any compensation. It's not like a healthcare provider. So the agenda is different, the discussion is different, but I think these two experiences could contribute to the discussion.
Gracias, Gaby.
Thank you, Gabby.
No sé si
I
Angélica
don't
o
know if
Claudia
Angelica or
quieren
Claudia
referirse un
want
poco a lo
to
que Pascal había,
to
la pregunta
comments
de Pascal.
to Pascal's question.
Ya, a ver si conseguimos. ¿Quién parte? Pónganse de acuerdo, por favor. Qué bochorno para el país, por favor.
Por favor.
Please agree. That's embarrassing for the country. You do not agree.
Ah, muy bien. Eso es
Okay, very good.
una muestra de transparencia.
That's a demonstration of transparency. Okay, good.
Yo quería hacer un comentario
Okay, I wanted to make a
que va en
comment
función también de lo que dijo Roberto.
around what Roberto said.
El compartir información con
Sharing
Hacienda en Chile es
information
un
with Ministry
proceso
of Finance in Chile is
institucionalizado
an
donde
institutionalized process.
nosotros trabajamos con
We
el
work
sistema de
with
información de recursos humanos en
the
salud, que es el
human
CIRACHE,
healthcare,
y a
human
partir de
resource
eso, toda la información
information
que
system,
generamos
and starting from the all
trimestralmente
information that we generated every
queda
quarter,
en unas matrices. Y
it's in
esas
some
matrices se
matrices, and those
cargan en un
matrices
sistema
are
general de
uploaded
IPRES.
to a
Entonces,
general
la
system
Dirección
of
Nacional de
IPRES.
Presupuestos
So the
tiene
national
nuestra información de
budget
cuánta dotación
department
tenemos,
has
cuántas
information about
asignaciones,
how much
cuánto ha sido nuestra
dotation, how much
ejecución,
allocation, what has been our
hacemos ver el
execution has been.
comportamiento. Y
We
también hay
check
otra
on the behavior,
instancia
and then there is
donde
another instance
Angélica lo
where
graficó muy bien cuando
Angelica
hablaba de abrir la cocina, que eso
opened
sí no está
the door there,
institucionalizado porque
which is
nosotros
not
tenemos un sistema de IPRES donde
institutionalized,
nuestras formas de trabajo,
which is our ways of
las
working,
metodologías, cómo
methodologies,
nosotros estimamos las
how we
brechas,
estimate
eso si
gaps.
bien no está puesto en ninguna parte, sí lo
That's not
compartimos
put
con
anywhere,
Hacienda. Entonces tenemos
but we
estas dos
share
formas.
with
El
finance.
trabajo de ejecución que está
We have two ways to
institucionalizado y
work,
estas otras
the execution
formas de
work, which
compartir
is
información a
institutionalized,
través de
and these other ways of
mesas
sharing
técnicas.
information through technical boards.
No sé si iba por ahí.
Yo estas
Sí,
cositas
la
las
de
sé, pero
Pascal.
ya estuvo bueno, Pascal. Yo sé estas cositas, pero siempre quiero encontrar como una mejor palabra o algo así. O por lo menos estar seguro de que realmente.
Pascal, lo que preguntaba
What
eran
Pascal
dos
asked
temas
was two
específicos.
specific
Un tema era,
issues. One of them was
dijiste que salud
you said
no había
healthcare
disminuido,
hadn't increased,
había mantenido el nivel de
they
inversión.
had
La
kept the
pregunta es
investment
si
level. So
otros
the question is
sectores
if
también
another
mantuvo,
sector
los
also
otros
kept,
sectores también
if
mantuvieron
the other sectors also
el
kept
mismo o
this,
fue un
this
beneficio, digamos,
the
en
latter,
salud
or
que
if
se
there
dio
was
que
a
se dio.
benefit in
El
health that was
segundo
kept.
tema es,
The
dado los
second,
retos a futuro,
she's given the
¿cuál
challenges
piensas
for the
que sería la
future.
estrategia,
What do you think
sí,
will be the strategy
para aumentar la inversión en salud?
to increase the healthcare
La
investments?
segunda parte no la había
The second part I hadn't
entendido desde el
catched,
principio, ¿sí?
I hadn't caught it very well.
No,
Oh, totally like
salud fue el único sector
no,
que
healthcare was the only
en el
sector
presupuesto
in the
2023,
2023
a pesar
budgets,
de otros
in
sectores
spite of other
que no
sectors
crecieron tanto, pero
who did not
ese
want so much,
Servicio de
but
Salud
one says, okay, this is
mantuvo
healthcare,
su presupuesto.
kept its budgets,
Y en estricto rigor,
and
en la
very
lógica de Hacienda, hay un
strict
aumento del presupuesto.
rigor.
¿Por
There's
qué?
in finance an
Y
increase in
eso
budget.
es verdad. O sea,
What?
el
Because it's true.
presupuesto en régimen
The budget in the system, in the regime, did not did not decrease. It was the same, but
recursos adicionales.
there were additional resources. If
Uno
we're looking for the sector,
es que se ajustó
one is
lo
that
que
it
se llama en
was
Chile
adjusted,
el
what we
per
call it
cápita,
the per
que es la
capita in
fórmula
Chile, which
a
is the
través de la
formula
cual
through
se
which
estima el
it
presupuesto
is
para la
estimated the
salud
budget
municipal.
for the municipality
Eso
health.
se ajustó.
That was
Entonces,
adjusted.
ya
So
ahí tenemos un ajuste,
there we have an
más
adjustment
los
plus
recursos extraordinarios, que son extraordinarios, y
extraordinary
eso es
resources, which
delicado,
are
¿no? Porque
extraordinary, and that's
Hacienda nos ha
very
dicho,
delicate
no
because
cuenten con este presupuesto
finance
de
has said
manera
do not
permanente. Los recursos extraordinarios son
count
hoy
on this
día
budget in a permanent way.
para
Extraordinary
fondos
resources are
ya
nowadays to
postergados
take care
o
of
listas de espera.
extended care or
Son
waiting lists.
extraordinarios,
They are
tenemos un
extraordinary. We
compromiso
have
firmado por
commitments
con cada
signed
uno de
by
los servicios de
with
salud,
each
eso
of the
también porque
healthcare
alguien lo
services.
mencionó, ¿no?
That also because
En
someone
ese,
mentioned it,
en
right?
ese
And
compromiso
in that
hay
commitment,
cumplimiento de metas
there's a completion of goals. That means how many people are going to decrease the waiting time or going to get out of a waiting list. Finance is giving us those extraordinary funds. So we say budget did not increase, finances budget did increase, did increase. It didn't happen so in other sectors. Generally, 2023 budget had a lot of restrictions for other sectors, important sectors as tourism, public works, education, which was also a bit affected by budget finally approved. The second question, complex, I don't know if it's my, of course, we, how to continue to increase the healthcare budget. Really, instead I'm going to talk more than what I personally could believe or not, because nowadays is actions that we're doing. This work that we're doing with finance, for instance, you're sitting and participating in the discussion groups or boards uh, uh, to be reformed, no matter if structural reform of a country, the political environment of a country is not too proper for that. But it has been established that the healthcare system needs to improve and strengthen, and mainly there is a concern from ministry and deputy secretaries regarding the human resource. So what we are doing is to identify those surroundings where we need the system to strengthen itself, not to talk about a reform. One of them is human resource. Second, compensations or salaries. That means there's a commitment to review the functional career and therefore to improve the um, compensation system. That means everything regarding allocations that Claudia mentioned is very important in the healthcare sector compensations. The base compensation really doesn't give the same, but base compensation is very insufficient or insufficient in payment compensations for sector in itself. All allocations in regards to the question to continue to grow in the sector. I think what we did in this budget, in the budgetary part, but the question is there. But the way how we face the discussion of 2023 budget is to leave certain lines, programmatic lines established in the for the following 4 years, which is as far as the government period takes. Those part of the discussions that we're going to have in the following budgets, right? Is it understood? Like the design of the budgetary formulation in 2023 established the lines that we're going to continue talking to finance about for the next budget. Like we did a planning and we said, okay, during the 4 years, this should be the environments where we need to continue improving in healthcare. As we did a planning of the following budgets for the 4 years. I don't know if I kind of answered.
Sí, Claudia,
Yes,
micrófono.
Claudia, microphone. Just to
Señalé que
complement
para
what
responder la
Angelica
pregunta
mentioned to
actual,
answer Pascal's question,
trabajamos
we
mucho por
work a
planes
lot
nacionales, que eso es lo que nos ha
by
permitido
national
además
plans or
crecer
through national plans. And that
enfocándonos no
besides
solamente
has
en el
allowed us to
recurso
grow
humano,
not only in human
infraestructura,
resource, but
equipamiento,
also in
hay un plan
infrastructure and
nacional de
equipment.
inversiones
There is a national
que
investments plan,
históricamente
which historically
fue muy reducido. La inversión en Chile en
was
materia
very reduced. Investment in
de gestión de
Chile
personas y
in
de
terms of
hospitales
management of
estuvo
people and
muchos
hospitals
años
for many
estancada
years was like
y
stuck.
en los últimos
And
15
in
años
the
hubo
last
una expansión
15 years, it
tremenda.
had
Hoy
a
día estamos
tremendous
con
expansion.
103
Nowadays, we
proyectos de
are with
hospitales que se están
103
remodelando,
hospital
hospitales
projects that
además
are
hoy día
hospitals
que
that are
se
being
que se
remodeled,
construyan
refurbished,
y que no
um,
existían para el
or
polo
being
donde ha
built, which
crecido
did
mucho la
not exist for
población,
some
y esos
towns where
hospitales llevan
population has grown. And
equipamiento,
those hospitals
infraestructura,
have
modelos,
equipment,
carteras,
infrastructure,
nueva
models,
tecnología,
portfolios,
mucha
new
inversión de
technology,
recursos
a lot of
humanos, además
human resource
especializado.
incorporation. And besides specialized
Tenemos
human resource,
también
we also have
en la atención primaria más
in
de 2.000
primary care, we have
proyectos
more than 2,000
de
projects.
inversión en
Nowadays,
ejecución
there are
ya,
100 already in
y ahí hay una
execution.
variedad entre
And
las
there is a
costas
variety there
desde pueblos
between
rurales hasta
from
grandes centros
rural
de atención comunitaria, que
small
también
centers
están en
to
este plan
large
de
community
inversión,
care
y
centers
tenemos
where
los planes
they are
nacionales
also
que
in our
piensan
investment
en largo
plans. And we have
plazo.
the
El
national
plan
plans that are
nacional de
long term
avance ha
nowadays. The
significado
cancer national
hacer
plan
crecer la
has meant
infraestructura
to make hospital structure grow and to have new oncologic centers. We have 5 centers nowadays in different parts of the country that are that work besides taking care of macro zones, macro regions, or macro areas. In mental health, we're growing a lot with many devices, and there are devices that are new that are being added to either existing hospitals or hospitals that are going to exist. And the same as we have those plans, we also work with smaller projects which are improving hospital infrastructure, and that requires no investment as technologies advance. So independently of the reform from the reforms that are very important and that give us a challenge and that are going to create an important need of resources, there's also this other line like continuity. Therefore, the sector is renewing itself through these policies, and also we get to generate an increase in healthcare investment. Indeed, our GDP has grown like in 6 points in the last 10 years.
Perfecto, muchas gracias, Chile.
Perfect.
Otro
Thank
aplauso
you
por
very much.
la
Chile, another round of applause for having done in such a short time this presentation.
y creo que ha sido muy
And
ilustrativa
I think it has been
y
very
me dan ganas de seguir
illustrative,
explorando
and
esta
it's good to
línea,
continue to
digamos, de
explore
la
this work
relación
line, the relationship
entre el
between
sector
healthcare sector
finanzas y
and
economía.
the finance
Yo no
and
sé si
economy
ya
sector.
Benjamín
I don't know if
Puertas,
already Benjamin
nuestro
Puerta, our
jefe de unidad
unit chief
de
or chief
recursos humanos en
of human
Washington, está
resources in
conectado para
Washington, is
darnos un
connected to give
saludo.
us a greeting. Okay, let me hear you.
Lo tenemos esperando hace un rato, Benjamín.
He's waiting for a long time already,
Ahí está
Benjamin.
Benjamín.
Here he is, Benjamin.
Bienvenido, Benjamín.
Welcome, Benjamin,
Sé que has
Benjamin.
estado
I know
siguiendo
you've been following us
por el Zoom
on
la
Zoom,
reunión.
following the meeting
Así que
on Zoom.
bueno, y
So,
que
okay.
tendría que haber estado acá, pero las
And
razones de salud no te lo
he
permitieron.
should have been here,
Así
but
que
because
por
of
otro
health
lado, tenerte por
conditions,
lo
he
menos
couldn't be
en
here. But
pantalla.
it's nice to have you at least
Y
on
bueno,
screen.
esperamos
And well, we
tu saludo y
expect
tus palabras. Adelante,
your
Benjamín.
remarks. And the floor is yours,
Muy
Benjamin.
buenos días a todos y todas. Solamente
Good morning
confirmando
to
si
all of you.
me
Just
escuchan.
confirming that you can hear me. Can you hear me?
Sí, te escuchamos bien. Vamos a pedir que
Yes, we
suban el
can hear
volumen
you okay.
acá.
I'm going to ask them to raise the volume here, but we can hear you okay.
Excelente, muchas gracias, Hernán. Y yo creo que esa sala está llena de amigos y
Excellent.
amigas
Thank you very much, Hernan. I think the room is full
del
of friends
pasado, del presente y del futuro.
of the past, from the
Así
present, and from the
que nuestros
of
saludos a
future.
todos y a
So
todas.
greetings to all of you.
En verdad, me cuesta mucho no
Really,
estar
it's
con
hard for me
ustedes
not
personalmente,
being with you in
pero como bien
person,
lo explicó Hernán, por una
but as what
situación
Hernan already
de salud
explained,
no
because of the
puedo
health
acompañarles.
conditions that I have right now,
Sin
I
embargo, he estado
cannot be with
siguiendo
you.
algunas de las
However,
presentaciones,
I've
no
been
todas,
following some of the
un
presentations,
buen
not all of them,
número.
but a
Y
good
creo que
amount
ha
of
sido
them.
muy interesante
And
escucharles
really, it's been very interesting
y
to hear
aprender de
you
lo que está
and to
haciendo
learn from
Sudamérica.
what South America is doing.
Em, Creo que los tiempos que
I think
tenemos ahora son muy interesantes para
times that we're having
los
right now
mexicanos
are
para la salud.
interesting for a healthcare
Hay
HR.
varios temas
There are several subject matters that
probablemente ustedes ya han escuchado. Uno de ellos
probably
es
you've
la
heard of
iniciativa
already.
de
One of
Fuerza
them is
Laboral
the
de Salud
labor force
2030.
initiative
Es una
in
iniciativa
healthcare 2030. It
del
is
gobierno de Estados Unidos con la
a
OPS.
U.S. government initiative with
Y
PAHO.
también quería comentarles
And I
que
also wanted to mention that
ya tuvimos la aprobación para
we already had the approval for
enviar una propuesta luego de haber sido
sending a
aceptada por
proposal
Comisión de Interés para
after
una
our
propuesta de
interest being
primer
accepted
país
for a
del
proposal of
fondo de la
multi-country
pandemia del Banco
of the
Mundial.
pandemic fund of the World
Así
Bank.
que estamos esperando
So
fondos interesantes
we're expecting
para poder
interesting
finalmente crecer
funds
en el área
to finally being able to grow in
de
the
recursos
area
humanos
of
para la salud de las Américas.
healthcare HR for the
La
Americas.
iniciativa, yo creo que algunos o todos ustedes han
The initiative, I
podido
think some or
saber
all
un
of
poco
you
más
have
de
been
ella,
able to
pero
get to know
así
a
en
bit
pocas
better about it.
palabras son 5
But
pilares
briefly, it's 5 pillars
que se busca
that
alcanzar
are sought to
con
be
iniciativa. Uno
achieved
tiene que
with
ver con aumentar el
initiatives.
acceso y la
One of them
disponibilidad
has
de
to do with
personal de salud,
access and availability of
algo que ustedes
healthcare
venían
staff.
mencionándole
Some of you
todos
have
estos
been
días.
mentioning
El otro
throughout
es el
these
componente
events,
virtual
all of that.
y
And the other one
específicamente el
is the
desarrollo del
online
campus virtual
component, specifically
de la
the development
OPS.
of the
La
online
tercera
campus
tiene
of
que ver
the
con formar
PAHO. The
liderazgo
third one has to do
futuro
with
en la
training
gobernanza de la
future
salud y la
leadership
administración
in
de la
governance
salud
of
pública.
healthcare and public healthcare
La
administration.
cuarta, establecer un consorcio de
The
centros
fourth is to
académicos de
establish a
ciencias de la
consortium of
salud y
academic
salud
centers
pública
and
en
sciences of
Latinoamérica.
healthcare and public health
Y por
in
último,
the
mejorar la
Americas. And finally,
participación y la
to
innovación
improve
del sector privado
participation and innovation of the
para
private
el
sector
desarrollo de esta fuerza
for the
laboral de la
development
salud.
of this
Las
healthcare
metas
labor force.
son bastante
Goals are very ambitious. 500,000 healthcare professionals trained in 5 years. And that is why we're seeking to generate this partnership to find new partners. And well, PAHO as part of this initiative is taking very important steps in supporting the efforts of countries. And from there are two additional topics which are very related. And it is that this year we will do the final goals measurement of the human resources strategies for healthcare and its action plan. And that will allow us to have a very important baseline which would allow us to advance in the next steps. And what is the next step? A policy proposal which is called 2030 Labor Force and Resilient, which will be submitted to the PAHO um, officials, in which consultations to countries will start on April, in April. So that's why I would like to tell colleagues from PAHO and colleagues from to mention this, which a consultation processes will start because they are all totally linked and tightly uh, bond processes one from the other. And
Se nos quedó congelado, Benjamín, a ver si
Benjamin get frozen. Let's see if
logramos. ¿Es de la fuente? De allá. Ahí está Benjamín.
it's
Te
from the
había
end. That's
congelado y ya
Benjamin there.
volviste.
Yo mismo me quedé así paralizado un rato, pero no, mentira.
I myself stayed like that, paralyzed. But no,
No sé hasta qué parte me escucharon,
I don't know
pero
up to
decía
which
que
part
todos estos
you
pasos
heard
están
me, but I was
totalmente
saying that all
ligados
these steps are totally
y
linked
que estamos haciendo
and that we are
varios esfuerzos para
making
que
several efforts
tengamos productos sumamente
so that we
importantes
have
y
extremely
visibles
important
para la
and
región de
visible
las Américas.
products for the Americas.
El tema de la política ha sido algo, y lo que
The
usted está
issue of
discutiendo hoy,
policy and what you're discussing
muy
today
importante.
has
De
been something
hecho,
very important.
la
Indeed,
sesión especial de
the
las
special
Américas del
session of the
Foro Global,
Americas of the
del Quinto
global
Foro Global de
of the
Recursos
fifth
Humanos para la Salud, que será del
HR
3 al 5
Healthcare
de abril,
Forum, which will
tiene
be
este
from
tema,
April the 3rd to the 5th, has
políticas
this
de salud en
issue.
las Américas,
Healthcare,
políticas de
healthcare
recursos humanos para la
policies,
salud en las Américas,
human resource policies
y
for the
compartiremos
Americas.
varias de las
And there we
experiencias
will
pues, que
share
ellos ya
several of the
han
experiences that you
comentado por
have
estos días, en estos 2
mentioned
días.
these
Las del
2 days.
Caribe, que son muy
The ones
interesantes
of the
de tocar,
Caribbean, which are
porque ha
very
sido
interesting,
también
a different approach
un
maybe,
avance muy
but
interesante
also a
allí,
very interesting
y las de
progress,
Centroamérica.
and the ones of Central
Entonces, yo
America.
creo que
So I believe
esos
that
espacios son importantes, pero más
those
que
spaces
nada
are important, but not
las
more than anything,
oportunidades que se nos presentan,
the
que son
opportunities
oportunidades
that
y también grandes
we
desafíos.
we find, which are
Desde la
opportunities but
perspectiva
also
de OPS,
challenges.
también quería comentarles que a
From the
raíz de
scope of PAHO, I also wanted to tell you that
del juramento y juramentación del
starting
nuevo
from
directorio, el doctor Barbosa,
the oath,
hace poco ya
uh,
se dieron
the,
los cambios que van
Dr.
a tener
Barbosa,
las
changes were made
diferentes
already.
áreas
The different
del
areas
OPS,
of
y
PAHO
una
will
de las
have.
que sale fortalecida es la de
One of the
recursos
ones that
humanos
was
para la salud.
strengthened is the
En
one
ese
of
sentido, yo quiero
healthcare human
también
resources, and in that regards, I would
contarles
like
esto
to
porque
also
estamos
tell you
entre
this
amigos,
because
amigas que
we are
han estado
among
trabajando y
friends
seguirán
who have
trabajando en
been
este tema.
working and will
Entonces, yo
continue to
creo
work on
que
this
eso
issue.
implica
So I
que la
think
cooperación
that would
técnica que el
imply that
OPS pueda brindar
technical
a sus
cooperation that
países,
PAHO
sobre todo
can
Estados
give its
miembros, va a ser
countries to its
mucho
member
más
states,
eficiente
it's going to be more
en calidad y
efficient in
ahora con
terms of
financiamiento.
quality and
Ese es
with
el objetivo, así que
co-financing,
quiero
co-funding.
invitarles a ser parte
So
de todo
that's
este
the
proceso.
purpose, and I would like to invite you to be part of
Ustedes son
this
a quienes
process.
debemos como Estados
You are
miembros,
who we
y nosotros
are
estamos
for as member
totalmente
states,
dispuestos
and we're totally
a brindar nuestra cooperación técnica para
willing to provide
obtener
our
los
technical
resultados en recursos
cooperation
humanos
to
para la
achieve
salud en la
resource
región.
and human resources
Eso
for the
nada más,
health in the region. That's pretty
así
much
que
it, and
sé
that's pretty much it.
que han
And I know that
tenido sesiones
you've
largas, yo no me
had
voy a
long
extender más.
sessions, and we're gonna go any
No
further.
quise hacer una presentación
I
formal
didn't want to
porque
make a
creo
formal
que
presentation because I
lo de
believe that
America's Health Corps o Fuerza Laboral de Salud de las Américas es
the
un
labor
trabajo
force
en
is the
proceso
core of the Americas.
que
It's
va
a
a
work
sufrir
in progress
cambios,
that's
que
going
van
to
a tener
go through some
mejoras,
changes. It's going to have improvement,
y creo que el tenerles a ustedes de
and I
aliados
believe that
desde
having
ahora,
you as partners
de
since now,
críticos,
like,
y
who are
nos va a
crucial,
permitir poder avanzar en este
is
sentido
going to
y
allow
poder
us to
hacer un
progress
trabajo
in this sense and to
que
do
beneficie al recurso
a
humano y
work
salud de
which
las Américas.
benefits the
Muchísimas
healthcare
gracias.
HR of the American.
La
Thank you
disposición,
very
yo creo
much.
que van a tener
For sure, you will have
resultados muy interesantes de
very
los
interesting
cuales me
results from
gustaría
discussions, and I'm gonna
gustaría
be
leerlos,
up to them. I would like
revisarlos y
to read them.
discutirlos.
I would like to read them
Un
and
abrazo
discuss
fuerte a la
them.
distancia
Strong
y
hug
con
from a
todo
distance,
gusto
and
para seguir
I'll be
apoyando.
pleased to
Muchas
continue
gracias.
to support you. Thank you very much.
Round
Round of applause for David.
Por
I don't know if you're
supuesto,
hearing the round of
viendo que
applause.
no estoy cargando.
Of course, nice. I was going to tell you that one of the things why we miss Benjamin Puertas is not only because of his presence here, but also because he is a um, compositor, composer. He's Ecuadorian, he's South American, and he plays Indian music of very good level. He composes, and every meeting that we have, it is mandatory that Benjamin opens the meeting or with some songs. Starts with Benjamin singing. We all sing, and well, and Monica also, the Ecuadorian group. Monica also sings, and it's it's a duet. So look for him in Spotify, Benjamin Puertas. He's got two songs. Besides, he's a writer.
Chili
I don't know
está
if
en Amazon.com.
las que dijo, multi-purpose, que las que dijo. No, no, pero lo que él dijo ya. No, but the next thing, there's no excuse for you to be present. And well, we're gonna continue here with a break, with a Colombian coffee break. Not Juan Valdez, but it seems like it's a good coffee, like in Colombia. Thank you very much, and we're gonna be telling you how we're doing.
Listo. Saludos. Gracias.
It's nice to see you. Thank you. Okay, thank you.
Vamos al café. Pausa café. 15 minutos y volvemos ya con la presentación de los países que no fueron parte del estudio.
We're going to summon the participants. Deborah, can you come here, please? Walter. Ese por ahí cerca no dice que empiece a toda mierda este berraco y... Hernán, Mario, Rodríguez, Joel. Es que no está. Where's Brazil? Well, Brazil is not here and at the floor. Bolivia is also not present. Chile is complete. Sure, it's complete. Chile is complete. Here comes Bolivia. Brazil is not present. They're not even outside. Julio Pedro's Brazil. Here's Brazil. Julio Pedrosa, please. Okay, first notice after arduous negotiations, we have access to internet. I hope it doesn't shut down. So this is done to show to prove your patience. We're taking notice of all your reactions. But there's two access codes. 001, OPS 001. The network is the same. And OPS 002. So whatever you want to choose, they're enabled for 30 seconds. So take advantage for 30 devices. There's a 1 on one side, 002 on the other. We have a crisis of identity. We're going to start with, because in these types of events, time is always a constraint. Well, we're going to ask all the countries to do continued presentation, and then we'll have please take notes, and then we'll have a general discussion. These were the countries that weren't in the study but have listened to the discussion. So we'll start in alphabetical order with Argentina. Champion of the world, soccer champion of the world. Emiliano, please go ahead. Thank you for this is an honor to be here with in this here with all of you, all the personalities, and thank you to everybody has been outside and making this possible. And so we're going to start now. I need the device to to turn the slides. Okay, here we go. The impact of COVID-19. The first challenge of human talent in Argentina is like summon all those challenges in one slide. The availability of the human resources in healthcare are a summary, are the result of a lot of factors that have been that we have spoken and you have put in as priorities. This has allowed us to talk about the factors that have influence. In Argentina, we have a very particular activity. We have 38 medicals for every 1,000, and 37 to 58 nurses for every 1,000. If we don't if we don't have assistants, if we don't count the assistants, we are trying to professionalize these assistants. The worst scenario is 37 plus 38 is 75 healthcare workers or physicians for every 100,000 works. However, there are some issues. On one side, when we see the distribution in a federate country, it's unequal. The second problem is how many are specialized and some are not. 50% of not specialized and 50 are. It could be or could be not, depending on the uh, medical issues. The orange is the specialization is very low. This specialization is correlated with the indicator, the healthcare indicators. So where there are less indicators there of first tier workers, there's more mortality. Many are not in the rural areas where we need the most. Another issue is not the same. Is not the same to have 53 very well paid and incentivized workers, connected, attentive, and assisted, fresh, than 53 or 21 or 30. That number doesn't work. Not paid well, word off, with few tools. So the rates have are biased that we need to tend to. So the last two publications say the MSET say that the 2019 that we have a good number of in rates, but our coverage, effective coverage, it is not even 80 to 100. We are in 61%. We're not. You don't have the optimum rate in healthcare workers. How are they working in their activities for this to tend to these issues that we have seen? Having high rates like in Buenos Aires, like 120, 120 for 1,000, 100,000 inhabitants. There's other issues, competitiveness, contracting, hiring is impoverished. High rates are not a guarantee of good care. So this is the things that we have to tend to in our country. And the other thing is the planning, and we need to say that after the pandemic, Argentina put in their agendas to their a human talent plan, and we have a lot of projects and actions The challenge is generated with all this to generate a plan with all these challenges. Let's see what we did at COVID with the challenge you posed. The information data analysis gave us an opportunity a few years ago. We put in digital agenda. We're working with new technologies, big data, and more than ever, the pandemic demonstrated how can we have available data and ready that will allow us to take fast decisions. So this is something that's working right now. It is fed by the national system in healthcare that emerged from the pandemic. It came from the pandemic. There's two maps, one from medical residents and the other is from nurses. The blue ones are in the clinicals, and the green ones are therapists, and orange are uh, child therapists. So they would have some impact in some places and not in other. But we do have them in tables and we have them in registry. But if that information does translates into information, we didn't have knowledge of the cycle of the data. This is what happened. It's not something desirable, but this was nursing. We need to discuss with between the layers, mortality, natality, birth rate, and the dementia of the dementia that impact the healthcare. This is a challenge. So we consolidated the for 10 years this has been in existence, but we reformulated it. We can't fall into the syndrome of diagnosis of the situation. We have to look into future scenarios, need technology, needed ample teams, psychologists, and this is the challenge, using technologies to help us guide us where we have to take actions. There's the map of two interactive maps that are working now. They're public, they're open data. Uh, Governance for healthcare. We could do a whole presentation of this. The passion is. Governance is difficult in a federate country. The budgets are delegated. Where, there are different diseases depending on each other countries. So governance. So in governments, we all agreed that we all needed to have the same action plans, and they created the COFESA, the Federal Commission for Healthcare, and we renewed the National Commission on Nursing. Uh, and this brought concrete actions. This didn't exist before. Now it exists, and now we're going to discuss this: the formative, the training, the skills, and what we did and how we trained these. We taught these technologies. We don't have the regulations yet. This was done in 2022. The plan, human talent national plan that PEJA is also participated, is all helping in building. The National Commission on Human Talent, there's 13 of the 13, 10 of 13 that are talking about this and putting the agenda. And these are one of the many problems the issues that we have. That putting human talent in the agenda is not an easy achievement. And nursing, I didn't talk about it. We had a human talent for nursing and uh, for knowledge. Knowledge is not only about resources.
¿Qué hicimos a nivel de la disponibilidad y la
What did
distribución?
we do about disponibility, availability, and distribution?
Ustedes ayer hablaron de cómo redistribuir y han
We talked yesterday how to redistribute,
pero sí contar dos o tres cuestiones
but
muy
let me
específicas
tell you about
que
two or
han
three
tenido
things
impacto
that we have done
importante.
that have a had a high impact and important. And in fact, it was researched by people that was it's called a system for information
Un estudio
for
cualitativo
this for a qualitative
de
study
seguridad, focos
for
grupales,
security
donde el resultado
where we have results.
escrito es muy potente para hacerlo
This is very
política, ¿no?
powerful to make it policy. So what did we do? We did active residence.
Ustedes tienen que redirigirse, llamar
You have to redirect and do the different things, different activities. You
hacer
c-
guardias en otros lugares
you
porque
can't go to different persons. You have to go where the public needs you. We recruited 3,000 physicians.
postulantes a residencia.
So every year there's 10,000 people that want to do their residencies. So they would add rapidly to here.
Marzo,
They do the testing in April,
imagínense en aulas de
and then they have their first impressions, their first test,
tuvimos que tomar una decisión que
where
no
there's too many
en
people.
la literatura, hacer un examen de residente virtual.
They did a residency test, a virtual residency test, because there was too many applicants.
Entonces digo, dijimos, no podemos no hacerlo porque es gente que no se
Then
va.
we said we can't do this, so we did a digital exam. This is a project that everybody's connected
Desde el punto de vista de las estrategias de capacitación, creo
from
que
the training.
me sobra, ya termino. Bueno,
This is the
básicamente
training strategies. We need to train fast in 10 to 15 days.
conflictos pero claro, pero bueno, usamos nuevos modelos. Lo más
We
importante
use two models
slide
of this. The
el
most important of this is a digital test
tiempo real,
in real time.
preguntas respondidas
Uh,
por 10.000 postulantes,
1,000 questions and answered by 10,000 respondents.
de aprender rápidas,
This was a live streaming event
chicos.
that need to do this very fast.
Lo que había que hacer era resolver las cuestiones.
We needed to resolve things in really fast.
Terminando,
And at
los
the
planes
finishing,
bueno,
the national plan of workers during COVID-19
cómo no se enferman.
to see how they do not get disease and be and be careful not to get infected and to attend to the problems and the current strategy and mental and these are other relevant things is that what we need to do, we need to discuss, we need to the calculation of the gaps. We need software to help us determine what are the gaps and for possible future pandemics. So we need to strengthen the information systems and georeferencing of in function of necessities of needs. What is happening? What do we need? And test and teach people in these areas.
Ya terminando, entonces, con información
With
diseñada.
the information, we have other relevant topics to respond. Integration, greater regional, subnational, and sectorial integration in digital healthcare, greater articulation between education and healthcare, and prepare students and alumni, and working through new formative frameworks and micro credentials. We need a driver's license for these little things, so people in the regions will have how to act and how to get directed. We also work training, improve the learning conditions and working conditions to avoid labor wear off, and with new laws, financing, incentive policies for rural areas that are not tended to.
todas estas cosas que se hablaron, esas determinaciones sociales, vamos a
I
evitar
mean,
el
the
desgaste.
social determinant and avoid
Bueno, nada más. Muchas gracias.
labor wear off. That that is all. Thank you.
Muchas gracias, Emiliano. Gracias por la síntesis, acotar el tiempo y muy bien, muy interesante todos estos aspectos. Sigamos entonces ahora
Gracias.
con Brasil.
Que coja Brasil, que yo no entiendo nada.
¿Está? Gracias. Entonces, buenos días.
Vamos a ver que pongamos la otra
Good
presentación.
morning.
¿En qué idioma vamos? ¿Portugués? Es una
What
broma.
language are we on? Portuguese?
Pero habla muy bien español.
You speak?
Entonces, primero es un placer estar con
Trying it. First, it's a pleasure to be with all of you here, sharing what we do,
hablando un poco antes de la presentación para ganar tiempo.
presentation to gain some time. I'm gonna start a bit with the country juncture. All of you know that
Muchas
we are in
acciones
a
que
new
habíamos
government.
desenvolvido fueron descontinuadas y hay
Many
acciones que estamos
roles were discontinued and now, or actions were discontinued, and now there are new actions that we're taking.
reduzido por
We have
momento.
reduced
Ok? Então vamos. Quem passa o
work.
aqui está. Assim, para lá.
So there we are.
Ahí está. Entonces,
There it is.
mi nombre, la función
Name, function, ministry.
y aquí está un poco de lo contexto.
Well, here there's a bit of the context. Considering that the unique healthcare system is
Desde 1988 somos nós, o Ministério da Saúde, junto com os estados
institution since
os
1988.
responsáveis
We are the
pela formação
healthcare
e pela gestão de trabalho em saúde. A situação que temos em Brasil é como de vosotros. As mulheres são a grande maioria da força de trabalho, da força laboral,
formalization
na
and
assistência,
institutions
mas
this way.
também
That's
na
why
gestão,
of course,
ocupando cargos de gestão. E neste governo, muitas ministras são mulheres, muitas secretárias também.
only in assistants, but also in deputy ministers, different work relationships in one service. Here, there is also a set
Que é
of
muito
challenges that we have, which is very important for Brazil. We have a system which is universal. Historically, we had a lot of public officials in the federal environment as well as in the states and municipalities. With time and with the law of tax responsibilities, we can hire by contest. So we started to hire management models which were doing different contracts. In some services, we have people with different contracts and different payments. So all of this is a challenge. We have unequal salaries between men and women. Now we have a very updated study on this for the medical field.
Pelo que
Women
não ganham, como os médicos,
majority, but
isso
they're not
uma
earning
situação
as physicians. That's a very complex situation. I'm going to talk about a program that we launched on March the 7th as a commemoration of the International Women's Day.
dimensionamento da força
We
de
have an absence
existente e
of
a pandemia
dimensioning in the workforce.
não
Pandemic left this very clear. We did not know how many workers we had and how we could mobilize them through a continental territory as it is Brazil. And also
estamos desenhando para
the need of the study healthcare education. And we critically understand that there is the
companheiro aqui que falou que temos muitas
there was a
instituições
colleague here who spoke that we have a lot of private institutions that are training their healthcare professionals in Brazil, and that's a great problem. Or that
único de saúde. Não são
the
formados
private
profissionais
systems do not communicate with the public healthcare system and private faculties are different from public universities. They don't take on the healthcare system. Then those professionals go to the public healthcare system. Many professionals work in the public as well as in the private sector, as you were saying. We also have low regulation in the healthcare training, a number of vacancies place for opening of graduate course and residence. Here, there's an important coordination that we have with the Ministry of Education right now. We need to decide together where we will open spots or slots for graduate courses, not only medical courses, but nursing, psychology, therapy, because we have a large concentration of training teams in some places of the Brazilian states and some gaps in others. This implies the supply of professionals. This has an implication in the supply of professionals. Okay, you understanding? Yes. How are we doing? So the five priority subjects.
Aqui, o uso de dados. Estes 5 temas são muito
Data
interessantes
use. These five subjects are very interesting because they dialogue among themselves. So for instance, here, the challenges of improving and integrating the existing information systems, the action which is very current in government is the creation of the healthcare secretariat and digital health. Uh, in some of states and municipalities are digital secretariats
gestão de informação em saúde.
that
Agora
work in
temos
all the
uma,
production and management
ok?
of
E
information.
que
Now we
quer
have
essa
one.
secretaria?
What are the objectives of those secretaries? Improvement of information and communication networks in health
De atenção e
with all the care leaders and the system leaders. Dialogues of information between municipalities with the states and with the Ministry of Health to improve the healthcare. At this time, we're all looking at how we'll get and to improve the quality for Brazilians. Implementation of organizational technologies is also a goal of the digital secretariat in regards to structure and also for the processes for management of information and also for decision making in management in the clinic. All telemedicine will be there. Now, also developing skills for the technological assessment and its operational aspects of cost benefit and effectiveness, and creating follow-up and evaluation indicators. We have an example, the field of policy that we call
não
permanent
hablamos
education policy. We talk
não
about
também
human talents in Brazil
uma
of human
entendimento
resources because we have an understanding. We make a defense which is higher than a resource. The subjectiveness or subjectivity, training for work and training for healthcare education. And here we created 4 years of work for the states. Indicators of monitoring and assessment of information plans assessments. So these indicators are an example of analysis of financial investments that we have, as well as the understanding of healthcare education, right? That was about data. Now, availability and distribution of human resources. With the planning of healthcare labor force, here we have some conditions of sizing of workforce, of, of labor force. We need to define everything, indicators of criteria and parameters considering a design of care networks, which is how a unique healthcare system is set from a regional perspective, uh, territories, and distribution of services by level of care, tier of care. But there's also thought in every tier. Strategies of studies that we're designing to overcome these difficulties in the healthcare systems with demographies. We have a very recent presentation, medical demography. We want to advance for other healthcare workers in
provisión,
distribution
retención,
analysis,
retención,
provision,
porque muchas veces
retention.
tenemos categorías profesionales, muchos,
Because
por
many
ejemplo,
times we have
tenemos
a lot of
mucha
professional categories. Since nursing, we have a lot of training, a lot of faculties, but we need to analyze the quality and the distribution. We also have here for the availability of distribution, the need of rethinking the regulation of the healthcare work, regulation of healthcare professionals, as well as of their professional exercise in the environment of practices, and to think in the scope of care of that margin is important for us. If we don't have physicians, wouldn't we be able to think on having the nurses to work in remote areas? It's difficult. It's very difficult.
que
This
fazer,
dialogue,
ok?
we need to
E
try
também
it, however, and also
relação
the regulation of labor
geral a
relationships. For that, we need to recover the healthcare and regulation in the healthcare work, which was discontinued in Brazil. About mental health, Brazil has a historic that I mentioned a bit yesterday about yeah, psychosocial care centers. We had a network, and that was very important during pandemic because we had a unique healthcare system for vaccines as well as for the mental health and also for um, procedures. There's the existence of a system, and here during pandemic, support centers were created in the um, healthcare work arena, even in some municipalities and also in some states, as if it was a specific referral systems for workers who were facing the pandemics. And there we also have, as yesterday, references for ATS, which are the healthcare family nuclei centers, which are psychosocial assistance, which go from children till more admission and stabilization of patients in general hospitals in case they need the admission for long term. We have specific beds, stretchers for the mental health of patients. And something else which is very important is the usage of permanent education as something necessary in the agenda. And we have that this space for dialogue, construction, and linking of reconsideration about a work process is a place of health, mental health care promotion or advocate also. Because the healthcare work is a hard work for millions of reasons as well as conditions, schedules, which are ethics that we need to discuss a lot, and that then we may wish what solutions we have for that. And also the need of thinking on the advocate of healthcare and disease prevention. We're always attempting to tackle the problem and we don't think on the promotion of health. We have a lot of more problems. What spaces, what projects do we have to, along with workers, because they are the ones who know what the needs are to promote the mental health, not work, right? Here, a bit of investment for 2023, which is already, unfortunately, physicians do not look for professional networks of health services. Medical category has social status and dialogue difficulties with other categories, which is important. Brazilian government has has been working on that, which is on having professional training to guarantee a higher access to the work process. Here we have medical internship uh, for mental health this year with 1,139 residents in Brazil, and mental health courses, which are offers in online platforms. We work with at least three spaces of Ministry of Health. There's free courses where they enroll. It's self-course, and there's a certificate for that. There's a continuous action of governance. Here we're going to the most complex parts. First of all, since 2003, the first that President Lula did was to create the um, Work Health and Education Management Secretariat, and it's got a very little critical mass of workers. We're trying to reverse this situation, but that this is governance in an area because in the federal environment, it's got a reference for work in healthcare education management. Am I going too fast? I'm worried about meeting the time. One more thing, cross departmental and cross ministries relationship or coordination. Ministries of work, education, and health. There's a presidential decree which creates a joint working group. 2005, we had a decree which talked about this, and it's very important for defining residences in healthcare as well as programs for retention of recruitment with training in health. The decrees to be launched. Now, one more thing is the creation um, of association agencies for interdepartmental, cross-departmental management of secretaries with primary care and with specialized care, so that the building of policies are more integrated. And then one more important thing is the agreements with federation entities. That means dialogues with health state secretaries. Okay, I'm 2 minutes away. Yes, I'm only two slides away. And also with municipality healthcare secretariats. We had months of debates.
Além da diversidade de
Of course, where we define policies. Now,
fundo, que isso não
why don't we have
transfere.
just in 2 minutes? Fund to fund, which is a transfer from the Ministry of Health to states and municipalities and the political dependencies, as we also have decentralized for the public sector. We have something called ProADI, which is a program
Incentivo fiscal.
where you have to pay your tax incentives for excellence, hospital excellence. There are some courses like training and studies and research of our interest and payment from the government and to make training processes. So it's also a source of funding. Important. Training strategies. That's the last thing. It's just training, just as
Para a formação
network of
centralizada, a
public
integração
schools
de
of
financiamento
health for the
da
centralized
universidade, temos
integration of
de que colegiam
services between the community and university. Even as soon as the pandemic will be and out, we finished 200,000 community agents, healthcare community agents, and it's welcome in decentralized ways in all the country. Also project that have training for professionals who are facing that's called as the Ponta, and we're including now cross-cutting topics in training. Here, I would like to put a traffic light on this. We have the first slide. We have 75% of us are women. And in Brazil, also, there are many black people, and there's a lot of racism. So we need to strongly face these issues. And now there's the equity, the equality program, and SUS workers, because healthcare training need to have these debates. Part of a moral, sexual harassments in other areas in a chauvinist cultural environment.
Agora é o último mesmo, não? É o último, agora é. Não é broma, agora é verdade. Aqui. Pronto, por fim.
No, it is true. That was the last one. Yes, that was the real. This is the real last one. Structural debates. Thought as structures in the main base. We need our legislative articulation. Now, in 2 minutes, because I didn't talk in the morning, so I didn't want to talk in the morning so that I could speak more now, right? So, legislative articulation because um, maybe all the legislations in Brazil there is approved in the Chamber of Deputies, in the Chamber of Representatives, in the Chamber of Deputies. We have parliamentary, which is the senator, and they may put money in projects and other sources of funding also. That articulation of the legislation with the executive who are us and the judicial or the judiciary. So all management models that are being created in Brazil, and we advanced a lot in that, but we regulate very little, have public-private partnerships with social organizations hiring and doing hospital management, but which not always has a public nature that we want. So we want to advance in this, or we need to advance in this regulation. Also, we need a revision of the tax responsibility law, which is a law that puts a focus on contracting or hiring of healthcare people. So new programs are created. What we do is hire a company who goes and hire people with different levels. And there we go back to the first slide, which is the context of our challenges. And we need to restrict the participation of the education, private education market in training in healthcare, because healthcare is a training that's also cultural of defense of the healthcare system to guarantee the broadening of social participation in SUS. We will go back to make the conference of um, uh, healthcare education and work management conference. That's beautiful. The last one was the way there was in 2016. And here we define the policy along with the civil societies and other stakeholders that are very important for us. And also one more thing that we need to debate is the three-party, tripartite financing,
pelo Ministério da
health
Saúde,
care
municípios
education, the policies of management of
em uma
work
questão
and healthcare education, restart and strengthening the network of human resources observatories, which is a current situation with policies and prospective researches, not just trying to reestablish the regulation chamber and finally to value work and workers, guaranteeing better working conditions and that work to guarantee better quality of healthcare. Thank you very much. Pesquisas, consultas, research. That was very fast, yes. También es difícil un poquito.
Ahora sí. Gracias.
Thank you.
Leice, ¿se pronuncia Leice tu? Laiz.
Lies.
Laiz.
That's how you pronounce it.
Laiz.
Lies.
Bien, ahora entonces tenemos a Cristina,
And that we
difícil de
have good
pronunciar.
Christina. It's
Paraguaya.
easier to pronounce for Paraguay. Good
Me
afternoon.
sacan a mí de ahí y ponen una presentación.
Yeah, get me out of there. Before the presentation, we will talk this. Um, I need to thank for the invitation and for everything that I am learning in this meetings. That has been more very productive for me and for all the ministry. And give you a salute from our ministry who form the politics and have supported all the work that we're doing in that framework. So you already know that my name is Cristina Caballero. I'm National Director of Strategy and Human Resources. The content, the context of the human resources in Paraguay. I just want to add something about Paraguay. And beside, we are the heart of South America. I don't know if you're aware of that. We need to take care of this heart, and also tell you that the estimated population is small. So we're a small population. We only have 7,453,695 people, and the promised hope of life is 75 years. And our surface is also small, 406,000 square kilometers. It's a pluricultural country, and they have two languages, Guarani and and Spanish. I was thinking of just talking in This has been a challenge in the scope of the and during the pandemic to generate a lot of the information as we have two languages. Um, we need to speak three languages: Spanish, Guarani, and the combination of those two. So it's pluricultural and bilingual. So you need to know this about the country. In Paraguay, the healthcare is guaranteed by the national constitution, but there's a national healthcare system that was created by a law 1032, and it's integrated by public sectors, private and mixed sectors, and it's characterized by the lack of integration and coverage and asymmetric territorial coverage and integration. As for different modalities of financing, goal population conditions of employment, social
Aquí
employments
es muy
and
importante,
payment
¿verdad?
capacity.
Que nos
We need
diferencia
to clarify that
sistemas
we had
en el sentido que
differences from other healthcare systems is that
también de provisión de servicios
we
así
provide
que
services and do coverage to 73% of the population that don't have coverage, insurance coverage.
en las 18 regiones
And we
sanitarias
have
y
installations in 18 sanitary regions,
que abarca el 19% de la
and
población y el
14%, 19%
77,5%
is public, and
en funcionamiento,
7.5% is private.
supervisión y financiamiento. Entonces aquí un punto importante
It's an
es
important
que el
part here
Sistema
is
Nacional de Salud del
to
Paraguay
advance in the national system,
de
healthcare
atención
system. It
primaria de la
focuses
salud.
on primary
Desde el
healthcare
2008
that
empezó a
since
implementar esta
2008
estrategia
started
de
to
una manera
implement
bastante
this
ambiciosa
strategy
con la
in a very
disminución de las
ambitious way
tarifas en las
by
prestaciones
eliminating the
del
rates
sistema público
of
de
the
salud
users or
privado
the
de
public
manera
system,
progresiva y se
the
fue
public
fijando
health
las
care,
unidades de
and they
salud
installed a
para
united
que para cuando nos
an
sorprendió la
USS
pandemia
as part of the
teníamos
comprehensive
827,
healthcare
ahora tenemos
public
aproximadamente
healthcare
300
network.
unidades de salud de la familia y aunque no disponen en su
And they
totalidad de
don't have the
recursos humanos
totality of the
suficientes y
human
cualificados,
resources
empezó a
qualified,
usar de médicos
particularly
especialistas,
of
también de
specialized
agentes
medics
comunitarios
and
y de
family
médicos
medicine
ocupacionales
and,
del sector salud,
communitarian
un aumento ahí
agents.
del 37%, pero hay variaciones que van
There are
del 33
variations of
al
besides that
87%,
37% we spoke
dependiendo
about
de la población,
before.
¿verdad? Está muy relacionada con eso. Y también aquí hay
There's also a national healthcare
presentada
policy
la cantidad
that I
ambiciosa
was
que quieren
talking
tener en
about
unidades de
their
salud de la familia y
ambitious
del personal, que se piensa
when
siempre
Colombia
que hay que
showed their
trabajar un
ambitions.
sanitario, un médico, una licenciada en enfermería, un agente comunitario, pero hay
We
que pensar que tiene que haber alguien que administre eso y que
we
haga
also
el
need somebody to
seguimiento
administer
de todo eso y al
all
final
these
finalmente
and make them
todos tienen que
mesh
formar parte de
together
la unidad de la salud de
that
la
need to
familia.
be part of the family
Nosotros
medicine.
tenemos una política
We have a new
nacional de salud
policy, national
vigente
policy
2015-2030
that
que
from
tiene el compromiso
2015
de
that has
avanzar
the
hacia el
commitment
acceso universal a la
to
salud y la
go
cobertura
into
universal de la salud.
integrated
Y uno de sus
coverage,
componentes estratégicos es
and it
también el
has
manejo de la gestión
due to
de los
the
recursos humanos
unbalanced
en salud.
distribution of human
Con la
resources
pandemia
in
se
general.
estaba trabajando la
With the
política
pandemic,
nacional
we
de
worked the
recursos
national
humanos en
policies of
salud,
human
pero no
resources in
estaba
health,
terminado, se
but it
estaba
was
en
not
realización.
finished.
Nuestro sistema
So our
informático
information
relativo a los
system
recursos humanos es
towards
incipiente, no está
healthcare
integrado,
was
al
not
igual que otros
integrated
países en la región.
as
Tenemos
the
una
same as other
distribución
countries in the
inequitativa de
system.
los
We
recursos
have an
humanos en
unequal
general
distribution
y
of
sobre
human
todo la
resources
brecha
in general,
laboral
and mostly of course,
hay ausencia de la
specialty
carrera sanitaria
workforce.
para el Sistema
There's
Nacional
an
de Salud
absence of
y
the
eso trae
healthcare
consecuencias
career
que
for
tienen que
the
ver con diferencias
healthcare
en los
sector,
salarios
with differences
entre los
between the conditions,
sectores, las brechas
labor
regionales,
conditions, and different
principalmente también
subsectors
entre
that
atención primaria de la
implies a
salud
lack
y
of
los centros de
unification of
atención
the
de
benefits
mayor
and
complejidad, los
labor
programas de
conditions and
pluriempleo,
salary
incorporación de personal
gaps between the
calificado,
centers of
ausencias de
primary
políticas de,
attention
de retención
and
y lo que ya
attention centers
se
of
promueven
greater
incentivos
complexities.
económicos para motivar la pasantía en zonas alejadas
We
de los
need
centros
more
más
incentives to
ubicados a
motivate
los médicos, una
these
necesidad de
physicians.
fortalecer la
There's a
capacidad
need to strengthen the
gerencial de los recursos
capacities,
humanos y
the
funciones de supervisión, pero lo más
managerial
importante es que el personal de
capacities
salud está desprotegido
that
en
is
las
very
instituciones de
weakened,
salud, ¿verdad? Ayer
uh,
se debate con Alejandra de que
and
en el
strengthen the
Ministerio de Salud no
institutions
tenemos
for supervision.
seguridad social,
We don't have
los que
social
son nombrados
security
tienen un pequeño
that are
déficit
not
para tener
appointed.
un
The
seguro
ones that are appointed do have
reciben ellos a los
this
trabajadores, lo
social
cual es un
security.
poco irónico eso, ¿verdad?
It's just a
Hay
bit
una carencia
ironic.
de articulación
There's
formal
a lack of formal
entre los
articulation
sectores de
permanent
educación,
between the
tenemos
education
el Ministerio de
sectors,
Educación y Ciencia, el
the
Consejo Nacional de Educación, la Agencia
CONES, the
Superintendencia. Si
ANAS,
bien hay una ley
and
que exige
healthcare.
la acreditación
Although
de las
there is
competencias,
a law
puede
that
ser
demands
la
accreditation
necesidad
of the
de
careers
vigilar
of
que tenemos
human
un creciente
sciences,
número de
the
instituciones privadas para las
however,
capacitaciones
the
en la salud,
agency of
principalmente de medicina,
this
que se
agency
instalan en
needs
las
to be
fronteras, principalmente
strengthened.
en el Brasil, y que nosotros todavía no vemos la consecuencia
We haven't seen yet the
a nivel de
consequences
recursos
at
humanos
the level of
formados
the human
en el país,
resources
¿verdad?
that have
Es
informed
un
the
poco
country.
reciente,
That is
pero
just a little
sí
bit
ya es
recent,
una preocupación
but
para
this
los
is
que
a
desean ingresar a
concern
las
for
residencias
those that
médicas
wanted to
y
go into
nosotros
medical
formamos este
residencies.
recurso humano que
And we
finalmente
form this
tiene
human
muchísimo
resources that has
potencial de volver
much
a
potential
surgir
to
o
come back to their country, or they leave, and how will we absorb them later? So Brazil and Paraguay need to have conversation how we're going to do on this regard. There is a need for training of human resource, specialized human resources in technologies of information and communication in the framework of digitalization, a system of digitalization and information system. The responses to the policies, there's five uh, prioritized topics. I talked about governance first. Paraguay um, had a preparation, a rapid preparation in the sense of governance, as it took a real fast decisions in governance. Like in 7th of March, when Paraguay had its first case, it already had a center to tend to these cases. That in and on a 20th March, we already
de la
have
COVID-19. Así
preventive isolation, general preservation. This was done very fast. The classes were suspended and massive events were suspended. On 12th of May, there was a exceptional schedule, work schedule. And in March 20, we had a general isolation, closure of the frontiers on the 24th of March. So this was done in a very short period of time. What happens in a short period of time? The country took decisions with resolutions and decrees, and other sectors. And so other sectors saying what healthcare needs to tell us what we need to do. So governance was recognized rapidly by the other parts of the government. The problem is not the issue is not in the capacity to establish resolutions and decrees, but in the negotiation and the articulation, so this could be feasible and for this to have an impact on in time. This was all generated at the web page during COVID, and I need to highlight this government's part. At the same time, we began to work on national policies of human resources in like 2020 and 2030, and we had a lot of support from PEJO, and we have good participation. Later we did potentially plan for the implementation and monitoring of the national human resources policy for healthcare in Paraguay, where we have 20 authors that are part half of them are externals that have to do with finances and implementing that we spoke about yesterday. So I will not go into details. The use of data for analysis and information for human resources for decision taking. When the pandemic, we didn't have that information system comprehensive or integrated. So this was done with along with the university, and we
por COVID-19 y los
formed a platform so to have all the information, and this was done really fast. Some said that contagion was done with the roles.
sistema que se generó
This
ayudó
system was helped us to know the uh, capacity of beds in the whole system and where the patients should be directed. That is an important part of governance. All these measures in Paraguay took, we couldn't open the door to the virus because the system was not prepared. So this protected the human resources in the healthcare in great measure because it gave us that quick closure and isolation the country did and made people go to certain hospices so so the system could be strengthened and also with the use of PPE and their use. What happened later is that we worked in a diagnosis of the situation of human resources in Paraguay. We did that with data from 2021 and 2022, and we had results last year with the cooperation of PEJO for this. And for the first time, we have a diagnosis that showed us how many people, uh, 60,000 people, are in the public system with 84,000 contracts. 60% are in the assistance and 20% in administrative part, and 3 women for each woman. And the main employer is the Ministry of Public Health and Social. We also evidence the concentration of personnel in the central part of the country and Ciudad del Este, and there's a high percentage of nurses that weren't being absorbed by the system, the healthcare system. And we also had the data of medics and nutrition and obstetricians for every 1,000 people. This will be fast. There's a lot of information. uh, There's a lot of matches with the other countries. We had resolutions to establish a better coordination efforts uh, that were dependent on the ministry and the IPS, and they had a contract in both concentrate in both entities, and they could concentrate in just one in
y a los médicos a proveer servicios de
to provide services, a distance in promotion, in diagnosis. They approved a, a table of criteria. They fertilized and reorganized the healthcare services for better attention, and they built hospitals for the contingency. They worked virtually, teleworking, those who could. They reassigned personnel, healthcare personnel, to greater with greater risk to other workplaces, like a call center, and to better contracting services. And what happens with that temporary workforce? After a few months, all the process was reorganized, and personnel was reorganized in another stage. This is the data that confirmed the distributed cases of COVID-19 in healthcare workers from 2020 to 2023. Our training capacities. We had a resolution creating the national training program for COVID-19 that was obligatory, compulsory to apply and have. They training medics and nurses, not intensivists, was a priority to 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 be cognizant of the manage of the patients of COVID-19 patients in intensive therapy. We had courses in biosecurity and use of PPE by levels of attention, training in operators, call center operators, um, training also in identification of regarding mental health. This was more directed to the general public in general, and not only to the healthcare personnel. We needed more attention, and we have documented there's a high level of human resources to work on anxiety. We had several diseases like pandemics like chikungunya, dengue, and others, and to end another relevant topics of this policy was they redistributed the economic allotments in the framework of the agreements, interinstitutional agreements between the the Ministry of Healthcare and the Ministry of Finances. There's also a catalog of specialities in the area of healthcare sciences, eh, and now specialities of the area. There was a 2020 with all the communities, with the different medical societies, and there's more society and specialities. There's a great predisposition to for the law of residencies that Argentina already has, and there is a professional career for nursing, and there is a scaling system for the medical profession. This is a great challenge. That is all for now. Thank you very much. Thank you very much for the system and for all the collection of the data. Thank you for all I gave their data for this presentation. Thank you very much.
Thanks, Christina. Thanks, team. And thanks, leadership capabilities that have been noticed in Brazil. So thank you very much. Christina mentioned that Paraguay has a few inhabitants, and I remember now of a country that was defined as the plain that has more cows than people. So a slightly waved plain which has more cows than people. 1.6 cows per person. So with this presentation, but we have more physicians than cows because they're not counted among the people, right? Gladys, thank you. Uruguay. Hi. First of all, I want to greet you. It's always a pleasure to re-encounter with many of you who have been working on this for a long time together, and to meet those who are joining this great crusade for this human uh, healthcare, human resources.
Paso con este.
Con el anterior para adelante, con esto para atrás.
Con esta.
Puntero, puntero.
Por esa, con esta. Apreté esta y se fue. Dije, toque más. Bueno, en la
Okay. A presentation that we worked with Wilson from the national office of Pajo, Uruguay. We try to summarize in the PowerPoints that have been proposed the main aspects in this dialogue
recursos humanos,
between
ya sea
human
periódicas,
resources policies um, with what happened in the pandemic. So on the first part that has to do with the context of human resources, what we try to do was this, like to say, okay, what were the main aspects of labor marketing human resources in Uruguay who had or have a positive or negative impact in the pandemic in our country.
que eran una
So yes,
fortaleza para el
we
país,
found some elements that were a strength for the country and some others that no doubt were a problem or that generated a higher challenge to face the country situation. So Uruguay has
114.000
114,000
del empleo
healthcare
global,
workers,
economía,
which represents 7% of the global employment of economy, and it's distributed in the makeup. Pretty much we have physicians. Labor force is made up by physicians and by nurse assistants who in our country have a non-tertiary level. And nurse graduates are like the great problem in terms of availability of human resources. Out of those workers, so in terms of starting points, we had a workforce which had the capability of assuming an gradual increase in the healthcare population. 75% of those workers are women that will see that in terms of a pandemic that had a problem and that represented any
en el caso de
problem.
enfermería,
For instance, in the case of nursing, um,
mayor y
this
supera el
percentage is way
90%.
higher. It overpasses 90%. We have, besides, a makeup of women who belong to female one parent um, household. So we have a work burden in the place plus the paid work, children at home requiring of higher care because they did not participate, they didn't go to education schools. So that female population had even higher problems than the rest of workers. Then, what I was saying, we have almost three physicians per every um, nurse and 1.5 assistants per each physician. Multi-employment level is important in the case of physicians, which almost reaches 70%, and in the rest of staff in the part of nursing is below 40%. This, which in some countries at some point was identified as a policy to promote, at the extent that I need to cover more services, I try so that the ones that I have work more. But in our case, they became vectors of contagion between workers, or among work those who they work in different institutions caused by multi-employment, which is very important in the closed areas. These percentages, if you see them for the closed areas, probably is way higher. Then we have makeup problems that are being proposed by all countries. The gross of information is developed by the public sector, which we have a unique university. So dialogue with training institutions is simpler. We already had an online field or campus that covered or encompassed more than 60,000 healthcare workers and high levels of informality in employment. This is also a favorable condition, thinking of contagion and coverage in regards to disease episodes of healthcare workers. So what we see is that with this starting point, we have a great installed capacity. We have an increase in difficulty for reconciliation between the paid and unpaid work, difficulties to give coverage in the case of nursing, and the rest of the points, we kind of mentioned them already. So if we go to the first axis proposed, what has to do with the use of data and information analysis, that's probably one of the main strengths that the healthcare system has. We have information systems which have more than 15 years, which include public and private, and where maybe the deficiency is different from other countries. We have it in the public sector more than in the private sector. Our regulation capacity is more, and governing capacity is higher in the private sector compared to the public sector. So we have these important systems which rapidly allowed us to design and measure and say, okay, how many we need, where they are. A contingency plan was uh, elaborated for the increase of the ICU beds, and all based on information available. And we didn't have to go to find any additional data, at least for the design of them of our first policies. And then we'll see that in other cases it did happen. So what was generated was complementary information. This was motivated mainly for the vaccination development plan for healthcare workers. Healthcare workers were one of the main populations to vaccine, one of the priority populations, and this generated an incentive by those institutions who did not send information to the ministry. That incentivized them to send them so that we could uh, the work, so we could have full pool of workers in the sector, identifying as a starting point to invest towards those groups that still were not included in the permanent information system of the ministry. And with this data, these data were the ones that allowed to monitor contagions and vaccination of human resources in healthcare and during the whole pandemic. And this first system, besides, allowed us, for instance, to identify not only the focuses within the healthcare workers and where they happen. One of the phenomena that called the attention at the beginning is that focus were given in the first levels of care and not in the ICU units. really what you saw, it was areas that were more used to PPEs and where besides there was the encouragement of the use more than the administrative of the polyclinics. Uh, Contagions at the beginning were concentrated in those areas.
Pageants.
Contagions.
términos de la disponibilidad y
Then in
distribución
terms of availability and distribution of our nationwide resources,
algunas de las
we
principales
listed some of the main
políticas que se dieron, que
policies
además
that were given in the besides.
uno de los objetivos en algunos
One
casos
of the
efectivamente
objectives in
fue la
some cases was that effectively they were
podríamos hacer decir, bueno, hay algún conjunto de
transition.
políticas que
And
uno
yesterday we
espera
said
que
there's a
sean
set of policies that we
permanentes o que
expect
se
that they are permanent,
formalicen, ¿no? El incremento
and that the
y
increase
demás.
of
Y hay
workers
otras que
is
requieren
Temporary.
momentos críticos y que es importante
Temporary.
que
and
continúen,
critical, and that's
¿no? Tener
important that they
estudiantes
don't
trabajando
continue.
dentro de una unidad
And
de
having
cuidados
students
intensivos
working within an
no debería
ICU
ser un aspecto que
uh,
permaneciera
shouldn't be an
en el
aspect
tiempo
to stay on
post
time
pandemia, ¿no?
on the post-pandemic time.
Entonces esa era una de las
So that was one of
preocupaciones
the
que
concerns
teníamos a la
that
hora
we had at the time
de
of
normativas, preexistentes
modifying the
también la
pre-existing
situación
regulations in
laboral
terms of
y la
regulations
inserción
of
laboral.
the area in the
Entonces,
um, labor
uno de los
administration.
principales
So one of the main
políticas fue el plan de
policies was
contingencia para las áreas de
the
cuidados
contingency plan for the
que se
ICUs,
desarrolló junto con las
which was
sociedades
developed along with
científicas,
us, with the
los
scientific
médicos y
societies,
investigadores,
medical
y lo que hacía
associations, and
era
providers. And well,
hacia un
and
conjunto de
there was a
recomendaciones
set
en
of
base de
recommendations,
normativas
and from here
que
there were specific
flexibilizaba
regulations that came out, which
algunos, ya no
made it
sean
more
estudiantes de
flexible.
la residencia
The
de
entering
medicina
of some
intensiva u otros
residency students of intensive
especialidades,
medicine or other
una serie
specialties towards
de
the
medidas
ICU
principales
areas.
que se tomó para esto
One of the
fueron,
main ones that were
por
taken for
ejemplo,
this
como
was anesthesia, for instance,
entre comillas,
as a B plan
frente a
specialty with
capacitaciones en los intensivos.
in front of an increase of
Después,
um,
una importante
intensivists.
contratación
Then there
local en
was
el
an
sector
important
público para
hiring,
fortalecer la
the
atención,
short-term hiring
esto ya
of the
cayó,
public
nosotros
sector.
estábamos con
It dropped
Wilson,
already. Now with Wilson, we were mentioning
tuvimos
that was one of the conflicts that we had
a fines del año pasado, que después de
last year. By the end of last year,
aprobada la ley de
which
emergencia
after
sanitaria,
finishing the
las
emergency,
planillas les dieron de baja,
the health emergency
tuvimos el
law,
ingreso de
this
estudiantes de
hiring
medicina
were
también en el sector público
stopped.
para el
We had
tamizaje,
some medicine students in the public
para el
sector for
seguimiento
screening and for
incluso
the
de
follow-up of
consultas por
even
COVID telefónicas y
consultation
demás.
or teleconsultations for
Hubo un
COVID,
aumento de camas de cuidados
and there was an
intensivos en
increase of intensive care bedsides in all the
resolución de la
system,
Junta
and there
Nacional de
was a
Salud,
resolution
que
of the
son los
National
monitores
Healthcare Board, which is the
de los prestadores
governing
territoriales, que son los que le
uh,
dan la
agency
cobertura al
and the
conjunto de la población,
integrated
que lo que hacía
institutions
era
which
tratar
give
de
coverage to
minimizar
the
la
rest of the
atención
population,
presencial
and they try to decrease the
intrahospitalarias en
in-person and
espacios residenciales
intra-hospital
y fomentar la atención
care. I mean,
extrahospitalaria,
inside
incluyendo
on-site
algunos establecimientos
consultation,
de
face-to-face
teleconsulta.
consultations, and to
¿Sí?
do some teleconsultations.
También a principios del 2020
Also,
tuvimos la
at the beginning of
aprobación para
2020, we had the
Argentina,
approval of
que
the
es una ley que
telemedicine
todavía no
law,
está
which is a
reglamentada,
law that's still not
estamos
regulated.
en el proceso de reglamentación
We are in the
para
process
ver,
of
digamos,
regulation, but
cómo hacerlo.
still hasn't come out.
Bueno, salud mental.
Okay, mental health
Seguramente está en el papelógrafo ahí.
probably is in the
Ha sido
flip
uno de los
chart there.
temas
It has been of a great
ausentes en las políticas
top
específicas en materia de recursos
topics
humanos.
absent
Que
in
sí se habló
human
mucho
resource
de la
policies. We
importancia
talked a
del
lot
tema,
about the importance
pero cuando
of
eso
this
en
subject
términos de
matter,
su
but in terms
traducción en
of
políticas
its
específicas,
translation to
lo que
specific
sí está
policies,
breve,
I think it has
agarramos
been
algunas políticas que fueron las
here we
generales,
propose
que
some more
digamos
general policies
abarcaban a los
and
trabajadores
obviously
de la
cover the
salud,
healthcare workers.
la ampliación en el
The
año 2020
broadening in
de
2020 or
prestaciones de salud
the scale
mental
up of the
y la
mental health
necesaria
provision, which
salud.
includes the healthcare
Entonces,
staff.
lo que se hace es, en el decreto, se establece un
So
grupo
in
de
the
personal
decree,
gratuito que tiene
a
un
free
mínimo de
nature
4
group
integrantes y un
is
máximo
established,
de
which
8.
has a minimum of four
Con
members
sesiones
and a minimum
intensivas de 90 minutos
and
dispuestas
a minimum of
semanal,
two, 60
etcétera.
minutes every week, etc.
Y bueno, lo que se hizo
And
fue
what we did
regular la
was to
cantidad de grupos que se tenían
regulate
que
the
habilitar
quantity of
dentro de
groups
cada
that had to
prestador.
be
O sea,
enabled with, between each
número de
provider.
integrantes para los
This number
prestadores que integran
of members, the providers who are part of FONASA, who have different
tenemos
sizes.
algunos que tienen
We
más de
have
500.000
some that have more than
afiliados, 15.000,
500,000 members,
se establecieron dos
some other
grupos de
ones a few
prestadores,
thousand, so we established a
los que
group of
tenían más de
providers.
50.000
Those who
afiliados
had
tenían
up to
que formar
50,000
dos grupos
Members needed to have two groups, and then the rest of those of more than 200,000 A groups. But I think that this is one of the great subjects that if you need to think on a future agenda, we should separate this. In terms of governance, it's very straightforward, but really to highlight like the pre-existence in Uruguay. There's also a culture that comes from way before of negotiation spaces, which are institutionalized and formal, and everything that has to do with work conditions, and salaries of healthcare workers were defined in instances where the executive power, workers, and enterprises participate. The same thing in the institutionality of the healthcare sector. FONASA is made up by the Ministry of Economy or Ministry of Finance, Ministry of Health, healthcare providing institutions. So to continue the dialogue the country has in many environments, and even the public provider also has an agency of participation or government participation. So there is dialogue between different relevant sectors that obviously context that help to accelerate some measures that to be require the dialogue. What was created specifically for post-pandemic was the crisis human resource board, which was also made up by all the parties.
Y, capacitación. Era el que
Training
quedó corrido.
was
Pero
missing.
acá lo que presentaba al principio,
Here, what I was showing at the beginning, we already had a campus which had a very important percentage of workers. We have almost 100,000 workers. We had almost 70,000 out of those 100,000 within the platform. So this platform, which we already had, was used to provide information to identify, okay, in access of information, what was the official information that the ministry wanted to convey to workers, and then for specific trainings. For instance, the one of the patient management with mechanical ventilation for nursing staff who had to get into the ICU unit and that before didn't have to work in those areas. Training for non-intensivist physicians who would have to work in ICUs. For instance, the part, maybe this was one of the greatest innovations, which was training for workers in long-term stays or for older people, which we do not have identified as healthcare staff. Well, in this case, people were gathered for the platform and specific training was given, and we can name several others. Then the node course for the part of vaccination, which had around 40,000 participants from Uruguay and 1,300 from the region.
bueno, y lo último,
Okay, and the last thing is here we put, it's got like two angles. One of them is aspects that we couldn't identify in the five axes that we put it here. And then some that are like the slight ones that we haven't developed yet and that should be in the future agenda. Some have to do with the protection of the healthcare staff. First thing, which has to do with what are the measures that were taken. The first one is the definition of COVID-19 as a professional disease that several countries also proposed it as one of the measures that have been taken. Formalization and employment quality levels, as I was saying, were ignoring the worker who had long certifications. They have coverage in terms of revenues in healthcare for those extended sickness times, improvement of the costing capacity of healthcare workers, prioritization of the vaccination plan. And then one more policy taken, which probably no much dissemination has been given to, were policies that had a double purpose. On the one hand, I mean, the growth of our healthcare system or workers are made up by providers that give comprehensive or integral coverage to population. Those providers are funded by a unique fund, which is FONASA, which is linked to the coverage of Social Security. One of the measures that were taken that had a double purpose. On the one hand, was well, since the pandemic, on the one hand, had the healthcare impact, and then on the other hand, the impact in terms of finance of society. It increased the unemployment, extended unemployment, etc., which had an impact in terms of social security coverage of population. People who went beyond 6 months of unemployment had no coverage in the social security. So that coverage was broadened in temporary terms, which had a benefit for the population itself, which had a higher benefit for a longer time, and but it also gave stability to the funds receiving those providers and therefore the employment in the healthcare sector. So at some point, unemployment that could be generated was discussed in the degrees of coverage of Social Security and population as such, and those were the measures to mitigate it. And then one of the issues that we believe that's always latent in this things and that we didn't include in the agenda is what we had already proposed, which is the gender approach. And that's it. Perfect. Round of applause for Uruguay. Thank you very much. Thank you very much, Gabby, for the presentation. And we're going to give the floor to Venezuela with the Vice Minister. For Brazil, we have a chat there in YouTube, and Joaquin Venancio School is congratulating the Vice La Isa for her presentation. It's the same as the network of healthcare technicians. Good presentation, it said in the chat, so we'll give you the message. Okay, Liz, thank you very much, and the floor is yours.
Muchas gracias de verdad por la invitación. Estos momentos en el que encontramos en todos las mismas necesidades y que de seguro vamos a conseguir las mejores respuestas y alternativas para mejorar el sistema de salud latinoamericano. Para poder hablar de mi sistema de salud, mi sistema público nacional de salud, debemos entender que es un sistema altamente caracterizado por una visión social. Y es por ello que en esta estructura, que tenemos más de 280 centros hospitalarios de diferentes niveles de atención, tenemos obviamente una estructura que fue debilitada por
Structure that was weakened by migration, where we lost a lot of specialized workforce, which migrated to neighboring countries of our region, and which obviously, when COVID arrived, we were at a specialized level, very weakened, but our strength laid in more than 15,000 hospital centers of primary care, which were the ones that had the care flag against COVID and the strategic lines which were generated of the central care level. Of course, this resource had to be committed and resilient because it had a very behavior that had been attacked by this social crisis that we were going through in the country and which had to have behavior in the pandemic declared in 2020, and that these professionals have been in charge of the healthcare and people in a permanent way for work teams for decision making, more convenience for preservation of wave patients and of service providers. Necessary to incorporate strategies which gave permanence on time, preventive healing, and rehab that were daily assessed. Daily, most increased care level or which led decision making received with information data from other countries, especially from our first line of care, what was happening in the country. And daily, the testing committee and scientific committee, advising committee, assessed all the strategies and dimension them pretty much every day to give a timely manner response to the Venezuelan people. That is why 5 issues were prioritized in this political response. We'll see it in a way more, in a lighter way, not very well structured or in charts, because this is the end and we're tired already. The first thing we did to emphasize the protection measures as culture. Who did this? This first line of care, strengthen, empower. In a community that he worked on for a long time and that obviously was his responsibility. Who had these flags? The community leaders who were trained, who provided volunteer service, and who are incorporated in the healthcare teams at all levels and in all the care areas, which in a voluntary and aware met the safety and comply with self-care as the tool to break the contagion chain.
Disculpen, estoy ajustada en tiempo. Es por ello que la
That
tasa
is
de
why
contagio del
the
país
contagion rate of the
estuvo
country
realmente
had
bajo
very low levels
en
because
correspondencia con otros
in
países del
correspondence
mundo.
with other countries of the
Esto
world.
hizo que
This
se empoderara el primer
made
nivel de
the
atención
first level of
y que
care to be
obviamente
empowered, and
este
obviously this
servicio
provision of
nunca
services
estuviera en peligro
never was
por parte de ellos.
endangered by them.
Lo siguiente fue la
The next
capacitación
thing was
permanente del
permanent
recurso
training of
humano. ¿Por qué? Porque
human
estamos
talent
en la
resource.
setenta y
Because
dos
we were
legislatura del
weakened,
sistema de
the
salud
healthcare
y
system had to be
obviamente
restructured, and
en los
obviously
niveles más altos o
in the
los más
highest or
especializados
more specialized
tenemos
levels,
muchas desigualdades,
since we have a lot of
como
inequalities.
por ejemplo
Areas as, for instance,
terapia intensiva,
intensive
neonatología,
therapy,
requería
new
personal especializado y no lo
birth
teníamos.
assistance
Otro
in
ejemplo,
specialized
caso,
areas, or we had a very
en este ciclo se
scarce. In this
introdujo el
system, we
comportamiento
introduced
clínico
the
que
clinical behavior,
sigue
which
generando nuevos ciclos y
continues to
signos
generate new cycles
antes
and
de llegar al
symptoms.
gobierno
Before the
nacional.
reality of a
Se
national
puso en
government,
práctica capacitaciones sobre los temas,
trainings were
evaluaciones
put in
periódicas
practice
de
for
protocolos casi que a diario, como lo
reviews
venía
of pretty much
comentando,
daily protocols, as I
y
was mentioning,
sobre todo
and
en los movimientos
especially
COVID
in
y el post-COVID,
ecstatic COVID
en
and
donde estamos
post-COVID,
viendo
which
lesiones
is not generating
a nivel
permanent
nacional en
um,
el personal, no solamente
injuries nationwide in staff, not only
porque
healthcare,
hemos
but
estado
also
viendo
we have been seeing
en estudios que hemos estado realizando
studies that we've been
que tenemos
performing that we have
unos
patients
criterios
with
como
not
por ejemplo la
criteria or, for
hipertensión,
instance, of
pacientes asintomáticos
hypertension,
ACV,
and we're having
pacientes que no cuentan con indexos
cardiovascular
regulares
uh,
de
disease in
evidencia
patients who do not
este
have
tipo
regular
de
criteria of
patologías.
evidence for these types of
En esto
pathologies.
convocamos a las
And
universidades,
this we call
no solamente
the
de la ciencia y salud, sino
University
una
of not only
universidad que
science and
está
health,
incorporada en el
which is
Ministerio del
the
Poder Popular
university
de la
that's
Salud,
incorporated in
sino
the
que se
popular
convocó
power
a toda la
for
estructura
health,
de
but all the structure
universitaria del
was
país
uh,
y de verdad
called,
que tuvimos
summoned,
un llamado
and
y una
really we
aceptación
had a call
inmediata.
and an
Lo
immediate
siguiente que
acceptance.
hicimos fue hacer ambientes
The
más
following
seguros
thing we
para
did
ese
was to
talento
do
humano.
more
Como
secure,
producto de las
safer
adecuaciones de
environments
las
as an
instalaciones para
outcome of
atender a los
adequation of
pacientes, se
facilities to
logró
take care of
también
those
el
patients.
trabajo con
We improved also the work
acceso a duchas,
environment
agua
with
potable,
appropriate
adecuación de
breaks,
los
with
medios de
access to
comunicación
showers,
efectivos,
drinkable water,
se le garantizó la alimentación,
effective adequation
se le
of
proporcionó
media.
insumos para limpieza del
Information
sistema de
was guaranteed and
condensación
inputs were
y
provided
en
for las zonas de alta
environmental and
personal
temperatura,
cleaning and
ventilación
in
y
high temperature
climatización
area,
adecuada.
ventilation and appropriate heating.
Horarios laborales. Esto
Work
en principio
schedules.
fue un inconveniente, pero a medida
At the
que el
beginning, it was
tiempo
not an
fue
inconvenient, but as the work
relevándose de
team
responsabilidades, el
was
gasto
getting
energético
overburdened of
aumentó,
responsibilities, the
también
energy
los niveles de estrés fueron
expenditure
constantes, fue necesario implementar
it was necessary
papeleos
to
en
implement
el sistema de salud en cuanto a los
roles in the
horarios
healthcare
laborales.
system in regards to work
Primero,
shifts
se
or
reunió
schedules.
rotación
First,
de
there
horarios
was a rotation of
laborales del
schedules
personal de salud, del
on
primer
calls
nivel de
of the
atención, del
healthcare personnel at the first
coordinador
level of
médico.
care,
Se controlaba el
physicians,
cumplimiento de
nurses,
las
and
coberturas y cabales horarias
bioanalysts.
en los centros
There
de
was
salud
compliance
y
of
se estableció
on
un
calls
sistema de
and the
supervisión
healthcare
eficiente
schedule and
que
efficient
garantizó la
uh,
permanencia de estos trabajadores en el
supervision
primer nivel de atención
system
durante
was
el tiempo
done
en los que los
in the
síntomas y
thing of the
comentarios
staff
estaban
during time in
elevados.
which
Se realizaron
contagions were
jornadas
elevated.
laborales
There were
alternativas para evitar
alternative
la
working
rotación y el
schedules to
éxodo
avoid
por
rotation and
agotamiento de los trabajadores del
the
primer nivel de atención.
exodus
¿Por qué
because
sobre
of
todo en el primer nivel de
exhaustion of
atención?
workers in
Porque
the first
fueron
level
los
of
que
care. Why in the first level of
subieron
care? Because they were the
hasta
ones who went up to
las áreas más
the
vulnerables
most
del país,
vulnerable areas in the
tuvieron que
country.
caminar
Um,
y no solamente
they had
estuvieron
to
dentro de
work,
la
walk,
estructura,
and not
sino que
only they
fueron
were
a buscar
within the
al
structure, but
paciente.
they went to the patient.
Obviamente el desgaste
Obviously,
físico, emocional y
physical and
mental fue
emotional
superior.
mental exhaustion was quite high.
¿Qué hicimos?
What we did
Nuestro sistema hiciera talento
that
humano
our system
resiliente ante
did
un futuro.
resilient human talent towards the future.
Logramos que se ajustaran
We
al
could have
medio ambiente cambiante que
made
es
them
diario,
adjust to the
permaneciendo en
changing
constante
environment, which was
interacción.
daily. We were constant in
Se
actions.
permitió que el recurso humano
Human
extrapolara sus
resource was
propias
allowed to be
limitaciones en
extrapolated in its
incursionar
own
en ámbitos
limitation and to
ajenos o poco llamativos
participate in
para ellos.
environments that were
Estimulamos la
not known
readaptación
for
y
them.
la
We
reorientación de las
stimulated
estrategias.
organization and
Se determinó
reorientation
que
of
la
strategies.
diversidad del
It
recurso
was
humano
determined that the
era
need of the human resource
indispensable.
was
Se
essential.
fortalecieron sobre todo el trabajo en
Especially
equipo,
they
que fue
were work
fundamental,
team was
fundamental,
strengthened
perdón, para
as
lograr
it is
los
essential to
objetivos
achieve
y buscar
goals goals to meet goals, and we sought for a visualization as equals because there we were all important, no some more than others. We all had the same responsibility and the same benefits. other issues that were relevant for the political response was obviously this readjustment in efforts of the national public healthcare system. We took it to a specialized system, obviously to the levels that required a specialized system, and we reorganized by complexity of care. We reorganized it by era, slight, moderate, and serious. In that way, we adjusted the system. We strengthened the primary care. We went to look for patients in their homes. When we took care of them in their households, and we had physicians and first level of care teams that were responsible for a sick. A sick is a social um, integral community area. They reported daily, morning and afternoon, under which clinical conditions our patients were, especially those who we had in shelters in their households. We trained healthcare advocate teams. Within that same arena, we interacted with other ministries, the Ministry of Communities, the Ministry of Women. We work with missions and great missions, which are also part of this system, with the Ministry of Science and Technology, and of course, the Ministry of Popular Power for Health. We established strategies to apply the psychological first aids in personal as well as in the patients, because it was necessary to to act in the same line at the same time, because it was not just the patient, the one who was facing fears. It was our healthcare professional, the one who was leaving the families at home, self taking care of themselves when they were facing fear of neighbors and of those who were at our care. And we sought that this peace, we sought to work as a team, and we sought to socialize and like meet ourselves as just one team within our people to serve our people. Wow, wow, was that tan nice?
Liz, viceministra de Hospitales de Venezuela. Vamos a dar
We're going
tres
to give three space for three interventions, and then there's going to be a group work where we'll be able to share all these experiences, which I imagine there's a lot to analyze or proposing. So now we're going to give a space.
Y ya Javier había pedido la palabra. Sí, adelante.
No, no, es básicamente una reflexión.
No, it's basically a reflection, because many of the countries that are here have the challenge of interculturality. And obviously, this is an issue, and I'm talking on behalf of Ecuador. Indigenous movements in Ecuador requested a presidency, a special board, and within the requirements of that special board, there's the issue of not only the access of these groups to technical or professional training, but also that contents, for instance, that they demand that physicians of social year, social service, or physicians, non-indigenous officials, have interculturality elements. So I make that reflection because I think this issue is every time more challenging. In the case, for instance, of, as I'm saying, of Ecuador, there are many indigenous groups. There are 5 provinces in the Amazon region. In the case of Paraguay, it's important to remember that Guarani is not a written language. Guarani is an oral traditional language, and that makes it very complicated, the part of training. So I would propose it as a challenge that every time is more emerging and to which we have to give a response. Not a response not only in training, but as I'm proposing in the case of Ecuador, where these groups are demanding that those who take care of them have interculturality content that give response to their traditions. Thank you, Javier. There's a content that at a level of human resource we're working on, which are intercultural skills and transformation of a curriculum for training of professional, of a syllabus.
Sí, claro. Bueno, doctora Calle, por favor.
Dr. Kaya, please.
Ya saben, cuando quieran micrófono, los recomendamos.
Yo quería
I wanted to congratulate all the presentations because they have been extremely sincere and transparent, and they've said a lot of very important things. I think in the 10 minutes that you have been given, you have shared different realities, but I do want to say it publicly. Our governments, is it okay? I was in a webinar, the webinars where the physician said that it had been a failure, and quite frankly, I was terrible because I said, just a moment, right? It's not like that. Our governments have given their best in this pandemic, and I think there we cannot say negative things about nobody because everyone give from their end. They were not prepared. That reality got us naked, stripped away, or whatever. But we all did a lot. They all did a lot. Second point is yes, interculturality is something that's always with us and it continues to be with us. But really, we do not ground into practical things. I admire Ecuador. I've been there. I've been in the services, also advances in Colombia, in Bolivia. But really, for instance, in Peru, I don't know how many ethnics we have. I lost the numbers already, but there's an important issue. And we cannot treat equally those who are different. And I think sometimes they tell me, Mari Carmen, that's against equality. It's not like that. And in that sense, I want to talk about human resources. We cannot treat equally human resources and health because it's different in everyone. They're all different. Now, whenever I present, we have done a qualitative assessment because it's not just about knowing how many they are, if they are or if they are not, but characteristics. Because at the end of the day, it's people who take care of people. And the last point is we have to recognize that the pandemic has been the greatest catastrophe in this century. If we do not recognize that, we are not going to correct mistakes. When I'm here, when I and listen what I'm feeling, that there are a lot of things that we are not doing. We know very well that the healthcare systems, the way they came in, is they shouldn't come out. That means we need to do a whole re-engineering reform, whatever you want to call it, but we cannot be the same. And a very priority issue is the first level of care, but it is a priority. Yesterday you said it, and I thought it was very interesting. It's not worth it strengthening the first level of care if you don't have a resolution capacity or capability in the second and third level or tiers. This is about networks. This is about I take care of a patient. I am in the first level. I give everything I can. Let's not talk about a first level, a very rudimentary first level, but a first level with capacity of responding to the most common things, but also with a trust. And I think that's basic. The trust of being able to refer in a timely manner and that the people gets to another place and that the problem is resolved. And the priority issue, I'm sorry about what I'm going to say, but it's not just human resources. It's not worth it if you're very trained, well trained, if you don't even have the means, if you don't have instrumentation, if you don't have equipment, if you don't have processes and procedures, it's not going to be worth it. So that's why it is also a way of retaining physicians and healthcare professionals. Everyone gets depressed. You tell me they send them to the tip of the mountain, because the physician has to be sensitive and has to be incredible, right? You know, lately they haven't asked for much, but before you had to be amazing, incredible, First, you go to a place where you don't understand what they're speaking. We've had that experience when we sent them to populations, and it was mental health care. If a physical care is difficult when your other person does not speak the language, let's imagine mental health care. How do you feel? And we don't know how to do it. And I feel that that still hasn't been resolved. There are the successful experiences, there are the good practices, but it is demonstrated that our countries, the capability of taking a scaling it up is incipient. We're not saying that it doesn't exist, but it is incipient. I'm sorry. Yes, we forgive you, Mark Carmen. You're always forgiven because there's always wisdom in your words.
Thank you. After I told you to talk to Matt, I had to fix it.
Oye, palabra de felicitación de la
Words of congratulations for Christina in the chat that we have here. We're going to have some lunch. We ask discipline. If you want to go out tonight, it will depend that we have here to be at 2:40, and here comes a very important part, and the community, the integration mechanisms when we return. So please at 2:40. The other thing is important. We lack the discussion, but there will be a moment for discussion at the work team. So we're going to go have lunch and we will return.
Buenos días.
Hernán, Hernán, hoy día y yo doy las palabras por parte de Lora. ¡Wow! No sé cómo.
¿Está por ahí Ecuador? ¿Qué más nos falta?
Tiene que pasar lista.
Bolivia.
Okay,
Ya estamos en la
we are already
sesión de la tarde del segundo día.
in the afternoon session of the second day.
Y ahora nos toca una parte bien importante porque tiene
Now
que
there
ver
is a very important part because it has to do with the South American integration mechanisms.
que tiene más
South
mecanismos
America is a subcontinent that has more integration mechanisms coexisting among themselves. Central America has Comisca or Sica Comisca. Caribbean has CARICOM, but South America has some. Has Mercosur, has OTCAM, has Pro South, Pro Sur. And I would say that the only specialized healthcare agency is the Andean Health Agency with Belibono Olanio, which involves the 6 Andean countries and it has a long journey trajectory. What is the important element that integration mechanisms have? That they are capable of articulating, coordinating common elements that all countries have. In that way, it generates joint actions. As PAHO, we've had a very long collaboration story with the health agency, even though the executive secretariat challenges me and questions me. So we're the parents of the creature.
Parents of creature.
I'm not gonna get into this discussion. I'm not gonna get in that discussion. So I'll be pleased to to give the floor to Mari Carmen Calle, the executive secretary. The team is here.
Por favor, por favor, por... Ahora sí.
Ahora sí podemos.
Mari Carmen, por favor, adelante.
Mari Carmen, please go on. The presentation of healthcare Indian agency body. Good afternoon. We're also the parents of the vaccinations week, which came out in the healthcare Indian agency, and then PAHO adopted it.
Es por eso que nos llevamos tan bien, ¿ok?
Because that is why we get along so well. The mothers. We're a family, anyways.
Pedir que
First of all, I
me
want to
pongan un
ask
poquito.
you to pay some
un
attention
momento
to me.
muy
I know
difícil.
we're
Todo el
at a
mundo
very
almorzado.
difficult moment because everyone has had lunch, so everyone wants to fall asleep. And really, I would love to be heard, because the healthcare Indian agency has 51 years of life now. Pajo is going to tell me that they have more.
Y la verdad,
It's
han sido
51-year-old, and
años
really, it has been years that always health has been above political differences, and always 6 countries have been together. You know that the Andean Healthcare Organization is made up by Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela. And we've reached 51 years last December the 18th. I want you to stand up because we are going to give a minute of silence to all human resources who died in our pandemic. I believe pandemic was catastrophic, and that who says no must have been in Mars. So this chart is a chart from the Indian Healthcare Organization. We always put it at the end, but as it is about a human resources meeting, we have put it at the beginning.
Ok. Entonces, este cuadro está,
So
muchas
this
gracias,
chart is picture is dedicated to all
horas que se
workers
quedaron atrás
who
en el camino, ¿no? Salvarlo a los demás.
who left
Entonces, nosotros
us
estamos
helping the
agradecidos
others.
y
So we're
agradecidas
thankful
eternamente.
forever.
Existen muchos
There
espacios
are
en el
many
organismo mundial
spaces
de
in
salud
the
en el que
Andean
podemos
Healthcare Organization in
acelerar
which
la construcción colectiva de los
collective
recursos humanos para la salud.
construction of
Estamos
human
hablando
healthcare
de los
resources.
comités,
Um,
la
we're
gestión
working about
con los
communities,
comunidades,
management, coordination with
tenemos
communities, with
todas estas
REMSAS.
reuniones
We have
de ministros de la
the
salud
meetings of
pública,
ministers of
las
Andean
reuniones
Health, the
nacionales
meeting
de
of
salud,
national healthcare
las juntas
authorities,
técnicas, los
technical
boletines.
meetings,
Hacemos sistematización,
bulletins.
seguimiento y
We
evaluación de
do
políticas
follow-up
de salud
assessment and evaluation
alianzas
of
con otros
Andean
organismos
policies,
nacionales, regionales
partnerships with other
para
national,
podemos
international, regional
últimamente
agencies. We have
nuevas
multi-country
estrategias
studies, webinars,
comunicacionales en varias
communicational
plataformas
strategies in
y
several platforms,
elaboración de
and
políticas
elaboration
para
of policies and Andean plans.
¿Por qué? Porque tenemos muy claro que
Why? Because
mejorar
we
las
have very
condiciones
clear
laborales de los recursos humanos
that improving the conditions of
es
human
indispensable,
resources
porque
is essential
queremos todos tener una vida digna.
because we all
Eso
want to
sí quiero
have a
decirlo,
life with
es una
dignity,
vida digna y es un poquito
not
más.
just decent, but life with dignity is.
El Comité Andino de
The
Recursos Humanos
the
está
Andean committee
conformado por los
is
puntos
conformed by the
focales de las
focal
unidades de
points
recursos humanos
of
de los ministerios de salud de Bolivia,
the
Chile, Ecuador,
ministries of
Salvador, Perú y
Bolivia, Chile,
Venezuela
Colombia, Ecuador,
y
Peru,
realiza
Venezuela, and
reuniones
does
periódicas.
periodic meetings.
Caracas
This meeting was
el
in
año
Caracas
pasado.
last
Fue
year,
nuestra primera
and it was
reunión
our
fuera de
first
Lima,
meeting outside
porque
of
la
Lima
Secretaría Ejecutiva
because the executive
actualmente está en
secretary
Lima.
is in Lima.
Tenemos plan de
We
actividades
have a planned
anuales
activity,
que responden a
annual
la
meeting activities
generación de
that
evidencia,
responds to
intercambio
generation
de
of evidences,
experiencias y
interchange
fortalecimiento
of
de las relaciones
experience and strengthening of skills.
Allí se ha evaluado la
They,
política
we
de
assess the
recursos humanos en
Andean
salud
human
218
resources
del
policy
2022
218 and
y estamos en
222. Right
actualización
now, we're updating the
política
Andean
de
policy
recursos
for human resources
2023
223 to 230
2030
to
que van de la
2030,
mano con nuestro
which
plan
goes hand in
estratégico
hand with our
de los
strategic
organismos
plan
de salud.
for the
Solo quiero recordar
Andean
que el
healthcare
volumen
organism.
de trabajo
We
de
want to
este
recall that our work
desde
line has been in
1974
place since 1974,
cuando se creó
when
la
they
primera
created
comisión de gobierno
the
recursos
first
humanos.
commission for human resources in healthcare.
¿A dónde? Ah, ya. Algunos comentarios.
Some comments. The use of data analysis of information for planification of human resources in healthcare. Definitely, we have to have the information of the human resources in opportune and realistic way. Reactivate the Andean Observatory for Human Resources, and it's right now it's not activate, and boost the interoperability of the self health the country fragmented healthcare systems, and something very, very important, to become cognizant of the interests of the new generations, to become closer, to make science, healthcare sciences more near. And all this is for boosting digital healthcare. When we talk about digital healthcare, we're not only talking about telemedicine, and we're not talking about history, digital clinical history. We're talking about digital transformation.
Ya.
Governance of human resources.
Nosotros tenemos las reuniones
We have the ministers of meetings with the ministers of healthcare, meetings with authorities, the authorities, national authorities of healthcare, and Andean Committee, Healthcare Committee.
para mejorar los sistemas de acreditación en salud. Ya hemos tenido
We have already have rate
con
meetings with
universidades
universities of your countries.
obviamente la
Obviously,
disponibilidad,
the
el
availability
reconocimiento de
and
trabajo
involvement of the workers,
comunitarios
communitarian workers, and their incorporation in healthcare teams. We have already have meetings with health, education, and reoriented curricular reorientation towards primary healthcare in all the healthcare careers, professions, and continue to articulate the dialogues with the different sectors, education, finance, work, labor, among others. Health continues to be a priority in the political agenda. We have had 3 years of having healthcare in the Senate. Well, now it's not at the Senate anymore. And so when you begin to take healthcare out, we don't have the budget anymore. In a few words, so if something important is that we work towards for healthcare to be where it needs to be. We made a leadership course for the management of policies, regulation, and planification of resources, of human resources for healthcare. We did this with Sam, with Hernan, and directed to 67 professionals of the units of the human resources units. But the most important of all, it was assessed and there has been surveys. There have been some surveys, and we have seen that the courses were good. So it's no good if we do courses, but the things that we do here are not implemented. This has demonstrated the synergy of the agendas and complementarity of the work of technical cooperation to implement in a joint manner the special monitoring plan of the action plan of human resources and the political and with the sub-regional program of the PAHO. Healthcare continues to be priority in the political agenda. What does this mean? What this means is budget. In Peru, what we're saying is without a budget, there's no rights. This is one of our uh, things we say. In to improve the availability of the resources, we did the conditions to a study of the conditions that influence the election of workplaces, healthcare workplaces for the development of uh, non-attended regions. There were 200,007 professionals and healthcare technicians. These responses are in the countries. So when we have a result, the countries get these results. What are we talking about? There are environments that impact in the attraction and the retention of communitary and family working in sanitary human relations. What is the next step in generating evidences? First, a baseline of human resources in the 6 countries. This is how we work, how the Indian works. We have a baseline to then a policy, and that goes to an implementation plan, then an assessment of all this. Something that was requested at the meeting in Caracas, that we needed a baseline to dimension and quantify the foreign professionals present in the system, in the healthcare systems. This was an agreement of the committee in Caracas in 2022. Mental health. We increased the budget for the ministries of health and for mental health with emphasis on human resources. We spoke with the coordinators that everybody has increased their budget.
También es
Tells us
importante
this
saber.
is really true. We need to know that this is true. We have the policy of Andean policy and plan of healthcare, mental health care. I would like to say that all these documents are agreed with all the focal points of the 6 countries. Nothing comes out if there isn't a consensus. We need to provide. We can't provide documents with for and two against. So everything comes out is when everybody is agreed and everybody agrees. We also had the International Congress of Mental Health through the course of life in December of 2021. Obviously, this was virtual, and this had the participation of 4,009 professionals. There is a self-care course on mental health directed to uh, healthcare border personnel with Ores and Congo and the FAHO OMS WDC. That was in March of 2022. So we assessed if to see if this works. So please place this in the agenda. We have the International Second Congress of Mental Health in December of 2023 this year. What are the things that we need to do? We need to insist on the assessment of the main actors, main stakeholders during the pandemic. Who were the main stakeholders? The ones that are in the first line. So there's many things that come out of this. Some are the violence, harassment, fatigue. This is something that we've always managed, but we don't have the answer that we need. And obviously, we need to implement concrete actions to preserve mental health and human resources for health. Why? Because we shouldn't forget that we are people tending to people. Many times one forgets that they don't have any mental health problems, but the figures are terrible. There, anxiety, depression. There's a lot of in our studies between 50 and 65%. These are very high. And I wanted to do a comment here, not only in the workers, the mental health rates are throughout the whole life. Children, youngsters. Remember that workers live in families. They're not alone. They have a lot of baggage. Strategies to rapidly train in human resources. We have planned courses with planification for training decision makers and professionals in healthcare in the 6 countries. And this was made with the Copenhagen Institute for Future Studies. Please take a look. This is fabulous. It was directed to 35 professionals with the RUS committee. We have just presented a project to the European Union to create the biobank for decision making. Let's hope this comes true. We have the course on intellectual property and application of flexibilities uh, joint with the South Center. We have done 163 webinars with more than 100,000 professionals and technicians connected to 600,000 reproductions. We also had 15 roundtables with experts and Andean. We did releasing of Lancet in Latin America with violence, treating about violence to women with laboratories. We had also have 2 conferences about medicine centered around or focused on people. Attention is, like they said the other day, now we're doing presentially what we're doing we did virtually. There's patients that prefer telemedicine. What do we need?
En Ginebra nos estamos yendo en 2 semanas para
in 2 weeks, we're going to Geneva for a new current conference. We need to diminish the gaps between education and health, the qualitative part and adequate the required skills. I would like to touch just about one skill, that is communication. Our professionals are not are going to be able to overcome in this world if they don't know how to communicate.
Yo estuve de
So I loved when I
montón de
was
aulas.
a consultant in Washington on youngster, and we saw a light, very nice book from the OMS that was how to treat the first line for youngsters and how to do the communications, because we need to do and how to know how to transmit. And then the quantitative, the calculating the number of personnel that must be trained to adapt to the realities of the sector.
Quiero robar lo que alguien dijo, pero me
And I
pareció
want to steal what somebody said that was very great.
pensar en los que se van a jubilar, ¿no?
Thinking of those who are going to be
Porque siempre
pensioners,
pensamos
because
en
this is
aquellos
going to
que
be
van
great,
a
because
quedar,
we always thinking of those who are entering, those who are came. I don't know, maybe because I'm going to become a pensioner. We need to think about the elderly.
también de
We're also
pasan,
talking about internships
pasantías con los institutos.
with the
Gente que ha
institutions,
venido de Bolivia
people
y
that have
Perú,
come from Bolivia and Peru
les ayuda.
for the Indian Healthcare Organization,
Ha sido el Inforus del Perú,
the Infrarus
hay
of
alguien que está
Peru
interesado en ir,
is
nosotros
somebody's interested
podemos
in going.
colaborar,
We could
podemos decir, ¿saben
help
qué?
collaborate
Hay que
so that
aprender
we need to
la
learn.
cooperación
Uh,
sur-sur.
and this is the famous South-South cooperation.
Consideramos
So
implementar
we
programas
consider
nacionales de
there is
capacitación.
national
No, y también
training
escuchando
programs,
todas las...
plans.
¿Me
What
da
I
una
have been
cortinita por ahí?
what I have been listening and
Todo el
seeing,
mundo capacita en diferentes formas.
everybody trains and educates in different forms.
Deberían haber planes nacionales
So
de
we need to have
capacitación,
national
obviamente tomando en cuenta
educational
las
programs,
diferencias.
taking into account the differences we have. Common challenges.
Ay, ¿cómo?
Common challenges.
¿Qué hago? Ya. Haciendo un resumen.
To make you summarizing, what are the common challenges where our Horas Conas can or is already doing and will continue doing? Strengthen,
Que la salud continúe
making
en el centro de
healthcare continue to be in the center of the policies.
presupuesto,
Without
no hay derecho.
without budget, there's no rights. Maintain the human resources as a fundamental pillar of the healthcare system.
Vuelvo a decir lo que dije la
And
mañana.
as I said this morning,
De nada sirve que yo
it
esté
nothing
certificado
is
si no
I
tengo
have
la
all the
capacidad de
training
ejercer
if I don't have how to operate what I have, to guarantee conditions, labor conditions, to contribute to a dignified life, having national education plan to promote inter learning and
yo te vengo
educational interprofessional education.
Estados Unidos, de Europa y me dicen,
When they
vamos,
call me from Europe or United States in the United States,
siempre yo le digo, no, tú aprendes y yo aprendo.
no, then I say, when they come say, I'm going to teach you, then they say,
Es
no,
una ley.
you learn and I learn.
Es interaprendizaje.
That this is called continuous interlearning and interprofessional education, because we all should be go there together, not know each other only in the internship. And the last thing is prioritize mental health and human resources. I had I was at Harvard during for the violence, and the first thing they told us that the most important part was the mental health of those who provide the attention, the care, because already that we also have anxiety, PTSD right now, but the percentage of burnout is high, and we don't know how to face it is very large. But it's also true there can't be mental health if we don't have physical health. If we don't do physical activities, this is why we have pauses. If we don't do different things, different from working, each one has their own
Por ejemplo,
form.
me gusta pintar.
For example, I like to paint. Everybody has their different thing of how to interpret. And one thing I have learned from my guru is for at least one time a day, for 5 minutes, get disconnected. and think what new dreams you have for later. Okay? Thank you very much.
Estos son nuestros lemas.
These are our mottos. Together we're stronger. Together we'll go further. But it's not only 23 of the executive secretary. We have almost 200 person that of the 6 ministries that work with us. Thank you very much.
Bueno, muchas gracias.
Thank you very much, Mari Carmen. You surprised us with your Hinduist lesson. Excellent. Then you will give us the data. But Juana Paula was talking about the last things. She'll provide us another thing. In Africa, they say that if you walk alone, if you walk alone, maybe you'll get there faster. But if you walk together, we'll go further. Between India and Africa, we're getting. Then we'll come back to South America. In South America, we live. We like to live. We live good. Yes. Now we have integration mechanisms with Mercosur. We have always had. We need to be very formal with the Mercosur, but what we do in this case is that the countries that are part of Mercosur from the three regional program, we have a cooperation space and permanent work. So Mercosur benefits from that. So in representation of the countries that represent Mercosur, so now that Argentina has a pro tempore presidency, we asked them to do this presentation. So Emiliano, please take the floor.
Claro, si no,
No, porque ahora representas a un mecanismo de integración.
You should have said they were the champions, but now he is. They're also the champions of America because they didn't play any final with Chile.
Bueno, acá le voy a pedir también a las y los colegas de los países miembros.
I ask the member so you can contribute. So it's not only me chatting from Argentina. And so we said we are the pro tempore presidency, but this means that the presidency changes every 6 months, and we need to learn a lot from the organization. This is a great advance in regards to Mercosur. A lot to learn.
Really, there's a whole organizational chart in regards to health from Argentina, from specifically participate in the development and professional exercise subdivision, because many other subjects are not being covered. Specifically, they're being covered under the umbrella of training, professional exercise, and obviously regulations. In general, objectives of the national coordination, the umbrella is the free this circulation of goods, services, and productive factors, coordination of macroeconomic and sectoral policies, and harmonization of legislations. Now, allow me to say that the Mercosur challenge is like if workers can take care populations, the borders many times arbitrarily limit them the access without having any legal risks, and they matching in certain standards of care. So I think that's a great challenge that gradually was being developed throughout the years. That means that in 2020 there weren't any meetings. There was just one meeting out of the two annual meetings. 2022 there were two meetings, and the frequency of meetings is way less. I think I had mentioned in Peru, one meeting a month. I don't know if I'm mistaken. One meeting a month. Okay. The building of consensuses, of documents and advances. Of course, it's an extended, more extended rhythm than the one we would like to expect. These are some achievements and some things that we worked out last year. Here there are standards and resolutions. Mercosur healthcare professionals registry minimum matrix. It's 150 pages. It's a 2014 document, which lays the foundations for so that registries have nominal, robust data, and that they match so that we can dialogue, so that the worker can have common attributes. But it's not as simple as that. Making this match is not as simple as that because treatment of personal data slash sensitive. Each country and states have their own regulations. Not all countries can um, keep this data in the registry. In Argentina, we did it very robust with a degree of information. The Federal Network of Healthcare Professionals Registry, really, there are millions of specific data, and we're taking advantage of it, as we said before, with different other things to analyze information. But that is a great challenge that we have to even ending having web service to have web services that can look up and each country can have those data that we can see beyond the borders. If a professional is on one side or the other of the border, and to have the valid knowledge. Okay, what are the professionals we're going to address all the efforts for everything that I said in the previous slide? Skills or standards of skills, regulations that allow us to exercise, that allow them to exercise, healthcare professionals, doctors and specialists, but also what is the healthcare team that we're going to define in the last ones that were incorporated. First, ethical principles, then ethical principles on what to do and how to do this care.
La verdad que el plan de trabajo 2022
Really, the 2022 work plan was taken to 23, 24, and the most important issues that are on the table, on the agenda, or in the agenda, from the knowledge of these 2 days of work, I think we have to take another agenda, or at least propose some other things that have to do with this. Continue with the minimum matrix implementation so that all countries can upload and have their own information systems and interoperate. Great challenges they mentioned in the Andean region, something similar. Compatibilization of several higher education and technical level professions. We'll talk about it in the next slide. How professionals can go around and move or mobilize and recognize their training paths. Because if a professional goes from Argentina to Brazil or from Brazil to Argentina, they have to take a test and they have to do administrative process of 6 to 8 months to be able to exercise. Evidently, there's something that's not working in the local integration, and those are the efforts that are required. It's not easy because each country has its own accreditation mechanisms, which has to do more with the world of education. So there we're intermediate speakers in Mercosur. Some concerns in the post-pandemic scenario. Reality is that this slide was done before these 2 days. So I think that very quickly it would be a challenge to write with the country's 3 to 4 points and to take it to discussion. But discussion about mobility and temporary exercise of professionals healthcare professionals in the border. Pretty much the same thing that we said before, with regulatory issues, permits, to agree on the set of indicators, but also the set of professionals. We're going to call them workers, uh, the hard medical field, but also of all the other professionals that are part of the team. Of course, join the data. There's an educational Mercosur. There's a healthcare Mercosur and an educational Mercosur. So here we need to work on these things that we talked about. That's why I'm saying the complex of all this institutional interdependence. We need to put there the telehealth issues on the table. There are already difficulties in the countries in Argentina, country in Argentina. There we have a lot of telehealth development. We have a teleconsultation platform. We're at a medium level of development. Therefore, it's hard for us to know who's responsible for the care of patients when the patient is in a place and the physician is somewhere else, and the patient took corticoids and then something happened, and then where is justice there? So that discussion is not complete. So it's not easy in the Mercosur countries and related countries, associated countries, who are also here in tele-education and online education. How do we also generate standards and are confident that professionals can train with training projects, online campuses, and we can give them credit and we recognize them and certify them at an online level? I think digital health is way more than TV education, etc. But we tend to focus on tele-education and tele-assistance in many countries because of the pandemic. Really, this is pretty much what I wanted to bring is little, but also to share the floor with colleagues from Mercosur. I don't know if you want to add something else. The only thing I could say is that the experience of a minimal matrix, the creation of a minimal matrix was a founding experience. I remember at that time when the ministry actively worked with the other Mercosur ministries. Gabi Pradera, I think she was there. Maybe were you there? Not directly. Okay. It was an experience carried out by the ministries, which was very rich and it generated a publication from Fajo, in which laid the foundations, at least in Argentina, for what later on was the healthcare professionals registry. And it really was a great progress. And I think we could continue emulating that experience with some other subjects, which need to be coordinated at the level of countries. It was a very exhaustive work uh, uh, because each profession has had at least minimum 18 ways, at least 18 ways inside each country. It was very important work. Really, maybe other countries are now, or some of you were in the Mercosur meetings, you can mention more about it. I apologize that I used templates, which was not the one. It's okay, it's okay. No problem. The presentation was brief. Yeah, it was very well. No, but very well. And I think it's an opportunity also so that the rest of the member countries, and that's what Deborah was saying, if you want to contribute with something else, and for the two presentations, we have the one that the Andean Healthcare Organization did, and then the one of Mercosur. Cristina Caballero. Caballero. I don't know if you say Caballero. It's okay. Well, first of all, we have a representative, a country representative. You're not hearing? I just wanted to convey that the document that was drafted of the healthcare professions catalog was useful for us to draft our catalog in the country. And it was also used, the specialties catalog was also used as a reference, as a benchmark. It's a specialties catalog. It's not a specialties catalog, it's a list of medical specialties and specialties. And a medical catalog that goes a bit beyond. But yes, it is important to encompass other areas of healthcare sciences because nursing, dentistry, biochemistry, psychology, we started to draft other chapters of the catalogs, and it has been of a lot of use. I think they are very important tools, but still we're missing to work a lot, and everything that has to do with the matching of titles, with the limitations of specialties, those needs that all of them, the scientific society, medical scientific, which we gather, want to go beyond a list. They want to delimit, por lo menos en otros eventos. That the baseline is defined. What's concerning is the specialties that come out. I'm gonna say a word by spontaneous generation. There are laws that we have in Paraguay in which specialties starting from 100 hours is considered a specialty. That's not feasible for medicine to use it, but we need to work in that. And if we work as countries, it's easier to say what specialty need of a main one to be called specialties. Doesn't work as complicated, but that all scientific societies are asked for. And if we work it within the group, it'll be ideal. It's complex.
Gracias.
Thank you, Christina.
Últimos comentarios. Sí, Gaby.
Comments? Yes, Gabi. Yes, it was especially a question from the first presentation. Maybe you could tell us a bit more because you proposed the assessment of some measures that are taken, especially in training. And for us, that's an aspect that we have in the must do. We've had an important growth in training and online platforms, and we see that it has a large complexity. The impact measurement, we can talk about impact measurement because sometimes we're talking about small trainings, which is difficult that they have. I'm saying because there are some currents that they say, okay, after this course, we need to see the health in population improved. But there are a lot of other factors, which is not only, but yes, to have an indicator that allows us to give the discussion because it's difficult for me also because of my professional training as economist. It's difficult to say it's not possible to measure the impact of this, but yes, to go around it to see up to which point this trainings you can measure not an impact, but yes, that they can contribute at some extent. If you had experience in the measurement of online training, okay, Mari Carmen is taking note because we're gonna make a round and then Lisa from Brazil, please.
Primero uno que no funcione, después el otro que funcione para seguir la tradición.
Hello. There. First, for Brazil, it's also very important. We who are in a transition government or of some problem because there isn't a dialogue for update information. So here, as here, we're also doing that, and we're gonna see the next representations because today, ISA is like the ministry cabinet, but the agency that assumed that role was closer. We're in an internal dialogue to show our full interest in participating and contributing with these debates.
Muchas gracias, excelente.
Thank you, excellence.
¿Alguna otra intervención?
Any other intervention?
Sí.
Yes,
Vilma.
Fatima.
Sí funciona.
It does work.
Bueno, creo que en la misma línea de
Okay,
lo que
I
se ha
think in the same line
mencionado,
as
creo
what
que
has
es
been
importante
mentioned,
que podamos ver
I
en qué
think it
medida
is
podemos
important to see
apoyarnos
at
en
what
esa
extent we can
cooperación.
support ourselves in terms of
Hay algo que
cooperation.
les contamos que
And there,
como
for instance,
hemos
we can
hecho
tell you that as we saw yesterday
iniciar
afternoon, we're going
procesos
to
de formación
initiate
masiva y
massive
posteriormente
training
empezar a
processes,
contar con la
and it'll be very
experiencia de los
important to have
países que ya
experience
tienen
of countries who already
atención
have
primaria en salud,
primary care
que
or health
podamos tener en cuenta
primary
trabajo
care,
con equipos
that we could have
técnicos ex
encounters with
de, en el
technical
caso
teams
de
from the
Brasil
ministry.
importante,
The
en
case of
el
Brazil,
caso
for
de
instance, is
Chile,
important. The case of
a
Chile,
Bolivia
Uruguay,
también
Bolivia,
seguir
Well, and there we can go on and on.
Que sería interesante que pudiéramos hacer una especie de
I
agenda
think it'll be interesting that we
hacer
could do some
este
kind of
evaluación
agenda of
para
possible
más o menos lograr
cooperation
abordar esto.
subjects. Like, okay, I can give this, I can provide
Hemos
this.
adelantado esto
With
y pues
we have this
vamos a ver qué
progress
podemos
on.
aportar,
Colombia will
pero
see
sí
what we can
creo para
contribute
poder
with,
hacer ese tema
but
de
I do believe that in
cooperación
order to
y un
do
tema
cooperation
más de
and
unidad
more
como,
of
como equipo
unity
de
as
desarrollo humano de
human
Sudamérica,
talent
eso es
team in South
necesario.
America, that is
Lo otro que
necessary.
tú
And
planteaste
the other
es
thing
el
that you
tema que
proposed,
se
which
llaman
is
las
what's
convalidaciones.
called
Terminamos
the
hace unos minutos
validations.
hablando del tema de convalidaciones y
At
creo
lunchtime, we
que
were talking about
como estamos en
um,
Sudamérica sería
validations,
importante
and as we're in South
iniciar
America,
ese
it'll be
proyecto
important to
de un acuerdo de tal
define
manera
some
que
kind of agreement in
facilite la
such a way
movilidad de
that
nuestros profesionales en
it
los países de
facilitates
la
the
región,
mobility of our
¿no?
professionals
Y porque
in the
también
regional countries.
piensan
And
que
also
van de
because
Colombia a otros países como
either
Estados
they go from
Unidos,
Colombia to other countries or they come from other countries
de
to
una
Colombia,
validación de
there are some
títulos
kind of
para
title
las
validations
características de la
that because
formación,
of the training
las
characteristics,
mejoras,
number of
las
hours,
prácticas, los enfoques,
practice,
no es
approaches,
posible
it's not
homologar y
possible
los
to
profesionales pues llegan con la
validate.
expectativa de
And
poderlo hacer y no
professionals
pueden
arrive with the
hacerlo.
expectation of
Entonces
doing
creo
it,
que
and it's
sería
not
bueno
possible.
dejarlo
So I
allí
think it'd be good to
como
leave
un
it here
punto de agenda, como
as a
una
point for agenda,
reunión, como
like a
una,
meeting,
no sé, un cuestionario donde podamos
some kind of
decir,
questionnaire
en
where we can
Colombia
say,
tenemos
okay,
esto,
in Colombia we
por
have
ejemplo, en la
this
Dirección de
because
Desarrollo de Talento
in
Humano,
the human development
pero tal vez en
division
otras
or
direcciones del
directorate,
Ministerio
it
de
may not,
Alimentos,
but in other
como
maybe
usted
in
se
other
podría
directorates of
poner
ministry,
para
there are
apoyo
things that
de
could
los
be
otros países y pues para
made
nosotros
available
todas
for
las
support of other
opciones que
countries.
tengan y
And for
formación
us,
pues son
all options
bienvenidas
that
en
come
ese
of
sentido.
training are welcome.
Gracias, Dilma. Mira, una de las
Thank you, Dilma.
características que
Look, one of
nosotros
our
como PS y también
characteristics
los
that we
mecanismos de
as
integración
PAHO and also integration
tenemos
mechanisms we've had is
precisamente generar estos espacios
to
de
generate these
encuentro.
spaces for encounter.
Yo recuerdo cuando existía
I
UNASUR,
remember when
la Comisión de
UNASUR,
Recursos Humanos de
there was
UNASUR,
the Human Resources Commission of
que
UNASUR,
funcionaba bastante
which
bien,
were worked
sacaba
very well.
el Comité Andino de Recursos Humanos, es un
The Andean Committee of Human Resources is a committee that has permanently worked, but we always
PS
from
Sudamérica
PAHO South
hemos
America,
convocado a todos
we
los
have
países de
summoned all
Sudamérica
South American countries
permanentemente para estar trabajando.
permanently to
Incluso
be
hacemos
working.
acuerdos con el ORA para
Even we
que
do agreements with the ORA, so the in the space after the general
los
call,
andinos
the
conspiren todos
Andean
juntos, ¿no? El
get
Comité Andino.
together to
Entonces,
conspire
lo
together.
importante es que este
What's important
intercambio,
is that this exchange,
este intercambio que se da ahora es muy rico
this
porque se
exchange that's
genera
happening now is
online.
very rich because it's the one generating these
Virtuales
spaces.
son
Online
importantes,
meetings are
pero
important,
no
but
permiten esto,
they do not allow
no
this.
permiten esto
They
que
do
es
not allow
que uno se
this. They
converse,
do not allow us to talk at
que se
coffee
generen
time or break
espacios.
time
Y acá el
and
rol tanto del
spaces of
Mercosur,
interaction. So the
OEA,
role of
llegar a un
Mercosur,
acuerdo
OIS, and sub-regional
PS para América del Sur y
PAHO
América
program
Latina
for
lo
South
hace
America, and of course
para
WHO, is to
facilitar
support
este
all
intercambio.
of this
Porque
exchange.
nosotros no somos necesariamente los más
We
expertos,
are not necessarily the most
somos
expert ones, but yes, we are
articuladores que
articulators
hacemos y
who
facilitamos eso que dice
we
Dilma.
facilitate that what you're saying,
Lo que
Adilma.
yo sé lo puedo
What
aportar
I
a
know
ustedes
I
y
can
ustedes me
contribute
pueden
with, and the
aportar lo que
others
saben.
can give me what they have or share with me what they know. Mario and then Alicia.
María Alicia y
Sorry,
después
first
Mario.
Alicia and then Mario.
Ahí está. Tenía primero que no funcionaba.
Ya, muchas gracias. La
Thank
palabra.
you for the word, for the
Creo
floor.
realmente
I
la
believe that
experiencia de mi
really
país
the experience of my country was present in the last meeting in Caracas and now.
en estos 6 meses
In these 6 months, really, there has been
una sinergia.
a synergy.
El haber escuchado todo lo que hacen
Having heard everything they do
humano,
now is higher because
todo lo
we've heard all the
hecho,
what we have all done
lo
during
reci-
this time.
hablando muy rápido,
Sometimes speaking very fast.
se agolpan las ideas, quieres decir más
I
cosas,
mean,
no
in
sabes
the
cómo
ideas
decirlas,
you wanna say
pero ha
more
sido
things and you don't know how to
de
say them.
experiencias
But it's one of the
que creo que más
experiences that I
valen,
believe
¿verdad?
that can um,
Y de lo que nosotros
contribute the
podemos
most
llevar
with
a nuestro
in
país.
from what we can take home to our countries.
Personalmente, creo que
Personally, I
esta
believe that
experiencia debe ser más frecuente.
this experience must be more
Porque
frequent because
el ejercicio de sentarse
the
y no
exercise of
distraerse con
sitting and
nada,
not getting
que no
distracted
sea
with
el ponerse
anything
a
else
pensar
that's not just thinking on
qué tengo, cómo
what I have, how can I improve, who do I tell, where I go, where do I look for. It forces us all like to say, okay, you're doing that, I am starting. Where do I go to? What do I do? Who do I request help from? So first, I think the experience that was from my end in the meeting of ours, it was inspiring. I started 1 month after the law had been approved for healthcare career. Really, very scared. That doesn't mean that I'm not scared now. I'm still scared, but at least I have, I know I have the support in here. Javier all the time is like he says, I, it seems like I'm the ugly girlfriend in love. It's not ugly because every few minutes it's like an email. Alicia, what happened with this? What happened with that? What happened? And I say, oh my God, and now what am I gonna respond? And I tell them, okay, we're in the process already. I did a meeting already. I went there, here, there, beyond. Instead, I thank him a lot for that because through him, still also the minister asks me what happened, where are we? Please give me some feedback. Who else do you talk with? So I think that's a situation for our countries, and that I really feel like part of all of you. I think we're all human beings, and we all deserve that health and that life, that quality of life, life with dignity. But um, oh, I feel uh, sad with those professionals. Um, like almost I left you also because I got COVID and it was difficult for me to recover. And we go in with the hope of changing, and I think it is a crucial moment for all countries in which we started to um, start with new ideas, new things. How do we improve for life conditions as conditions life of population? And it is a we worry more about some, and when you get to the country and they tell you, okay, give us a report on what else or what you did. So I was desperate, taking all the notes and taking all the note the to say, okay, we're gonna get into my criteria. We're gonna go this way or that way, but definitely on behalf of everyone, we want to thank for the support and to ask that we continue to do this. Now that we don't have, that we're not too afraid of traveling, that we can go on with this cooperation to learn new things, that we can take those things to our countries and that we can implement them, even though in a rudimentary way, in a very incipient way, but that we can do it. Things that do not exist. We're all seeing that, for instance, as what Emiliana says. I went around there and I was seeing that we are all thinking on indicators. How do we measure universal indicators that are going to help us for the calculation of optimal matrices and gaps, for instance? I have the idea that they should include us this way, and we should learn well, or that we do a literature review at an extensive level. I think we're all in um, and we're willing to do that, or we have the skills to do that, and we get indicators that we talk about the mobility among our professionals. I'm saying because I have to be every week in the validate title validation meetings or accreditation meetings, and we spend 8 hours checking around 30 to 40 titles that we receive pretty much from Argentina, from Chile, from the US, from Italy, that they get to Ecuador to work. And pretty much one of the attached standards of the law is the manual of spots of positions, and it is the categorization of all professions. So I propose that yes, we should get together and work in this um, validation, not categorization, whatever we want to call it, on how they call it in different countries, harmonization, and different specialties, and that we can use a language that then it can be conveyed to universities, because one thing is that some get a specialist in vascular surgery, and another thing is the specialist in um, phlebology, and it doesn't work in the country because it's not the same. So I propose that this meeting, yes, it has to be held, and maybe as soon as possible, because that's one of the problems that we're all facing. Pretty much it. Thank you, Alicia. We have a very short time. We're gonna give the floor to Mario, but what I can say is that we, from regional program and also integration agencies, are going to retake this habit of constantly meeting as the ones in charge of HR to have a dialogue space of what Alicia was saying. Mario, please, and then
I just wanted to make a comment of what Diana suggested. Thinking of the roadmap, maybe in some time each country can do the think about of what we're agreeing in jointly for the work plan in the future. What has the greatest level of development that can be and facilitate from PEJO a repository of documents and tools that can be used in practice for the work of each of the countries has to do. And also, that would be the starting point for a cooperation project between countries or mechanisms that can help for that cross fertilization and the learning, as Mari Carmen said. Excellent. When we started to do this plan of action plan, what for each country we just told him what are your strengths and what are your action plans. I think there's a need to continue to interact, to continue to be associated, and what see what we have in common, and cross fertilization, as he said. There's the microphones. When we started in management, that was in 2020. The first thing that we said that everything was to be assessed, and we were talking about education, forming. All the trainees all the trains were assessed, and all the courses that we have done. This course on leadership that we did for managers, and there were people from human resources. This was a 6 week course, and it was in November of 2021. And in 2022, we made the assessment. How did we do that? That about impact is impossible, because when we talk about impact document impact indicators, we can't ask about we can't ask of what more of what we can do. The course is a line, and it has other action that we need to have things to do to be able to talk about impact. But we did do a survey with 26 questions in 5 sessions. This means we have talked to everybody that was there of their data, of your expectancy, and the objectives about the lessons learned, and if they have transferred these lessons learned. A very interesting thing was that not everybody answered as already happens. So please, I ask of you, don't be bad. Please reply, answer to our survey. There were 54 surveys and only 24 answered. But what was interesting and it was basic, and they were all in the areas that where they were. They hadn't been mobilized, and this is a very important indicator. So what is happening not only in our countries but in the whole world? There's a rotate. So much rotation. So we talked about that yesterday with Venezuela. I remember. I don't remember who it was. The ministers and vice ministers, consultants, advisors can't stay that much. But there's a technical technician, critical mass in every ministry, and human resource is critical mass. So we have to talk with those who are going to stay. That is the idea. So then, since we started doing this, it's been better. Thank you very much, so Mari Carmen. Thank you, Emiliano, and the countries of Mercosur. So 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 what comes next?
Solo una cosa antes de la bolita. Es que Gabriela mencionaba y otra vez
The one thing
enfocar en
before
el impacto, análisis de
the little
impacto.
bill, the
Nosotros,
impact analysis, impact
estamos
analysis.
empezando desde la OMS,
We're finishing from who?
sí, es una evaluación,
It's an
es
assessment
Assessment of Employment
uh,
in Health,
of employment and health,
de empleo en salud. Y en eso lo estamos
and
haciendo
in
a
that
3
we're
niveles,
doing it at three
porque
levels.
precisamente el impacto pues
Because
es
the
súper
impact
bonito,
is
¿cierto? Pero
super
necesita una
lovely to
base
do it,
claro.
but you need a baseline, a
Entonces lo
very
estamos
strict
haciendo
staple line.
en unos niveles y lo
So
vamos a publicar y
we'd,
hacer de hecho un
we're
piloto.
publish it, and then we were gonna have pilot plans. So we'll send it if you want to do it. Christina, do you want to say a very brief thing? I just wanted to say something with regards to the last thing she said about courses of leadership. First, I have to say to thank because there was only two quotes for Paraguay, and now that we have more quotas for Paraguay. Thank you very much. We only had two, now we have more. Had been training um, a great team, and this marks a difference because the officer has another vision of the work, a more strategic vision that will allow him to see the perspectives of the mission and the strategy that they have. And this is important. The photo didn't work, and all the tools that we had, policies for implementation plans. So those that learning session is essential, not only for directors but also for the middle management. Yarita, briefly, then we'll do the other thing. When in regards to the course for Andean region, the amount of quota was members was biggest large. This was course after the leadership course. Then after we did the virtual campus course, that we had some achievements. We adapted coming from the things that you said. We adapted this to do. We open this so we can have 10 members from each of the country. Even there were regional teams from strategic alliances that were from Ministry of Education, policemen, because it was very interesting in the Andean region because of the aperture of the opening we have. It was super interesting. The strategy was super interesting. And to say that these types of assessment helps the virtual field because it was help, along with the virtual campus, and 6 months later, and who are still in the workplace in their specific position. 17 of those that the reply they answered, 17 are still in their workplace, in their work position, and shared what they were doing from the work they have done before. Now we'll talk about Lotus so they can do your performance. So I could do the I could go take some coffee. Today it's gonna be without any little balls. Those want to go, those want to have coffee. I will go dancing.
Buenas tardes, desde el organismo estamos muy felices de recibirlos en esta actividad saludable. El golpe de ala, esa es la actitud. Nos fuimos, mueve esos brazos, esos codos, esos hombros. Perfecto. Y después de eso, siguen los ganchitos.
La pauta es ahora que con esos papelógrafos, cada país, al lado de su papelógrafo, va a ir entregando sus prioridades. Diana Hernández va a estar sistematizando eso. Sí, y posteriormente vamos a entregar una devolución sistematizada por parte de Diana y el equipo de la OMS. Entonces ahora la idea es trasladarnos de nuevo a donde estábamos en la mañana y Diana va a dirigir esta parte. Y como les digo, lo importante es que después de la sistematización que se haga, vamos a hacer una devolución a todos ustedes para ir ya definiendo las hojas de ruta.
Otra cosa importante, recuerden los países del estudio, los 5 países del estudio están manejando las notas de política. Ya recibimos los comentarios y ahora la parte administrativa, esta vez se la voy a dejar a Hernán.
¿Cosa de qué?
La de publicación de las
notas. Me acaba de sorprender, mira que eres tierna. Yo también te quiero. Ya, ok. Vamos moviendo para allá.
Lo que pasa es que
Hola. No llegó. Solo que el minutito.
Sí puedes porque yo el mío está conectado. Conéctalo bien, conéctalo bien. No, arréglaselo porque el mío está siempre conectado.
De los 5 temas.
Cualquier cosa puedes usar el mío también.
Van a hablar todos como Perú.
Bueno, Diani.
Bueno, mientras van llegando, les voy contando la dinámica. Listo. Entonces, nosotros tenemos, digamos, la información consignada ya en los papelógrafos, ¿cierto? Como en términos generales, ya se pensó en todo de los 5 temas. Ahora lo que necesitamos es poder establecer de ese universo, podría ser lo prioritario. Entonces, para que podamos priorizar, cada país va a tener un espacio de 3 minutos para hablar de los 5 temas. Entonces, toca hablar realmente de lo que es prioritario. Entonces, como ya en la mañana se estableció, digamos, ya se plasmó todo lo que se necesitaba, ahorita el objetivo es priorizar. Ahora, es muy importante. Esto se va a sistematizar en su totalidad, porque está ahí. Lo que estamos buscando es terminar el ejercicio con la priorización. Y ambas cosas, tanto toda la sistematización como la priorización, va a ir en el reporte. Lo que pasa es que necesitamos tener la información sobre la prioridad. Entonces, si les parece, democráticamente empezamos en orden alfabético por Argentina.
Hay otro tema en parte de la priorización, son los temas, pero agreguen también, tengan en cuenta que aquí está el Horas Cono y está OPS, OMS, ¿sí? Entonces, eso también nos ayuda para focalizar si necesitan de nuestro apoyo, en qué áreas van a necesitar nuestro apoyo. Pero es una combinación, temas transversales como temas país, ustedes están trabajando país y punto focal, entonces hay muchos temas de acá y por eso se va a sistematizar, que les va a servir específicamente para sus actividades y plan de trabajo país y otros temas que van a ser apoyados a nivel subregional.
Finalmente para completar, de lo que es prioritario, también es importante ir viendo qué es común para mi país. Entonces, de eso que está viendo Argentina, que es prioritario para ellos, que es común para mí. Porque eso nos ayuda a identificar también las acciones que van a ser transversales a todos los países. Listo. Entonces,
Hola,
para
hola.
que tengan el espacio son las 4:44. ¿Les parece si empezamos a las 4:50 el ejercicio? O sea, empiezas a las 4:50 y ahí la, la cara de Alejandra. Entonces, señor.
But yes, you have it in your heads?
No, no, de una vez, Emilio, de una,
No.
¿sí?
Okay, right. Yeah, immediately. Yes, immediately. Go ahead. 3 minutes only. Well, I'm starting now. Well, from the first point, information systems to teams, we focus on the analysis. The analysis, which is the second step of the data recovery, and especially the matrix, we focus on the gaps matrix. Information systems, AI, and to be able to have a software that allows us to estimate human resources. Second, governance from a high level, having meetings with high level, with universities and ministry and defining specific lines of action, especially with a focus on labor market. Distribution availability. Two things to bet to the care model, also with specific changes and very precise ideas and the change of tasks. And we bet for the change of tasks and roles, task sharing and shifting. We want to distribute is knowledge, capabilities and skills above people also, right? But skills and knowledge. Training. Permanent healthcare education. What we said before, impact indicators. To close with you, 10 indicators of impact of permanent education. Transformation in practice, transformation at work, about courses, texts, pens, transformation in practice, 10 indicators of impact. And lastly, mental health. Okay, yes, to continue to deep dive into internships in community mental health, to continue to deep dive in incentives in community mental health training. There's about to start a community healthcare diploma degree, preliminary pathologies, but also to work in determining conditions and the psychodynamics of work, which is essential for these issues. I'm not going to read anymore because we took the 3 minutes very seriously. Okay, it's okay. You still have some time left. We would like to say more. Out of everything you said, tell me two things that could be done at a sub-regional level. At a sub-regional level, for me, it's to work in the harmonization, harmonization and validation of titles, free passing of professionals, and information systems put on a table for metrics, softwares, and things that allow us to make decisions based on evidence. Okay, thank you. Paraguay? Hi, can you hear me? Yes. Oh, it's by alphabetical order? Is it by alphabetical order? Alphabetical order? Okay, Bolivia. You ready? Okay, perfect.
Bueno, sistema de información.
3 minutes. Information system. The most important thing is to consolidate the information system and broaden in the primary healthcare. Primary care. Important in the analysis, gaps analysis and calculation of those skills. And in the work group, technical human resources team, along with the Andean community, to make up working groups in observatory lines In that case, we have as a challenge to update that staff and to broaden teams at a local level. In regards to governance, ministerial board supervises all the human resources policies. In this case, challenges to integrate these actions constantly and regularly in the government levels. In all their structures are focused on working jointly to guarantee operational in the health care national service. Human resources, we have two structures, Article 8 and rotatory residency for internships for hospitals and for all the territory prioritizing vulnerable areas. In this case, the challenge is to consolidate the availability of information in those vulnerable regions. Human talent training strategies. In this case, challenges is continuous training, incorporation and update of technology for training, and incorporation of uh, professor staff, especially at a technical level. Specialization, broadening of EPNFA programs as intensive therapy and neonatology. And at a technical level, the integrated incorporation of training teams and tele-education in online triage. It's important to increase connectivity in vulnerable areas because that's one of our weaknesses. At a level of mental health planning, plans, support groups, consolidation of programs, awareness raising on the importance and relevance of mental health and the healthcare staff, safeguarding of the exercise to keeping safe security measures and talent to give non-monetary incentives of training, and at a level well-being, consolidation of teamwork strategies. It's a whole challenge.
Yo creo que la capacitación
I
consecutiva
think consecutive training and levels of information, constant update of information levels. Bolivia.
Ya, hola. Hola, hola, ¿se escucha? ¿Se escucha? Hola. Ya, ya, la experiencia de Bolivia.
Bolivian experience.
Caso de Bolivia,
So for the case of Bolivia, we have the strength identified is the human resources policy of human resources strength for that. Our strength, in regards to improving the part of governance and in regards to stability of what's referring to specialists, who are trained for the policy. So as objectives identified, we have the use of data, strengthening the information system in a comprehensive way from the central level, the Ministry of Health and Sport, to integrate subsystems based on the information systems of the Ministry of Health. So for ourselves, what's most important is the part of systems. In the next slide, there is the governance of resources. For that, we propose to strengthen the space of meetings with different levels of government to identify what actions they will perform and how and in the implementation of the country policy. And the next one is to improve availability and distribution of human resources. We proposed a gap study at the three tiers of care, levels of care. For that, we proposed an exchange of experiences among the countries. For the following one, we talked about strategies for training, human resources for health. For that, we talked about for strengthening the Bolivian node online campus in partnerships with the universities of the country, adopting a plan of education addressed to the healthcare staff in the four levels of care. In mental health, we were lacking time, so it was identifying gaps in regards to the healthcare human resource who take care of health at the four levels of care and incentivizing a higher inclusion of professional psychologists and psychiatrists in four levels of care. As there are some seconds left, what would be the work at a sub-regional level? To continue to work in governance of human resources and in the use of data of information for information analysis. Okay, perfect. Thank you very much. If you would like, we can go on with Uruguay. They run away, yes. This volatility of public policy. In the information system access, we identified as priorities or in actions looking forward is the gap study, which we saw is the constant of all the ones who are participating to continue to advance. We have some advances, but they're partial, especially with has to do with the leg of the identification of needs. We have good indicators in the supply, but we need to advance in the needs in identification of standards and models for the country, models of care, broadening of the scope of the information system, and strengthening of the planning capabilities by the ministry. In regards to governance, one of the great must do is articulation with training institutions, especially to institutionalize it and to generate permanent spaces of articulation with those sectors to improve management in the public sector and what has to do with agencies, organizations who provide public healthcare service, and integrated with other ministries as finance, etc. And again, strengthening of the governing capabilities. We're making a list of claims for the ministry, for the minister who just started, or her government plan, yes. In the access of availability and distribution, the focus we put it here in decentralization of training, which probably is the one that's farthest from our ministry. But for us, is the essential one, is the main and most important one. In sense, is for graduates in nursing, and then advancing in operational definitions of the medical internships on law, finds the slots of specialties, and to work in the convergence of work regimes and salaries between the public and the private, and among public providers, and the issue of gender, which we have been proposing it in a I'm the promoter, the advocate, but the elected have come.
Capacitación,
What has
retomar
to
el
do with training, so retake the previous access. Several points are like cross-cutting, right? And then to progress in telehealth, and what has to do with the regulation itself of what telehealth is and what are the operational definitions, training of staff in these matters, in these regards, and also the definition of working conditions and compensations related to telehealth. That means the consultation is paid the same, hours, how is that implemented in terms of um, the work of staff. And in mental health, there is everything. We had a lot of more post-its, but just failed. But the first thing is to incorporate it to the agenda, which is a great must do to define what has to be done, how to do it, and to generate capabilities within the ministries of for developing these policies, which I believe is kind of the cause and why this subject hasn't been developed yet enough. And the two regional subjects.
Bueno, en realidad son definiciones más desde lo
But really, it is more definitions more from the operational part, from what we think should be done. Not about the priorities, because maybe there can be other more important issues, topics, but possibilities. We believe that the part of information systems, Uruguay may offer um, capabilities or show what it has done. And I think there we have a lot like that could help other countries. And to the estimation of gaps is where we may need more like from the rest of the experiences. That with several countries we have exchange already, Peru, Chile, on these subjects, but I think still we have a long way to go.
Listo, perfecto. Muchas gracias.
Perfect.
Seguiríamos
Thank you
con
very much. And then
Brasil.
we'll go on with Brazil.
Bueno, ¿está? ¿Aló? ¿Está listo? Entonces,
You ready? Okay.
revisamos acá
We prioritize here for information systems
de
a
indicadores.
definition of indicators.
Porque sin la definición no podemos hacer más nada.
Because
Interoperabilidad
in the
también.
definition we can do anything else. Interoperability, two priorities. For governance,
Intersectorialidade, pensando
intersectoriality, thinking on the relationship with ministries of health, education, work, finance,
interfederativo
and also
estado e município,
at a different federal levels, state and municipality, and even tripartite financing to put more effort in the regulation of professional as well as the work and training, so that that way we can better distribute training this with the most cost scope of skills, and related to that, policies and programs of provision, dimensioning, and retention of professionals. We have some of them improved and creating other ones that are necessary for training, thinking long term for all the country. What is the most important leadership strategy for all the states, and to create a critical mass of operationalization of the center of work and education at the country level? For mental health, to invest more and to think on promotion policies, promotion and prevention of risks in the work environment, policies that look inside the work process, and also reinforcement of strategies that at some point got the creation of psychosocial nuclei for reference of workers to have specific spaces for. That's pretty much it. Thank you.
Los dos temas que se
And
trabajarían a
two
nivel
subjects that would
regional y
be
subregional.
worked at a sub-regional level. Governance. Yeah, I don't know. Those two, I guess.
Okay.
Thank you. Because information system governance and training. And here we put mental health and availability. Okay, perfect. Thank you very much.
Bueno, seguiría Perú.
Well, Peru will be next.
Entonces,
So, can you hear? Okay, thank you. In regards to information system, we prioritize 3 points. First,
Los intérpretes, por favor, más rápido. Ya, en el primer punto,
the first point, having the National Registry of the Healthcare
social, salud,
Information Systems, Social Security, and Health in the private sector, which are great options. Then, to accommodate the regulatory frame, if you have a registry system that's very strong, if this is not supported or accompanied by a regulatory frame that gives it governance, we won't progress. And finally, to involve other participants in development of human resources, training units, universities, colleges, national public health care school, to be able to complement information that we may have. In regards to governance, we have prioritized 3 points to strengthen the interinstitutional coordination between Ministry of Education and Ministry of Work. Ministry of Education to try to couple the syllabuses to the needs of the country. As everywhere, we have that in our universities. They train professionals with hospital vision when 80% of care
que se alinee.
is
Y en cuanto al
condensed in the first level of care, and we need that to be aligned. And in regards to Ministry of Work, because pretty much they have the social security, and basically they regulate themselves independently. They're planning independently. They have independent advances, and we cannot get to a consensus between them and us. Then strengthening relationships with stakeholders that represent the private sector, that to be able to align our policies in registry as well as in governance. And finally, to guarantee sustainability of communication strategies and negotiation with local governments and regional governments. We have scenarios that are given basically in regional areas, which are the meetings of ministers with the governors of each of all the country, especially that they're more spaced, which are un- one executives which are with authorities of local governments. So there, here, priorities are established, some agreements are reached upon, but not always they get to a good end. There's not a good follow-up of these issues, and that has to be strengthened. In regards to human resources availability, for us, a priority right now is to consolidate the implementation of healthcare integrated networks and the multidisciplinary centers in health. We're in the process of doing a whole restructuring and reformulation of our logics of a first level of care and the primary healthcare through a model by course of life, which we did not have before, and we're recently implementing it. It's been a year. Reformulated the rural urban marginal healthcare service. As you know, those kinds of services guarantee the availability in the most remote areas, continuity of the services offered, but it doesn't generate a retention, it doesn't generate a rooting What we mentioned in the meeting. It doesn't generate work experience and social services. So, so we have to reformulate an integration and complementarity of the healthcare services among sectors, especially in the first level of care. We have to, and in care it means even the private sector have facilities where some others do not arrive. And the aim is to work in a complementary way to guarantee universal access. And finally, to capitalize the current availability to improve non-economic, non-financial conditions. We're talking about life conditions, quality of life, inputs and equipment to be able to perform in an appropriate way, especially in the first level of care. Now, in regards to, it's the two ideas. So, first one, maybe I want to take advantage. We need a lot of support in mental health. Different from many of you in mental health or human resources, we do not have anything. We have a very strong strategy for population, but towards human resources, literally, we don't have anything, and we want to learn a lot from them. And definitely, the other thing is integrating information systems, not only at the national level, but also at an international level.
Entonces seguiría Chile.
Chile will be next.
Chile.
Chile.
Ya, que aquí lo vamos a hacer ya, para ir rapidito, en uso
Decision making, we prioritize the methodologies and tools of estimation. Nowadays, we're in a process of reform. We're starting, giving the first steps of the reform. And besides this, the universalization of assurance company. Therefore, here, gaps primary care is going to appear, and our methodology is very centered in the hospital. So here we have a great challenge for advancing.
relacionado con lo que planteó
Related to what Claudia proposed in governance, therefore it has all the implications that it's going to have in terms of human resources, not only because of the gap, but also because of all the current regulation. I explained that today in the morning, some of that in the morning. There are some other projects that are going to impact, and therefore we want it to be articulated to the conversation we're having in regards to the reform, where primary care, besides going to be universalization as main pillar. In human resources availability, we have systems we're still missing. We have interoperability challenges of integrating the private sector, but information always comes out from somewhere. We always get it. So where are we nowadays putting the priority in dominating the market study of healthcare information that we just finished? And right now we're gonna start work a labor market study in healthcare. That's gonna be the foundation for us to be able to do the update of the training plan for specialists, physicians, and also
monetarios para los
financial incentives and non-financial incentives for different programs.
en capacitación lo vamos a reducir, o sea, lo vamos a sintetizar
In training,
de,
we
a
will
partir
reduce it. We'll synthesize it into a challenge of starting from defining new priorities to establish a national training plan where there are environments that are already a priority, as the Cancer National Plan, mental health for users as well as for officials. And nowadays, we have great challenge in the training of technicians because the pandemic put evidence the deficit. And I just want to relate that this training plan is one of the agreements that we also have with Ministry of Finance to be able to recover the 1% in regards to compensation salaries. We did an agreement that in order to have this national plan, in the following 3 years, we're going to be budget for that national plan. Mental health, I'm not going to say it because in the morning we presented it, is to strengthen the Saludablemente Funcional program. Okay, environments, governance. Yes, we believe that there, because of what we're implementing, but essentially because what we heard is days of progress in other countries, especially thinking on challenges that we have in making universal primary care and integrating the network of primary care with other levels. to make available our assessment in terms of mental health, make available the Saludablemente Funcional program, but not as a program, but a conversation in terms of mental health related to for officials. Well, we have a lot of methodology for estimating human resources gaps in different environments, and we're also developing an IT plan which is about to come out now, so we also make it available.
Listo. Muchas gracias. Entonces
Okay,
sería
thank you.
Paraguay.
So Paraguay will be next.
Comienza el rally. Bueno, no, en Paraguay lo que identificamos
In
es que
Paraguay, what we identified is that we have an observatory committee board already made up, but it's necessary to be strengthened with a cross-disciplinary team, and also it must strengthen the capability for analysis and use of information, especially when it's referred to first level of care for decision making. We think a module within the observatory can be generated that allows the shared load of data or upload of data, but towards a final product, which will be well the strategic in healthcare, which allows the interoperability of systems. With regards to governance, we are already working in a decentralized
aspectos de
way
los campos de
some
práctica y de
aspects of the practice fields, and we called our uh, references. So that subject that we're working on we may strengthen that work methodology with other subjects which are
los recursos humanos
strategic in the environment of human resources in health, as well as to give a follow-up so that the National Committee for the Policy Implementation complies with activities that were already established by ministerial resolution, and now to start more strongly the articulation with the private sector, subsector of healthcare, but with education we can have certain articulation to the health superintendent.
disponibilidad de recursos humanos a nivel subnacional. Una de las cosas en el conjunto de incentivos es la
One of the
revisión
things in the set of incentives is a review of current incentives for
sobre todo en el
implementing and for empowering, especially in the first level of care, and redefinition around objectives of the APS strategy and of financial availability. Also to perform a market study to identify among different subsectors the differences as salary benefits, the objectives that each subsector has, and to then define packages and incentives, prioritize. And to go on, this is more of the other subject.
lo de la capacitación, operativizar su plan
Training,
nacional de formación,
making operable our national training plan and training to empower the node Paraguay node network made up by the training entities in the part of training to broaden the quantity of um, sites and specialized medical units, and to strengthen it with AREM, with RMF, the law of internships, the catalog of specialties in areas of health, and tele-guidance, training to create an online professor's clinic with the support of an online campus of healthcare, of health of the PAHO. And in mental health,
necesitamos
where was
elaborar un
Peru,
plan nacional de
we
salud
need to draft a national mental health care
el Sistema Nacional
plan
de Salud.
for workers of the national healthcare system. Also, an important point is the one of residents and healthcare workers in the Ministry of Health do not have the support. They're appointed, but there is an insurance. And the measure will be to implement a policy that we're going to elaborate. Uh, okay, the information system, which is of course crucial, and mental health, which pretty much we don't have anything.
Muy bien, Colombia.
Okay, Colombia.
Bueno, entonces,
Okay, so in Colombia, we work several things very quickly for the information system. We have an observatory which currently works and information about location and salary of healthcare human talents. That's how we call it in the regulation. However, it is necessary to recognize and advance in other indicators which not only account for other specificities of human talents, but also in the interoperability with other regional and national systems, which allow us to make discussion of policy and focus of actions in the healthcare human talent. One more element is planning and management of human talent. Currently, we're working with the national guidelines um, um, to the territory, but we're also required to prioritize a study of a labor market, as some of you prioritized, and definition of gaps analysis. In this element, it is also important to work with other sectors as the Ministry of Education, because it's not necessary to plan the work, but also planning education in the country. Here we have governance, which is also an element that has been worked on with other sectors as the Ministry of Education and Ministry of Work. However, it is necessary to design an institutional permanent architecture, which is operating and dialoguing in terms of healthcare, where specific roles are defined for each stakeholder, but also some minimum guidelines to name those needs that we have in human talents. One more element is that we are working in the update of human talent policy in healthcare in Colombia. So it's like another regulation instrument in the government. Additionally, strengthening of capabilities in the territories around the health authority for the planning and management of their human talent according to the territorial specificities. Likewise, the articulation with other stakeholders or actors, trainers, and providers. In the availability of human talent in healthcare component, we are broadening spots of mandatory or compulsory social service, broadening profiles. That means additional professions that so they do not have compulsory social service, but that they can go to rural areas where we have a scarcity of healthcare human talent, along with incentive mechanisms and strategies for retaining that human talent in the territories. The gaps analysis, along with uh, compensation and work conditions with the healthcare human talent. As a second element,
Teniendo claro que
it's
pues en
operating,
Colombia tenemos algunas
giving
experiencias, así
incentive,
como otros países.
having clear that in Colombia we have some experiences as well as other countries. But yes, it is necessary to incorporate it, especially in spread areas and rural areas where we have a shortage of human talent in healthcare currently. Within the training strategies, currently we are working in the massive training strategy in the countryside and the territory in collective healthcare, public healthcare. So they were defining the minimums for syllabus transformations, and in the mental health field, we have a mental health policy for population. However, we must make a dialogue with more emphasis in healthcare, human talent, and incorporating other elements that may help us to the uh, comprehensive healthcare in human talent. Now, two subnational issues here we have a priorities. I'm sorry. One of them is human healthcare, human talent policy in the frame of design, but also taking into account experiences from a region is as a second priority the labor market study, also with that regional assistance. Thank you.
Finalmente, Ecuador.
And finally, Ecuador.
A ver, nosotros, nosotros hemos priorizado nuestro
We have
trabajo
prioritized our work in healthcare career. It's in the regulatory agenda of the presidency within governance, which is going to orchestrate pretty much all other actions. Healthcare career and the human talent policy. This has to be ready for August this year. As well as we're going to be working on that, in parallel, we need the use of data, the establishment of the optimum um, template or and availability of human talent in coordination with what the 10-year plan in healthcare career would be. We're going to work with CONENUS, the Ministry of Public Health as such, and in healthcare career and, and related or attached regulations. This estimate of regulations for planning of human talent, manual of spots, hierarchies, salaries, compensations, remunerations, and other things that are in the attached regulations of the healthcare career network. Human talent policy needs to continue advancing in parallel. It should be before the healthcare career law, but now we need the estimate of everything regarding human talents to be able to know where we are, what we need, what we need to not to produce but to train to be able to walk within the system. And that is how currently we're also reforming one more law, which is the one of compulsory social service. There are several implicit laws in the country's regulation which would have to be modified or amended to be able to change these legal frames. Now, regarding permanent training, we have to talk to universities and universities and the online campus. As a country, we have requested that it's that for all rules, physicians, nurses, dentists, online campus with around 10,000 users a year, and for the implementation of a HARS project, we are working directly with the rural ones and universities so that they get incorporated in the learning system. Now, in regards to incentives, we're also working in the possibility of itinerating rotations within the healthcare system to strengthening skills, special training of physicians, family physicians, strengthening skills, and so that that way they can have a better performance to resolve the 80% of pathologies that should be taken care of in the primary care. Likewise, to work
Referencia que alimentan el sistema. Dentro de las estrategias de capacitación,
reference with the training strategies. What I wanted to convey, what I meant to convey, is that we need
para
help
trabajar
to work in healthcare career. Part of the attached regulations, gaps, manual hierarchies, categorizations, incentives, and working in the human talent policy, which goes along with the healthcare career. That's not the end and the purpose of the human talent policy, but that's going to support a lot to look for the well-being of those who take care of patients as well as population in general. So we need a lot of support from Bajo. Really, they're supporting us a lot. Not with information and primary care technicians or training of primary care technicians. Brazil is also supporting us through the mm, articulation with Pajo. We have conviction that among, do not hesitate that I'm gonna look for at some point. I'm gonna look for you. I'm gonna contact you because it is necessary, obviously, to go hand in hand. We have a lot of needs. Very briefly, because I think it's here and it could be of interest for other countries. So highlight in the case of Ecuador that in the part of training and strengthening of human resources at a territorial level, the country made a decision which really is worth highlighting. And it is that Ecuador is one of most successful countries and region in the implementation of a HERTZ program, which is a program of cardiovascular disease prevention. What the ministry has done, given a success, and that there is already an installed capacity within the ministry, guaranteeing medications and guaranteeing training, is that that program, which is vertical, and as also Alicia said, they're being trained not in a vertical way, but horizontal human resources, so that you can continue with the implementation of a program.
Excelente.
Excellent. Bueno, Paola, any reflection before we go to the other room? Okay, let's go then to
Diana se llevar todos esos papeles. Estaba invitando a alguien a mi habitación, pero no entendió. No entendió la persona.
no, eso es para guardarlo. Este es para llevarlo y este me lo tomo. Ujú.
Ya. Bueno. Ya estamos llegando al final.
Getting to the end.
Sí, se escuchaba todo, era espectacular. ¿Se escucha?
Yo pensé que estaban ordenando tazas y platos. Ah.
¿Cuál es el proceso? Ya lo dijiste, pero dilo otra vez, que tú vas a sistematizar, que gracias por la presentación lo das. Tú cierras, le das un brazo a dónde están los otros libros, porque Pascal tiene una buena idea y es a los que priorizar como Chile.
Se los robaron todos.
Deberían.
Los dejé ahí y desaparecieron. Te prometo. Sí, que los fueron robando. Después vamos a preguntar quiénes se quedaron sin libros para ver a quién se lo damos.
Bueno, para cerrar el
To
ejercicio.
close this exercise, it's just remember the information that we have in the dashboards will be systematized completely, emphasizing what you had prioritized, and finally generating the common lines that identified in the countries that should be regional. This will be the report of the event that will include the 10 countries, and that is the proposal, a draft proposal of a roadmap that we will send to you so you could validate that as feedback of that we can what was lacking and publish the report of the event. Thank you for your participation. It was a very interesting exercise and very building. We're gonna applause to Diana. She is not not only now, but for over 2 years. She's been working on this with a lot of dedication and effort, and very good products. Emiliano, you wanted to say something before we close? We just want to share quickly. We shared at the midday. There's a lot of experiences and documents and trajectories that weren't shown here, but that you have them, the healthcare career, etc. And I wanted to ask you at the at the FAO, have you thought of to reorganize this information or do it in some way? I would volunteer to collaborate in helping you, and there are all furthermore ways, but I imagine that there are places that double entry that certain country has some information, and you could consult that in categories and dimensions. I would like to know this or this about certain countries and have it someplace, because sometimes it's difficult to access that information. We didn't know this. We didn't know there was a law for uh, sanitary or healthcare career. So I'm thinking about an Excel or something like that. But I volunteer to do the first step to organize the information. Mario, please. Exactly, that's what I was mentioning after the comment of Adiela. Here at OPS, we have the methodology, the practice community. So part of the roadmap would be that that the topics that were prioritized, we could use them in practice communities. This implies doing, uh, taking on the resources that could be useful for the work of the community, and also establish some other components of like a forum where we discuss in real time the problems and solutions. For example, in adaptation methodologies, in gap methodologies. And this has a repository, and it has the possibilities of identifying um, knowledge gaps, and it could be systematized for someone. So this would be interesting for everybody, or for all the common interests. And we can also can work in collaborative networks and define the joint work and the tasks according to the strengths of each country. The possibilities are much, and we take this as part of the discussion. What Benjamin said, that how we need to strengthen the unity for the countries. Thank you, Mario. Deborah? Shanko? We have a Shanko. She's talking about the pronunciation of Shanko. Well, okay. Simply just to thank you for the space. We haven't done this for a long time, and this is the first meeting, at least for us, that we will meet again, and we put 3 or 4 human axes and acknowledge ourselves. Who are we? Who are the new faces? And above all, I want to the pertinence of I have chosen the working force, the working label, as a central axis of discussion. Although this is a very specific work and requires a specific work from the WHO. No topic of human resources is outside. They're all interconnected. This will allow to make other promise, and this is a topic that hasn't been worked much by us. So thank you very much.
Bueno, estamos cerrando.
For the proposal. So we are closing And as Deborah said, this is the work that we've been doing for a long time, for more than 2 years with the PEJO. So for now, I would like to thank you, the WHO and Paula for and also and give a word to Pascal for your last comments. Right now, Cons- always with the microphones. Gracias. Para mí ha sido un gran placer haber estado aquí el primer día. Estoy muy contento y hoy estoy más contento después de estos 2 días. Eh, Fue una gran discusiones, toda la información que se trabajó fue muy interesante, aprendí mucho y estoy orgulloso de todo el trabajo que han hecho ustedes y creo que esta es una oportunidad única en términos de intercambiar, el intercambio de todas las discusiones y de las condiciones fueron algo de que todos aprendimos del uno del otro, de la experiencia de los otros, de la OMS y esta es la mejor manera de progresar, de avanzar, de cómo se enfrenta la situación y cómo se cambian las situaciones, se intercambian las situaciones y ahora estamos creando un momento para ir hacia adelante. Gracias por todo el trabajo que se ha hecho con el trabajo de COVID y creo que necesitamos pensar cuál será el siguiente paso para seguir con el momento. Es importante concluir cuáles son las probabilidades, las prioridades y cuál es los siguientes pasos y continuar con el intercambio que queremos sintetizar en estas discusiones y refinar inclusive un poquito más para ver qué tipo de soporte, de apoyo necesitan ustedes from Pejo y realmente para volver a reunirse nuevamente y para discutir más detalles y luego para tener un periodo de línea para las actividades. Pero hay un maestro de decisiones para esto, pero sería bueno tener otra reunión. Pero si se hace una en base regular, sería interesante. Pero nuevamente Hernán es el maestro de ceremonias. Muchas gracias a todos. Thank you, Pascal. There's no doubt there'll be another meeting in a couple of months. Or maybe we don't know when, but there will be another. And I hope you'll be here. We could also convene in Geneva. It's a good option. Juana Paola, you take the floor. Thank you. Yes, you hear me? Everything has been said. I just want to thank you for all the work that has been done. It's very good to have been knowing you in person. Thank you for the great work and you're an example of the region at the world level. And welcome to the new countries. I'm very happy to see you and see the enthusiasm and how we exchange experiences, knowledges, and new techniques. And here we are. Thank you very much. Thank you, Hernan, Diana, for all the support. And we'll continue here. We will continue. Thank you very much. There's a sentence that when we went out the university, when got out and we came back, as we said in yesterday, it happens the same with this community of human resources. Let's continue to work. This re-encounter has been very valuable. The colleagues from the WHO are impacted by the capacity, the reflection capacity and exchange that we have here in South America. many experiences to talk about, to share. There's very generosity where we lack have scarcities and where we can support other people. This is the first conclusion. All the countries, South American countries, have been here, from except from those that are from the Caribbean region. And I also want to thank the uh, colleagues of the PEJO in the country, and because this work wouldn't have been possible without the support of them. Each of the country in country PEJO has given the support and the access to different people for the ministries, and the role they play is always relevant in the company that they are doing in this meeting. So it is very important. So thank you for thank you for each one of you, and thank you for being here to maintain this process. Above all, because if you don't know, they are in charge of many other things, especially one that I'm looking at that doesn't have to do with health care, but with other 300 things. So also thank you very much for that support. And thank you Colombia for having received it, and 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 uh, and thank you for the success and the success you will continue to have. And all the region is looking at you, and we have to wish you the best of luck in this process. And also for the Andean organization, healthcare organization, and we will want to continue to work with you in integration mechanisms. Well, I want to thank Selenia. She has been very important, and then all this can be organized. The Pajo, Colombia, the the, the microphone manufacturer, but yes, at the Wi-Fi and the patience for the interpreters. Well, most of all for Francisco, the guy from Peru. And the desire of coming, uh, always meeting in as in a country as interesting, a city as interesting as in Colombia, as in Bogota. And for the ones that are staying, there are several tickets to go to the Salt Cathedral. She is promoting this. This is a very interesting people that are staying here, but the people that are leaving are not going to be part of this. Adilma wants to take the floor. Just we want to thank because you have come to Colombia. You're welcome to return and are adopted, nationalized Colombians. It's very good that this re-encounter was done here in Colombia, and as Hernan says, it's good that we could return, have other meetings in other countries. And this sharing has been very. We appreciate this very much. Being together after the pandemic, so we could recognize and acknowledge ourselves, and not only virtually. This has been very important. And the other, and for the work that we have started here in the country, every experience is very important. We have learned, and uh, and hopefully we can exchange and share with you all the progress and that have been doing, and that we have been working on the reform, in the change in the model, and a new focus for the formation, training, new regional work, and in governance, etc. We know we have your support, and we are very appreciative and welcome back whenever you want to come to Colombia at the Ministry of Health and Social Protection. We are at your orders, and thank you very much. Thank you, Adilma. for the test that we will summon you will be the last monitoring the action plan for human resources for the final report for 2023 that will present it to the heads and there would a document of policies for 2024 that will be a continue of the plan. And obviously also there is a profound interest to deepen more in labor market and especially and this space will be taken advantage to of this work and taking advantage of the work of the people that are here will take advantage of what you want. So Julio, what do you want to say? So motivated by the excellent organization and Colombia for being the host of this re-encounter. We are at Pejo, Bolivia, doing a decentralized, and one of the new sources is Department Chuquisaca, and they have wanted to be the host country, and then they want us to go there for the Parliament of UNASUR. So this would be an event that you need to consult it and do all the agreements. The event would be the bicentenary of the independence of Bolivia. With so I hope we can. So we'll be seeing the confirmation and the availability. Just to close this accord of Chuquisaca, we'll take it very seriously. We have these tasks that we'll be in touch. We'll continue to be in touch with the new partners and the 10 countries of South America. And surely there will be a space for Andean re-encounter, healthcare re-encounter. We'll be in touch. Thank you for your participation, your enthusiasm, your collaboration, support, and applause for yourselves. A good travel and conquer Bogota. Thank you very much. Thank you very much and goodbye. Tomorrow for the Salt Cathedral, they sell emeralds if you are interested, and it's a nice, very nice experience.